Good morning. The Committee of Health, Hospitals, and Human Services is hereby called to order. Good morning. Today, the Health, Hospitals, and Human Services Committee is convened to receive updates from the leadership of the territory's hospitals on the state of our hospitals and healthcare. We will also hear from the chair of the territorial board on their oversight role and status of our disaster-related projects. We may not be in a declared state of emergency, but there is an urgency to ensure that our hospitals can meet the needs of our community. St. Croix residents have endured setback after setback in the opening of the JFL North. They have heard of in some cases, experienced poor service that doesn't represent the quality of care that our medical practitioners can provide. The negatives about our healthcare system are certainly drowning out the positives. We're not here today to beat up on our hospital leadership or on our healthcare workers. From the doctors and nurses to the janitors who have been on the front lines in the hurricanes and throughout this COVID-19 pandemic, I want to thank all of you for your service and your commitment to our hospitals and quality care. But the fact remains that the community is frustrated and deserves answers. Although our hospitals are at the front line of today's discussion, the committee will also receive an update from the Department of Human Services and consider Bill number 34-0055, which seeks to establish the Responsible Fatherhood Act. Monday will be Martin Luther King's Day, and it will be a holiday in the Virgin Islands. Again, we want to pay homage to that great leader. We also have started schools on January 10th, and we want to welcome all of our students back to school, albeit virtually at this time. And we're hoping that you're settling in and certainly, again, prepare for that learning experience and learning environment. I want to ask our students to make sure that you're paying attention, turning on your devices when you need to turn on, because there is a great opportunity for us to be able to make sure that our students are educated. We look forward to their full return to school in the near future, hopefully by January 24th, as the governor has indicated, and we will hope that there's no further delay. We have also seen the levels of COVID in the community, certainly as a result of Omicron, and we see that there is at least some leveling off that's occurring right now, and the numbers are starting to go down. So we're going to continue to strongly encourage our community to get vaccinated and get your booster, but at the very least, continue to practice safe social distancing, wear your mask when out in public, and wash your hands as frequently as possible. Again, those individuals that have tested positive need to quarantine and stay home, and let's try to minimize this spread. Again, those of you that will not require the use of the emergency room, emergency division, please take heed, and you'll hear some of that given today from our healthcare professionals. Please don't overburden them, and certainly make sure that you're heeding the warning to at least stay at home if you're experiencing symptoms. Make a phone call if necessary, but don't continue to expose, especially our healthcare workers that we so urgently need at this time. Don't continue to expose them to this COVID pandemic situation. At this time, I'll ask the Madam Clerk to read the agenda into the record and also to advise my colleagues and also those that may be participating virtually to please turn your phone on mute or off, turn your volume down, and as not to interrupt the proceedings, as well as to turn your device on mute at this time until you're called upon. Madam Clerk, please read today's agenda into the record. Madam Clerk?
Madam Clerk. The committee, hear me? 1, 2, 3, 4.
The Committee on Health, Hospitals, and Human Services has scheduled a hearing on Friday, January 14th, 2022 at 10 a.m. in the Fritz E. Loretz Legislative Conference Room on St. Croix to receive testimony on Bill number 34-055, overviews on the operations, infrastructure, staffing levels, status of the intensive care units, surgical suites, and patient discharge policies at the Governor Wang F. Louis Hospital and Medical Center and the Schneider Regional Medical Center. The committee will also receive an overview of the territory's hospitals to include operations, infrastructure, and disaster recovery projects. The committee will also receive an overview of the VI Department of Human Services to include programs and senior homes. Block 1, Bill number 34-0055, an act amending Title 34, Virgin Islands Code, by adding a new Chapter 4 to be known as the Responsible Fatherhood Act of 2021, sponsored by Senator Milton E. Potter. Invited testifiers, the Honorable Kimberly Kazi Gomez, Commissioner, VI Department of Human Services. Kaki Barrett, MHDL CATP, Child and Youth Therapist Family Resource Center, Inc. Mr. Carlton Stevens, CEO and founder, The Mission Project. Mr. Abdul Ali, Secretary, Men's Coalition of the Virgin Islands and community activist. Terrence D. Joseph, MPH, IVD Director, VI Department of Justice, Paternity and Child Support Division. Block 2, overview of the Governor Wang F. Louis Hospital and Medical Center. Invited testifier, Mr. Doug Koch, Chief Executive Officer, the Governor Wang F. Louis Hospital and Medical Center. Overview of the Schneider Regional Medical Center. Invited testifier, Tina Commission, Esquire, MPA. Interim Chief Executive Officer, Schneider Regional Medical Center. Overview of the territory's hospitals to include operations, infrastructure, and disaster recovery projects. Invited testifier, Mr. Christopher E. Finch, Chairman, Board of Directors, Virgin Islands Government Health and Hospital Facilities Corporation. Block 3, overview of the VI Department of Human Services. Invited testifier, the Honorable Kimberly Kazi Gomez, Commissioner, VI Department of Human Services.
Thank you very much.
Thank you very much.
Madam Clerk, for the reading of today's agenda. At this time, we'd like to advise the hospitals, and we know that you're anxious to give your side of the story. However, again, we will be addressing block number 1, which is Bill 34-0055 in this particular block, and you could you turn your devices off and come back on at least about 11:30. So thank you for being on, and certainly we'll see you at 11:30. We know that you have tons of things that you could get done during this time, and certainly want to respect your time. Madam Clerk, please do the roll call.
Senator Marvin A. Blyden. Senator Blyden, Absent. Senator Samuel Carrion.
Present. Present.
Senator Carrion, present. Senator Kenneth L. Gittins.
Here.
Senator Gittins, present. Senator Alma Francis Heiliger.
Present.
Senator Francis Heiliger, present. Senator Janelle K. Soro. Senator Soro, absent. Senator Kurt A. Violet. Senator Violet, absent. Senator Novell E. Francis Jr.
I'm here.
Senator Francis Jr., present. Mr. Chair, you have 4 members present, 3 members absent.
Very well. Thank you very much, Madam Clerk. Any correspondence to be read into the record at this time?
Yes, Mr. Chairman.
You may proceed.
The Honorable Novell E. Francis Jr., 34th Legislature of the Virgin Islands, 3022 Estate Golden Rock, Christiansted, St. Croix, VI, 00820. Dear Chairman Francis, this letter serves to inform you that due to an unforeseen and unfortunate obligation, I will be tardy to the Committee on Health, Hospitals, and Human Services meeting scheduled for Friday, January 14th, 2022 in the Fritz E. Loretz Conference Room in St. Croix. Every effort will be made to get there as soon as possible to participate in the discussion. Thank you in advance for your understanding. Respectfully submitted, Janelle K. Soro.
Thank you very much, Madam Clerk. Please mark Senator Soro as excused and tardy. We'll recognize her as soon as she gets here. We also want to recognize the presence of Senator Franklin D. Johnson. Good morning, Senator. Welcome. Very well. At this time, we'll take a 2-minute recess, and when we come back, again, we'll recognize the sponsor of Bill number 34-0055. The Committee of Health, Hospital, and Human Services stands at recess. We're out of recess again. To members that's just joining us, this is the Committee of Health, Hospital, and Human Services, and we want to take this opportunity to say Happy New Year to all those individuals that's now tuned in and viewing and listening to the 34th Legislature of the Virgin Islands. We're in block number 1, Bill number 34-0055, an act amending Title 34 Virgin Islands Code by adding a new Chapter 4 to be known as the Responsible Fatherhood Act of 2021, and this bill has been sponsored by Senator Milton E. Potter. There is several invited testifiers, and I'd just like to go to recognize them at this time and make sure that their devices are functional. First of all, we'll go to the representative of the Commissioner of the Virgin Islands Department of Human Services. Deputy Commissioner? Assistant Commissioner.
Good morning, Nicole Reimer, and I'm here with the Human Services Department on behalf of Commissioner Kazi Gomez, and I serve as Assistant Commissioner.
Good morning, Assistant Commissioner. Welcome. Thank you. The Family Resource Center, Kari Barrett.
Good morning.
Very well. Thank you. Welcome. We'll also go to the Mission Project, the CEO and founder, Mr. Carlton Stevens.
Good morning, Senator.
Good morning. Welcome. And we know that we received a letter from Mr. Abdul Ali, who is the Secretary, Men's Coalition of the Virgin Islands, a community activist, and at the appropriate time that his testimony be read into the record. We also want to go to the Director of the Virgin Islands Department of Justice, Paternity, and Child Support, Terrence D. Joseph. Good morning.
Good morning, Senator.
Morning. Good to see you, and thank you for joining us. Any other individuals that will be testifying? And Bill 34-0055 that I failed to recognize? Very well. Who speaks to this bill?
I do, Mr. Chair.
Very well. Senator Potter, you're recognized for presentation of Bill number 34-0055. You can sit.
Oh, okay, awesome. Thank you very much, Mr. Chair. Good morning, colleagues. Good morning, testifiers. Good morning to people of the Virgin Islands. Good morning to our hardworking central staff. Colleagues, I ask for your support of Bill number 34-0055, Responsible Fatherhood Act of 2021. We're going to change it to 2022. The bill creates the Council on Responsible Fatherhood within the Department of Justice. We submitted an amendment to reflect this change from the Department of Human Services to the Department of Justice after extensive engagement with a working group that we put together, a working group of professionals. All of them are included right now, are here before us testifying in support of the bill. The council will be responsible for increasing the awareness and involvement of fathers in the lives of their children and families. Colleagues, all of the experts agree that children with fathers who are engaged in their lives do better, plain and simple. They develop healthier relationships. They're less likely to have emotional or physical problems. Children who have a strong relationship with their fathers are less likely to use drugs or exhibit violent or antisocial behaviors. They do better academically and are more likely to graduate from high school, pursue higher education, and be successful in their line of employment. Providing support to fathers is the single greatest thing that we can do for this community. Judges, attorneys, probation officers, police officers, correction officers will tell you that most of the young people, most of the young men that they encounter in their day-to-day jobs come from households where fathers are minimally engaged or not engaged at all. We've structured our public assistance program to focus on helping single mothers rise from poverty, but we've overlooked the need to support the positive role of fathers, not only for the impact they have on their children's lives, but for the entire family to succeed. Act number 34-0055 is an attempt to shine a bright light on fatherhood in the territory. Much of what we're seeing today on the streets that look like crime is a manifestation of our families in crisis, often because of absent fathers. This initiative will establish an entity whose sole creation will be to support and educate the populace, to educate fathers with a view towards restoring the Virgin Islands family. A number of states on the mainland have developed similar programs. And colleagues, I ask you for support of this very important initiative. Just late last year, I had the privilege of being invited to speak before the VI Access and Visitation programs, Fatherhood Buzz graduation ceremonies sponsored by the Department of Justice. Sharon McDonnell was I think the executive director of that program, and Carlton Stevens really is a key person with respect to implementing the counseling component of the program. And if I can share with you the emotions that were on display that evening. It was a graduation. It's a program designed to provide support, education to fathers. And those fathers, I think it was 4 of them at the time, they were blue-collar guys, came in their T-shirts and boots and hard hats, but they were not going to miss that opportunity to receive their graduation certificate from that program. It was emotional, tears were shed, but I think this is an example of what we can do to connect with fathers in our community, to provide them with the support and engagement. Ultimately, if we restore fathers, we're going to restore the Virgin Islands family, and I think this bill is an attempt to address a critical need, a critical void in our community, and at the appropriate time, my colleagues, I would ask you for your support of this very important legislation. Thank you very much, Mr. Chair.
Thank you very much, Senator Potter, for that excellent presentation on Bill 34-0055. At this time, we'll go to the testifiers, and of course, we'll start off with Assistant Commissioner Michael Reimer Brown for her testimony. Then we'll go to Ms. Barrett. We'll go then to Stevens, and then to Terrence Joseph. Assistant Commissioner, you're recognized for your testimony.
Good morning, Honorable Senator Novell E. Francis, Jr., Chair of the Health, Hospitals, and Human Services Committee, committee members, other senators present, and the listening and viewing audience. Thank you so much for the invitation to testify before you today on Bill number 34-0055, an act amending Title 34 VI Code by adding a Chapter 4 to be known as the Responsible Fatherhood Act of 2021, proposed by Honorable Senator Milton E. Potter, dated April 30th, 2021. Additionally, a revised version of the bill was presented, which includes amendment number 34-286 and amendment number 34-394. I am Michael Reimer Brown, Assistant Commissioner, representing Kimberly Causey Gomez, Commissioner of the Department of Human Services. Commissioner Causey Gomez and Assistant Commissioner Caller Benjamin are attending funerals this morning for one of our beloved Youth Rehabilitation Center team members and for the child of one of our team members. Our sincerest condolences go out to the families, friends, loved ones, and colleagues. I have members of our VIDHS team with me to answer questions pertaining to our current initiatives, and they are Ms. Natalie Bailey, Administrator of the Division of Family Assistance, and Sarah Burke, our TANF Jobs Director. Fathers are important to children's well-being. Sensitive, supportive, involved fathers contribute to children's physical, cognitive, emotional, and social adjustment. Children with involved, loving fathers are significantly more likely to do well in school, have healthy self-esteem, and exhibit empathy and pro-social behavior compared to children who have uninvolved fathers. Additionally, more engaged fathers, whether living with or apart from their children, can help foster a child's healthy physical, emotional, and social development. The VI Department of Human Services believes the amended version of Bill number 34-0055 highlights the government of the Virgin Islands' commitment to the promotion and support of responsible fatherhood in our territory. It should be noted that funded federal responsible fatherhood programs began with the 106th United States Congress, and with each subsequent Congress, responsible fatherhood programs have received both presidential and congressional attention. Federal financial assistance to the territory is in line with research and census data. U.S. Virgin Islands 2019 Family Structure Profile. According to the Kids Count USVI 2019 data book published by the Community Foundation of the Virgin Islands, 58% of children under 18 live in single-parent, female-headed household compared to the national average of 23%. I'm going to read that again. 58% of children under 18 live in single-parent, female-headed households compared to the national average of 23%. 10% of children live in single-parent, male-headed households. Only 23% of Virgin Islands children live in a home with two parents who are married, compared to 66% of children in the United States. The USVI 2019 Kids Count data also reported that approximately 30% of VI children live in homes with incomes below the U.S. federal poverty guidelines. Mississippi is the only state with more children living in poverty, 32%, than the U.S. Virgin Islands. Kindly noting the Kids Count USVI 2021 data book was recently published by the St. Croix Foundation and focused on female-headed households in public housing and not the general territory's population, among many other aspects of the Virgin Islands. VIDHS collaboration with federal government fatherhood programs. Many federal agencies have responsible fatherhood initiatives and programs. The Federal Interagency Working Group on Responsible Fatherhood brought together federal agencies to coordinate department efforts that support and encourage responsible fatherhood and father engagement in their children's lives. The U.S. Department of Health and Human Services Administration for Children and Family funds organizations, nonprofit agencies, as well as governmental entities to provide responsible fatherhood activities that strengthen positive father-child engagement, improve employment and economic mobility opportunities, foster responsible parenting, and build healthy relationships, including couple and co-parenting and marriage. The VI Department of Human Services is the identified grantee of several federal ACF grants, which have specific guidelines, which also incorporate the promotion of responsible fatherhood and positive family engagement into our local programs. VIDHS Office of Head Start. The Health and Human Services ACF Office of Head Start encourages Head Start programs to engage fathers in their children's growth and development. Father engagement is a vital and integrated aspect of parent, family, and community engagement work. Both Head Start and Early Head Start staff engage fathers as advocates, lifelong educators, and first teachers of their children. Male family members and father figures serve key roles in the healthy development of their children and families and have much to add to their Head Start communities. The VIDHS Head Start program understands the value of fatherhood and has implemented creative and successful ways of engaging fathers for nearly a decade. Prior to the pandemic, one of the more popular territory-wide fatherhood activities took place at the start of each Head Start school year, when fathers were designated to bring their children to school on the first day of school. This activity not only engaged fathers and father figures, but it encouraged the participation of fathers in their children's Head Start experience from day one. During the Head Start school year, in addition to attempts to keep fathers up to date about their child's Head Start experience, the program included fatherhood-focused events. In the St. Croix district, there was an annual Date with a Dad, which was a day-long event with father-child activity as the focal point. In the St. Thomas St. John district, a similar event called a Father-Child Activity Day took place annually. A picture day with fathers was another much anticipated annual activity. Pictures taken of fathers and children were posted in classrooms for the rest of the school year. Fathers are encouraged to become a part of the program's Policy Council, a governance body composed of parents of Head Start children. The Head Start program continues to develop activities to include fathers in the Head Start experience and will resume the referenced in-person events when the pandemic allows us to safely do so. The VIDHS Division of Family Assistance. The HHS ACF Office of Family Assistance, which funds the Temporary Assistance to Needy Families, or TANF, and other similar cash assistance programs, funds 58 organizations across the United States to provide responsible fatherhood services. The Office of Family Assistance promotes and supports programs which help fathers to be responsible parents. Consequently, OFA encourages coordination with existing employment services such as welfare to work programs and referrals to local employment training initiatives to help fathers improve their economic stability. Under the DHS umbrella of services, the Division of Family Assistance, TANF program, provides the territory with the flexibility in operating programs designed to help low-income families with children achieve economic self-sufficiency. States use TANF funds to fund monthly cash assistance payments to low-income families with children, as well as a wide range of services. DHS has in the past decade, used allowable TANF federal funds to assist in promoting responsible fatherhood in the Virgin Islands. It should be noted, the use of these federal funds is not restricted to impact only TANF-eligible clients. In line with the 4 purposes of TANF, which include the reduction and prevention of generational dependency on public assistance and promotion of healthy families, DHS will continue to support responsible fatherhood and healthy families initiative. The TANF program will be collaborating with the Paternity and Child Support Division to support the Fatherhood Initiative by assisting in making referrals to the Father Buzz program currently being implemented by the VI Department of Justice. We will also be providing fathers at no cost job readiness virtual workshops to enhance the skills of participants. This will be achieved by rendering an 8-week virtual training program for fathers to include topics such as overcoming barriers, career inventory and interest, interview skills, interview follow-up, effective job search, and job retention. We will lend support by such opportunities through our jobs programs to increase employability skills and assist fathers move towards self-sufficiency. Although there are federal dollars which can assist with the Virgin Islands with our responsible fatherhood programs, it is also prudent for us to invest local funding to support these programs to enhance the outcomes. Consequently, we strongly urge that Bill number 34005 include a provision for the establishment of the annual appropriation for the activities included in the bill, because many federal programs require a local match or maintenance of effort on the part of states and territories, and we see that this has been included in the bill. After review, here are our recommendations. Having reviewed both the amended bill number 34055 and amendments provided, the department concurs with the change in the number of members of the council from 10 to 11. The department recommends that the last sentence of Section 73, membership of the council, be amended by striking the word 5 and inserting instead the word 6 as the number of members required for a quorum. Having reviewed amendment number 34394 and amendment number 34286, VIDHS appreciates that this bill's sponsor, Senator Milton Potter, has taken the department's concerns about these proposed new responsibilities assigned to the VIDHS, considering the department's already vast portfolio of programs, when another agency, specifically the Department of Justice, Division of Paternity and Child Support, already spearheads fatherhood efforts in the territory. The amendment replaces the Commissioner of the Department of Human Services with the Director of the Division of Paternity and Child Support within the Department of Justice as the person who administers the Responsible Fathers Fund and as the person who authorizes the Commissioner of Finance to disperse the Responsible Fathers Funds for the activities of the Council. The Department of Human Services is in support of the Council on Responsible Fatherhood as amended to be composed under the Department of Justice, Paternity and Child Support Division, ensuring specified funding for budget line item is identified, administrative support provided, and a designated space for the Council is to be created as stated, as this would create a successful model. In conclusion, in supporting this bill, VIDHS in no way wishes to negate the existence, circumstances, and importance of other family structures, such as fathers who are raising children without the mother's involvement, families with two mothers, adoptive single parents, or other parents where there's no legal father. That said, we recognize the value that a father or a father figure may have on a child. Although the premise of the bill is on the right track, it does not necessarily fit in DHS as a holistic preventative effort supporting all fathers, but we strongly support the Department of Justice spearheading this effort, and we will definitely continue to support. From a DHS perspective, DHS, we are in currently reassessing our TANF state plan in relation to the option of providing financial assistance, employment training, and healthy family activities to eligible two-parent families who meet the income eligibility and other TANF program requirements. The bill refers, as we've said before, to an appropriation for implementation and sets up a separate section for the creation of a fund. And we know that unless there's an appropriation in this bill, it becomes an unfunded mandate. So we strongly support that addition. I sincerely applaud the notion of fully supporting families and providing preventative program to ensure our children are set up for success. Chairman Francis, in conclusion, I would like to personally thank our VI Department of Human Services team of professionals who have been on the front lines providing direct services to our Virgin Islands community throughout the COVID-19 pandemic. The continued support of Governor Albert Ryan Jr. and Lieutenant Governor Tregenza Francis, totally appreciated, as DHS continues to be committed to working together to make a difference for the people of the Virgin Islands. Thank you, and we are available for any questions.
Thank you very much, Assistant Commissioner Reimer Brown. And next we'll go to Ms. Barrett. You're recognized for your testimony.
Good morning. Good morning, Chairman Francis, Senator Potter, other members of the Committee of Health, Hospitals, and Human Services of the 34th Legislature, staff, other testifiers, and viewing and listening audience. Thank you for this opportunity to appear before you. My name is Kaki Barrett. I am the Child and Youth Therapist at Family Resource Center, as well as the co-facilitator of our parenting support groups. And it is my honor to be here representing my agency in support of Bill number 34-0055, an act amending Title 34 Virgin Islands Code by adding a chapter known as the Responsible Fatherhood Act. Family Resource Center is a nonprofit agency helping victims of domestic violence, child abuse, sexual assault and rape, human trafficking, and other violent crimes. We also offer services for family members, all at no cost to our clients. Other wraparound support includes court and victim advocacy, emergency shelter, and outreach programs to businesses, schools, and community organizations. In addition to our victim services, we offer also psychoeducational support groups to perpetrators of child abuse and domestic violence. This is not my first time in front of you supporting policy changes that encourage the positive well-being of children and their families, and I feel privileged to have yet another chance to advocate for their welfare. Children are our most precious resource, and so to protect them, we must support and advocate for those who have the greatest influence on their development. There is no harder job in the world than parenting. Even with the best intentions and skills, the day-to-day tasks involved in raising children can be emotionally, physically, and financially draining on parental resources. When circumstances are not optimal, children suffer. Non-custodial parents, especially dads, face even more barriers to positive interactions with their children, as is evident sometimes in our pop culture, social stereotypes, and even government policies that seem to place little value on the role of fathers. Dads, especially the non-custodial ones, are often thought as just an extra set of hands and another babysitter. However, research demonstrates repeatedly how critical a father's engagement is on their child's emotional and academic development. Involved fatherhood is linked to better incomes on nearly every measure of a child's well-being, from cognitive development and educational achievement to self-esteem and pro-social behavior. Children who grow up with involved fathers are 39% more likely to earn all A's in school, 45% less likely to repeat a grade, and 80% less likely to spend time in jail or in the judicial system. Fathers bring a unique perspective to child rearing, to dealing with life in general, and their steady involvement is linked with more positive behaviors in their children. Common challenges and issues that hinder consistent positive involvement are substantial and are often a factor to lower levels of connection with their children and lower quality co-parenting relationships with the mothers. These barriers do include unemployment or underemployment, a history of substance abuse, domestic violence, or mental illness, a poor relationship with their with the mother of their child, a lack of housing, reliable transportation, and other basic resources. The obstacles non-custodial fathers confront seem to be so unsurmountable and overwhelming, many give up and walk away. Public education is critical, but should not be confined to information about the importance of fathers and the problems created by their absence, but also about those barriers to that involvement and how to overcome them. The Responsible Fatherhood Act is a great step towards eliminating complications that impede a non-custodial parent's positive participation in their children's lives. That is because one of the best ways to attack many of the problems facing children and families today is to encourage that healthy father-child relationship. This bill, proposing a dedicated commission to promote the role of father in a child's life, serves to recognize that dads have an important responsibility in the development of a child's welfare. Its goal to strengthen the father-child engagement, to help parents face the challenges that prevent them from becoming effective, nurturing parents is based in the fact that responsible fathers are crucial. The Responsible Fatherhood Act is essential to addressing the issues of child poverty by supporting and advocating for fathers to increase the quality engagement with their children. Family-focused initiatives often integrate economic stability services such as career advancement education, on-the-job training. A father's economic contribution to the family is certainly an influential factor in responsible parenting, and there are many ways to help with financial viability. But the irreplaceable role of fathers in their child's life goes well beyond income security. Children who have a high-quality relationship with their father are twice as likely to go to college and 75% less likely to become a teen parent. Skill-based programs specifically designed for fathers, such as the one hosted by the Department of Justice Paternity and Child Support Office, which teach child development, coping skills, and positive discipline, go a long way to promoting positive father-child relationships while giving them the tools to be appropriate role models. Psychoeducational and support groups offer men shared experiences and guidance, networking opportunities, and encouragement for the difficult role of parenting, which in turn fosters their commitment to their parenting responsibilities. Another significant factor often overlooked is the quality of the father's relationship with the mother. A substantial amount of research supports the theory that when parents get along, both the quantity and quality of father involvement are higher. Research also shows that even when parents don't live together and are not in a romantic relationship, their ability to cooperate and engage in positive co-parenting has a strong influence on parent involvement. When parents have an amicable, stable relationships, fathers are much more likely to stay involved in their child's upbringing. Research has shown that a positive, secure, co-parenting relationship significantly improves the emotional and academic development of the child. It is difficult sometimes to have and maintain a healthy co-parenting relationship, but it is worth it. Learning how to navigate that co-parenting relationship and move past individual differences to create an environment that helps their children thrive is essential in keeping fathers engaged. When a co-parenting relationship works well, fathers remain involved, which helps children feel stable, secure, and adored. Programs and services designed to support fathers need to include developing effective co-parenting skills, which may include encouraging adults to put their children first, treat the co-parent with respect, keeping communication lines open, and welcoming these parent-child interactions with each other. In order to have an effective co-parenting relationships, parents must learn to cooperate, compromise as it pertains to the other parent. However, this can be challenging when coordinating changing family dynamics, including relationships among former spouses, new partners, extended family members. At the Family Court's direction, Family Resource Center has provided co-parenting counseling. Excuse me. We have provided co-parent counseling by working with parents to work through grievances and encouraging the development of co-parenting teams. Two people who support and communicate with one another for their child's well-being. And through this service, we have witnessed the positive influence this has had on the children's behavior at school and at home. The purpose of the Responsible Fatherhood Act is to increase and support a father's ability to meet financial, emotional, medical, and educational needs of their children, and to promote positive interactions with the ultimate goal of improving the lives of children and families in our community. Research of the harmful effects of fatherhood absence to children and the cost to society are well known and discouraging. On the positive side, there are many reasons to support and encourage positive fatherhood involvement, and this bill before the committee. Encouraging and funding this initiative shows a commitment to helping fathers become and remain fully responsible in the lives of their children. Supporting the Responsible Fatherhood Act is a crucial step in building a strong foundation for our children. Family Resource Center supports this bill because we all have a stake in building stronger relationships between fathers and their children. I think President Obama said it best in a long ago Father's Day speech when he said, "What makes you a man is not the ability to have children, but the courage to raise them." Thank you for your challenging work and your commitment to children and families of the Virgin Islands. I remain available for any questions you may have.
Thank you very much, Ms. Barrett from the Family Resource Center. Next, we'll go to the Mission Project. The founder and CEO, Carlton Stevens, you're recognized for your testimony at this time.
Good morning, Honorable Chairman Senator Noble Francis, members of the Committee on Health, Hospital, and Human Services, other members of the 34th Legislature, the listening and viewing audience. My name is Carlton Stevens, Chief Executive Officer of the Mission Project, a nonprofit organization on St. Thomas that conducts programs for fathers and families. I'm here this morning to provide testimony on Bill number 34-0055, an act amending Title 34 of the Virgin Islands Code by adding Chapter 4 to be known as the Responsible Fatherhood Act of 2021 to create a Responsible Fatherhood Council sponsored by Senator Milton E. Potter. Please permit me to share some information on the importance of this bill and my support for the creation of the Responsible Fatherhood Council. My past 27 years of work with children and families in the Virgin Islands as the coordinator and facilitator of the Men Terminating Violence program at the Women's Resource Center, now the Family Resource Center, as a caseworker at the Juvenile Intensive Services Support Services, and at the Edith Williams Alternative Academy as a Director of Alternative Education, have given me a first-hand view of the devastation and issues that affects children when there is a lack of no involvement by fathers. As the Chief Executive Officer of the Mission Project, I often work with fathers who are desperate, angry, lost, worse, hopeless, and just have failed relationships with their children, their spouses, their partner, extended families and friends, employers, and others. Many have piled on layers of bad decisions and mistakes that add to more barriers to those relationships. Many of these fathers experience further institutional barriers from social services, child support, and the courts. A number of social service agencies we have support mothers in their parenting efforts, but few target and support the needs for fathers. Our society have labeled many of them as deadbeat dads, dead broke dads, dead hope dads. Some have accepted defeat and deem themselves irrelevant and replaceable. When these fathers give up, we see the impact of father absence that affects all of our society. We need a responsible fatherhood council to keep their hands on the pulse of the issues that concern fathers. We need a system that only look at the financial stability of fathers, but one that supports a more balanced agenda that emphasizes and understands that maintaining the physical and mental health of fathers allows them to be there for their children and families and be the best father that they can be. A fatherhood council will be ideal for enabling the territory to create an independent forum to test ideas, discuss strategies, and receive counsel and focused input from experts regarding fatherhood initiatives. A fatherhood council will be able to support programs that will allow fathers to learn about themselves and their relationships with their lives, programs that allows fathers to be vulnerable, support and learn from one another the key behaviors that are necessary that allow fathers to navigate fatherhood successfully. A fatherhood council will support programs that inspire fathers to face relationships with the courage to continue fulfilling their responsibilities to their children. In my experience with working with fathers, they only realize the benefit of learning fatherhood skills after they've been involved or enrolled in a program that supports and embraces them without any bias. Fatherhood absence is a cancer that affects every aspect of our community's health and causes poor outcomes for children in a number of areas: educational attainment, mental health, relationships formation, stability, and employment success. Research has shown that fatherlessness is a growing problem in the U.S. as well as in our territory, Virgin Islands territory. And research have shown that a father absent childhood can significantly the children's perception of life, as well as their life choices later on. To bring this into more focus, research has identified 10 adverse outcomes that may result from the absence of fathers in a child's life: perceived abandonment, attachment issues, child abuse, child obesity, criminal justice involvement, gang involvement, mental health issues, child abuse, poor school performance, poverty, homelessness, and substance abuse. According to the U.S. Census Bureau, 18.3 million children, that's 1 in 4, live without a biological father, stepfather, or adopted father in their home. Consequently, there is a fatherhood factor in nearly all social ills facing America today. According to our 2019 U.S. Kids Count data published by the St. Thomas Community Foundation in the Virgin Islands, more than 58% of our children in the territory live in single-parent homes. The Fatherhood Council, a responsible Fatherhood Council, with the assistance of other community organizations, will look at how to inspire, encourage, and support fathers and father figures in our community to become more present and proactive at every stage of their children's lives. Developing a responsible fatherhood council will strengthen the administration's commitment to promoting fatherhood and the role of fathers in supporting healthy families. In closing, I applaud Senator Potter for his foresight in the creation of the bill that a responsible fatherhood council that will support and empower the empowerment of fathers having the capacity to leave powerful legacy for their children and the generations to come. There is a fatherhood absence crisis in our territory, and we need to address it now. Our Virgin Islands children depend on us to give them the best environment in which to grow into healthy adults, and the creation of this bill is a beginning to that reality. I thank you for your opportunity to allow me to give this testimony today. I remain for any questions.
Thank you very much, Mr. Stevens. Next, we'll go to Director Joseph from the Department of Justice, Paternity and Child Support Division. You're recognized for your testimony.
Good morning, Senate Chairman Francis. Good morning to every other senators. Good morning to the listening audience and the testifiers here before us. My name is Terrence D. Joseph. I'm the Director of Paternity and Child Support. I'm here to give testimony on the bill number 34-0055, the Responsible Fatherhood Initiative. I've been doing fatherhood initiatives in the territory for over 15 years now. And it's really exciting to hear that a lot of these individuals that gave testimony, that they have funding to assist in fatherhood initiatives. The Virgin Islands truly, as Mr. Stevens says, the Virgin Islands truly needs this bill. I'm in total support of this bill and the amendments. As the Director of Paternity and Child Support, we have seen fathers cry. We have seen fathers jump for joy. We have seen fathers do everything possible to get involved in their children's life. The hardship that may pose this council is those children that are off island. It's difficult to really and truly put any mechanism in place when you have to deal with the policies of another state or country as it relates to visitation or relates to any communication with the mother. I must admit that the mothers here in the territory have done a yeoman's job in the raising of children, but it must include the involvement of the father. As a father for the past 12 years, I realized, listen, this thing, I'm really I applaud this bill so much, because it really and truly, it's hard when you're doing this from an agency standpoint by yourself. The agency has provided some help, but it still seems like child support is all alone. And we have reached out to the churches, we have reached out to many nonprofit organizations, we have reached out to several organizations here in the territory that has brought some light to me in regards to what's needed, and this bill answers the question. Let me mention something that Paternity and Child Support has done over the years. We have received a grant from the Federal Office of Child Support in regards to it's a $100,000 grant that has no matching specifications to the grant. This is to provide fatherhood initiatives here in the territory. We have done so in many aspects. This is why I think Senator Potter mentions the program he went to in regards to the fatherhood initiative we were doing with Mr. Stevens, the Fatherhood Buzz. Some of the programs that we provide under the Access and Visitation Program to include mediation, parenting plans, communications, and job readiness. It is good to hear that Human Services is looking at doing some job readiness here in the territory in regards to fathers, because they surely need it. This bill is an excellent target towards getting fathers involved. I've been asked so many questions over the years as to where they can go to get help, how they can get this help, and the problems that they have, and the problems that they're having with their current state and their current custodial mom and the children. I've been through war trying to get fathers involved. And it's good to have a team to really assess this issue. Elements that we have outlined thus far in regards to this council is, first, we have to acknowledge that that child that which is born is for that, the father is able to acknowledge paternity for that child. And if DNA test is needed, then we do just that. Once we have established that the father is recognized by law as the father, then we move forward in providing him all the services necessary to keep him involved in the child's life. We also safeguard against domestic violence. I am glad to hear that Abdul Ali is involved in this process, because domestic violence has been a permanent issue here in the territory, and it should stop. It needs to stop, like, immediately. You got to give me a minute, because this thing is very emotional for me, because when you've been doing it for over 15 years, it really becomes a part of your life. I have gone all over the place, both St. Croix and St. Thomas, giving T-shirts saying Father's Count. And the idea behind the Father's Count is to show that once you start to see that fathers really count, and the way the T-shirt, the Bible speaks to death and life lies in the power of the tongue, and they that believe shall eat the fruit thereof. So when you start to say that fathers count instead of saying deadbeat fathers, it starts to resonate with the fathers to do better for their children and children's life. The Paternity and Child Support Division opens their arms and welcomes this program, and is looking forward to creating the council and spearheading this process with the necessary agencies involved to make sure that this council is a success.
Thank you. Thank you very much, Director Joseph, for your testimony. Yeah. You had concluded, Director Joseph?
You're welcome. Yes, I'm good.
Right. Thank you. Thank you very much. At this time, we'll have the clerk read into the record the testimony that has been provided by Mr. Abdul Ali, and we want to wish him well. We know that he's not doing well right now, but we want to continue to pray for him and wish him well. Madam Clerk, please read Abdul Ali's testimony.
Letter dated January 3rd, 2022. Senator Novell Francis Jr., Chairman of the Committee on Health, Hospital, and Human Services, 34th Legislature of the Virgin Islands. Written testimony regarding Bill number 34-0055, an act amending Title 34, Virgin Islands Code, by adding a Chapter 4 to be known as a Responsible Fatherhood Act. My name is Abdul R. Ali. I want to, at this stage, thank you, Senator Novell E. Francis Jr., Chairman of the Committee on Health, Hospital, and Human Services, for inviting me to give testimony at this hearing on Bill number 34-0055, an act amending Title 34, Virgin Islands Code, by adding Chapter 4 to be known as the Responsible Fatherhood Act. I am a Virgin Islands government eligible provider, and I hold 2 degrees from UVI, a BA in an elementary education, and an MA in education with an emphasis on reading. I am the secretary of the Men's Coalition of the VI, MCVI, and one of its founding members. MCVI has, despite challenges, been in operation for over 35 years. It provides training and information to batterers, male and female, referred to it by the local courts. Its main goal is to help to reduce cases of domestic violence and its causes. The organization is located at number 6 FA Peters Rest, Sine Farm intersection, Christiansted, St. Croix. In addition to my role as a secretary for the MCVI, I have also functioned as a community activist here on St. Croix for well over 30 years. And in so doing, I have organized Tomorrow's People, a community-focused group that has honored well over 300 persons in the community for their contributions to its growth and welfare. Along with that, and with some assistance from Matthias Clavier and Kajedi Fanos, leader of the UVI's Brothers with a Cause group, and Josh Ramos of WSTX Radio 970 AM, I have led the organization of 3 International Men's Day Summits on International Men's Day, IMD, which falls on November 19th of each year. The day, which is being observed by many countries across the world to include Jamaica, Malta, Trinidad and Tobago, the United Kingdom, Australia, India, and the United States, seeks to highlight positive male role models and the importance of gender equality. It also seeks to celebrate the achievement of men and their contributions to the community, their families, and to women and children. Information regarding the International Men's Day and its general focus can be found via Wikipedia. In 2019, Dr. Marlon S. Williams was honored on IMD for his contributions as a chiropractor, Olympian, and as a community leader, and as a strong family man. In 2020, retired police captain Melbourne Adams, basketball coach and trainer David Iceman Bermudez, youth leader, Julian Don Bishop, sports reporter and radio personality, Magelia Savita Milligan, former Senator Samuel Sanis, and basketball coach, the trainer Boyd Todman, were all honored for their positive contributions in 2021. Testimony on Bill 34-0055, the Responsible Fatherhood Act 1-3-2022. Some 14 men in the community were honored, and these included Tom Adar, Bureau Chief at the Avis, Zafene Allen, manager of Pueblo and Lorraine Supermarket, Hollister Bad Company Russell, DJ and radio announcer, Lorenzo Simon, businessman and owner of Capital Teas, Lee Carl, newscaster and radio announcer, Charles Hollywood Nibbs, TV and radio producer and retired police officer, St. Clair N. Williams, radio host and chief radio, St. Clair Goodman, businessman and owner of ABS Printing, Dr. Walter Gardner, owner of the Caribbean Kidney Center, Dr. Edward Brown, community activist and VI historian, Reverend John Gilbert, minister at the Frederickstead Baptist Church, Dr. Haldon David, VI Business Development and Innovative at UVI, Dr. Valdemar Hill, UVI professor, author and historian, Dr. David Hall, UVI president. I was indeed pleased to hear about the plans to introduce Bill number 34-0055, an act amending Title 34, Virgin Islands Code, by adding a Chapter 4 to be known as the Responsible Fatherhood Act. The bill, as I understand it, calls for a number of things to include A, the recognition of the importance of the participations of both parents in the lives of their children, B, the development of comprehensive plans designated to enhance positive attitudes within the relationship between fathers and mothers, C, the valuing of the effect of fathers and mothers in the lives of their children, and D, the placing of an emphasis on qualified support and proper recognition of those children for whom public assistance is being received by their parents. Given the importance of this Responsible Fatherhood Act and the establishment of the Responsible Fatherhood Council, it is nice to hear of the proposed tie-in between the Department of Human Services and the Department of Justice Director and the Division of Paternity and Child Support. These agencies would, without a doubt, have on hand vital data that would be utilized to help towards the success of the Fatherhood Initiative as a whole. The fact that the Department of Human Services would have a line item on its budget available to help with the funding for the work of busy council is another bit of good news. It is also nice to know that some specific workspace would be made available to the council by the Department of Human Services to help it to function properly as it carries out its work. When it comes to the evaluation of the territorial programs and offer and things like symposiums and town hall meetings, virtually or otherwise, these was called for creating outreach to fathers and men in general, and in so doing, getting a sense of the challenge that they face and extent to which follow-up work would be needed and sustained. The empowerment of fathers and the enhancement of their self-discipline practices is key. Of course, if fathers and men in general do well, we all as a community do well as well. These symposiums and outreach program referred to above would do no doubt call for funding, data collection, and staff to help ensure that the goals, plans, and change theories developed are realistic and can be sustained. It should also be noted that there exists a variety of external and internal forces connected with the change process, to include much resistance to it. Other factors like the economy, human social needs and values, government policies and laws, and regulations also play a part. With all of this in mind, there would be a need for the Department of Human Services and the Department of Justice, Division of Paternity and Child Support, to be willing to hire a staff member to work with the Fatherhood Council to help to ensure its effectiveness for one, and its place in terms of meeting the objectives of the Responsible Fatherhood Act. On the question of the size, a membership 11. If the Fatherhood Council and the work to be carried out by the council, I really do think that its members should be comprehensive for their efforts, compensated for their efforts, and further, that they should be reimbursed for approved expenses. We would provide initiatives to the members of the Fatherhood Council, and of course, do our best to ensure that all members of the council really function adequately. Would there be a set guidelines and a budget for the Fatherhood Council to follow? And if so, who would prepare these? The Responsible Fatherhood Council funding should be tied to budget so that there would be some clear guidelines on hand as to just how much money is available for spending on matters like marketing, staffing, the evaluation of projects, the holding of conferences, symposiums, travel, technology, upgrades, COVID-19 matters, the training of youths, the folks will be fathers and mothers one day, etc. In a nutshell then, Bill number 34-0055, an act amending Title 34 Virgin Islands Code by adding Chapter 4 to be known as the Responsible Fatherhood Act, is a bill that should be given some serious consideration by the 34th Legislature. It is a step in the right direction and clearly one that only shows concern for the fathers and their roles within the family and within the community, but also put a price to be paid when they are not adequately met. The Fatherhood Council will also provide opportunities to fathers and to men in general be willing to make sacrifices, to take the time needed to forgive self and others, and to continue to accept and to recognize the ever-changing world in which we live and the responsibilities within it. I have no doubt that the organization like UVI's Brothers with a Cause, the Women's Coalition, and the VIDVSAC for the churches, local community groups like Rotary and Alliance Club, and of course the MCVI will be willing to provide support for the bill and for the Fatherhood Council initiative when it is appropriate for them to do so. Given the level of domestic violence and the gun violence that exists in the community at present, there could well be need for the council to foster a thinking years ahead approach, and in so doing, come up with plans and designs that would alter, to a large extent, The systematic patterns of class structure, color, and unfairness that appear, for one reason or another, to have been given priority and glorified over the years. We must now be focusing more directly than we do on self-engagement and the kinds of power and control that seeks to create and foster the unbalancing playing field that exists today. There are times it seems that we forget the adage which states that when a man sows, that he also reaps. Franklin D. Roosevelt once said, "The only limit in our realization of tomorrow will be our doubts of today. Let us move forward with a strong and active faith." Mr. Abdul Ali.
Thank you very much, Madam Clerk, for reading of that testimony. At this time, we'll open up the floor for questioning. However, we'll be doing a 4-minute round for questioning, but I'll take a 2 minutes recess for refresh. And then when we come back, we'll begin with the round of questioning from my colleagues and I. The order that we'll be going in, of course, will be Senator Francis Heidegger, Senator Gittins, Senator Samuel Carrion to start it off. At this time, the committee stands in recess for exactly 2 minutes. The Committee of Health, Hospital, and Human Services is out of recess. At this time, we have heard from all of the testifiers in respect to Bill 34-0055, and we'll be doing a 4-minute round. And of course, I want to thank all of the testifiers for their testimony thus far. At this time, we recognize Senator Francis Heiliger. You're recognized for your 4 minutes.
Thank you so much. Good morning to my colleagues. Good morning to the testifiers. Good morning to the people of the territory. First, I want to applaud my colleague for this piece of legislation as we sit here and listen to so many of the information and statistics as to how needed a program like this to deal with the overall coordination of fatherhood and making sure that the tools and the information is there compounded to make sure that our fathers get what they need. I think for me, one of the things I want to first ask, I will directly deal with Head Start. What were some of the programs available to fathers during this pandemic? Because as you know, it was a shut-in period. Did you have any, or did you see any issues in regards to dealing with the pandemic and fathers still being able to play and participate with their children?
Yes, as I wrote in the testimony, and I don't see our Head Start administrator, if she's on, she can definitely come up. But because of the pandemic and not having the in-person and really reductions in staff and outbreaks and surges, it has really slowed down all of our other initiatives other than the direct education of our Head Start children. But we are anticipating within very shortly, we are praying that the surge reduces and that we can get back to doing more activities for our promotion of healthy fatherhood in our Head Start program.
What are some of the suggestions that any of you would recommend to be part of this council? I could share with you what I would like to see, but I would also like to see some of the things from some of the different agencies and nonprofits where they feel that they could bring something, or what you should be, that should be a part of this council.
Well, for me at Human Services, we really want to fully collaborate with this council. We don't believe in recreating the wheel. So successful practices and activities can be reconsidered and maybe just reimagined as we really push forth now with the council, because there's been some wonderful activities that have been done in the past. And we definitely want to support the Department of Justice, Paternity and Child Support Division with all of their initiatives.
Anyone else?
I would love to see a pastor.
Okay, that's a plus. Any other suggestions? Well, for me, one thing I would definitely like to see a part of the council is reading the bill, and I have expressed this in talking to the sponsor, that I hope that the council has different types of programs as it relates to the development of fathers from an initial onset. A lot of what I was reading with the program is how to get them to be good fathers after the fact. But I think if we had a lot more programs where you were educating young men and young women as to becoming parents, ultimately becoming fathers, decision-making process as to how life would be if you choose the right partner, etc., that a lot of times could help alleviate and push forward more towards the prevention side of it, as opposed to trying to create great fathers after the fact. So I would definitely hope that those types of programs as well would be a part of the council.
Time.
Oh, sorry. The other thing I wanted to ask is, when it comes to the successfulness of a program such as this, what elements do you see that might be important to guarantee its success? Because I do applaud all the various efforts that I've been hearing from the different programs, but if we're going to create a council, what elements do you think needs to be included to guarantee its success?
Your time was
Well, I
called,
can,
Senator. Who are you asking that question to?
yeah.
Oh, well, anyone in general, because everyone is just offering their thought process on it.
Very well. Commissioner?
Yes, Mikhail Reimer Brown, Human Services. I was thinking that the council will definitely need a very strong outreach, community outreach, to include social media and marketing to get the message out there. I love the name Father Buzz, the program that DOJ is going to be doing. So we got to create a buzz in the community. So we see commercials, we see media, social media out there on YouTube. And as you said, Senator, a prevention approach and working with our young men beforehand, before they become fathers.
Exactly. Well, I really appreciate that, because you are correct with us creating programs, and the public might not be aware and not recognize that this is a positive thing to really help them. I think that's a very key element. But I look forward to seeing this council being formed and the individuals being placed on it. I do take note, Mr. Joseph, of your thought process of having a pastor. And hopefully, once the governor is making his recommendations, that this will also be something that he does take note of as well. Thank you so much, Mr. Chair, for the time.
Thank you very much, Senator Francis Heiliger. I'd like to recognize the presence of Senator Genevieve Whitaker. Welcome, as well as our Senate President, Donna Frick Gregory. Welcome, Madam President. At this time, Senator Gittens, you're recognized for your 4 minutes.
Thank you, Mr. Chair, and good morning to all. This subject matter, though some may view it as simple, is very important to today's society. And at the same time, let me just say a salute to all the mothers and fathers who are raising children in a single family home today. This is a very well intended measure that's before us, and I'm hopeful with the change that was requested, and I see that the bill sponsor have agreed, hopefully with the change or the transfer of this commission from the Department of Human Services to the Department of Justice, we'll be able to find some of the absent fathers, otherwise known as deadbeats. Creating these types of measures in the beginning also have a burst of energy, flames, and later on, what happens? The flame just go right out. So I say this to say that we should have some enforcement and follow through with these types of measures whenever we do implement them. You know, at first I was a bit iffy with this, because as a former Rules Committee chair, we have oftentimes, and the chairman knows this too, because we oftentimes discuss it, we try to find ways to reduce the amount of boards and commissions that we have in this government right now. And I see that we're still finding reasons to create more. Again, I understand the intent of the measure. So what I'm asking, though, is that as we implement these things, that we have the enforcement drive from the other agencies or the executive branch for them to carry through these measures as they're passed. Now, as we're in 2022 now, I'll also suggest to the good bill sponsor that we that the bill reflect that this,
It's 2022.
that we're in 2022, thank you, that this bill reflect that an act amending Title 34 of the Virgin Islands Code by adding a Chapter 4 to be known as the Responsible Father Act of 2022, so that they could be consistent with the year that it will be enacted. I want to also thank Assistant Commissioner Michael Reimer for the data presented this morning. 58% is a great number. But what I want to say is that we should also be aware that all single-family homes are not just mothers. There's also single-parent dads, and I want to also salute those individuals. On page 5 of your testimony, Department of Human Services, you spoke of the Office of Family Assistance encouraging coordination with Welfare to Work program. Welfare to Work program. How active and effective is this program? And do you have any data with you today that will tell us how many clients have actually been weed off of this program and actually have gotten gainful employment?
Time.
Yes, in our department, we have our JOBS program, which is the employment training arm for individuals who are on the TANF program. And actually, we have a very low number historically now of probably no more than 100, 120 individual households who are single parents, largely women, who are working with us. I don't have the current numbers as far as seeking who has received employment for this past fiscal year. I can get that, but we have traditionally had probably up to 1,000 people on that program. Because of welfare reform and the limit to 5 years, it has been reduced. But at this point, our numbers are very low. And many of our individuals leave the TANF program and become gainfully employed. However, we're always looking for improvement in this area.
So time has been called. What I want to ask is, through the chair, if you could submit to the committee the stats that you have with regards to this program, so that we could know how many people are actually being weed off of this program and actually getting gainful employment. Mr. Chair, if I may, just one thing I wanted to ask. Thank you. Under the Section 73, membership of the council, I noticed that there's on line 19 and 20, it speaks to members serve without compensation but may be reimbursed for their actual expenses incurred while carrying out their duties as members. I also want to just recommend to the sponsor, or any one of us could bring the amendment, but it should, I'm looking at us actually amending that section and speaking to prior approval for these actual expenses, and they must be eligible expenses to be reimbursed. Thank you, Mr. Chair.
Thank you very much, Senator Gittins, for your line of questioning. I also like to recognize the presence of Senator Carla Joseph. Before we go to the next senator, which will be Senator Carrion, I wanted to ask you, Assistant Commissioner, in your presentation and your data, just to make sure that we're straight on the data, the 58% of children under 18 living in a single-parent, female-headed household is actually in a public housing community, correct? Not in the general community?
No, Senator. This statistic is from 2019, and this was across the territory.
Across the territory.
The 2021 focused on public housing, but the 2019 gave the 58%, and it was a territorial, not specific to any particular population.
Very well. And the you're saying that the 2020 reflected what? What number?
No, the 2021 did not have a number that I would use to encompass the entire territory.
Okay, very well.
So that is why that wasn't included, because it was really too narrow of a slice.
Very well. And that 58% is certainly significant. At this time, Senator Carrion, you're recognized for your 4 minutes.
Good morning. Good morning, Mr. Chair. Good morning to my colleagues. Good morning to the testifiers, and good morning to the people of the Virgin Islands. First of all, I want to also join my colleagues and first start by commending the sponsor of the bill, Senator Milton Potter, for his intention with this bill, and for recognizing the major problem that we have with our society, dysfunctional families, the absence of fathers in the lives of the children. So I must commend him, and clearly the testifiers this morning did an excellent job in their testimony by providing statistics and informations, and providing also sharing some of the negative impacts of the absence of the fathers in the role of their children, and also some of the benefits when they're actively engaged in the lives of their children. So thank each of the testifiers. I want to thank each of the testifiers for their testimony and sharing that information. And of course, once again, for the sponsor for his vision and his leadership with this proposed legislation. Let me start by asking Ms. Barrett, I hope I'm pronouncing your last name correctly. In your testimony, you mentioned some barriers that some of the fathers face and affects them from positively interacting with their children. And in the list that you provided, some of those barriers, you did mention that one of them is government policies that seem to place little value in the roles of the fathers. Can you please elaborate and maybe give an example of what some of those government policies are that you have identified that really affects this?
Well, the government policies, that I was referring to are more how we promote the role of mothers, how oftentimes fathers are often overlooked in their in the importance of their role in the families, and family laws, family policies that do not recognize that fathers are just as important as mothers and support fathers themselves. Too oftentimes, mothers are given the benefit of the doubt that fathers do not get, both in our court systems and the policies. And so, not speaking to a specific policy number, it is just the overall general view in the past that mothers are a much more valuable parent, when that, research has shown that is not the case.
Well, I really want to thank you for bringing that out to our attention, and for those in the government that are listening, especially Human Services and other agencies and departments that have the jurisdiction to work with families, importance that within their policies to recognize and value the role of the father. And I must agree with you, sometimes the men stigmatize and not really value, which and then affects their role in the family. Thank you for that. Commissioner, Deputy Commissioner, Assistant Commissioner, I'm sorry. Ms. Reimer, how are you today?
Good, afternoon,
Good afternoon.
Senator, I'm doing well.
Sorry, I've changed your title there a few times. In your testimony, you did mention that, and I quote here on page 8, that although the premises of the bill is on the right track, it does not necessarily fit in DHS as holistic. Preventative effort supporting all the fathers in the Virgin Islands. I would like to hear you elaborate a little bit. What do you mean by when you say it does not necessarily fit in DHS as holistic? So can you please share a bit more? Because I know you are in support and the department is in support. So can you please expound?
Time.
Yes, Senator. We're definitely in support. At the point, and we shared this with our senator, that with the narrow focus, we felt it was a better fit for the Department of Justice, who has that focus with the Paternity and Child Support Division, and that they had received federal funding to assist with the fatherhood programs. So that should be interpreted that although we are going to be strongly support this program, at this particular time, we felt it was a better fit for the Department of Justice.
Thank you for clearing up. And Mr. Chair, if I may, I know my time has called. Last question.
You may.
What are the recommendations, and maybe from you, Ms. Reimer, you spoke about the importance of the funding source, and you mentioned testimony, unless there is an appropriation made in the bill becomes useless as unfunded mandate. What would you recommend would be maybe an appropriate funding to start off and kick off with this piece of legislation?
Well, I might defer to our Director Joseph, because he would know for his department what would definitely be an important first deposit to assist. So I really would defer to Director Joseph at this point on that aspect.
Good afternoon, Senator. I would say based on what we've worked with in child support over the years, $100,000.
So $100,000 would be sufficient to carry out the responsibility of this council, according to your
That's what I would
estimations.
say.
Okay. Thank you very much. Thank you, Mr. Chair, for the leniency.
Thank you, Senator Carrion. Senator Johnson, you're recognized for your 4 minutes. Good afternoon.
Good afternoon. Thank you very much, Mr. Chair. Good afternoon to all the testifiers, and I would like to say thanks to the sponsor of this piece of legislation, and I can see the direction that, the sponsor would like to go. But I'd like to say thanks to all the testifiers. But I definitely want to say thank you to Ms. Barrett and Mr. Stevens. You guys' testimony, it's really in depth of a lot of the problems that really exist that creates that missing father link. And, when you talk about these deadbeat dads and stuff like that, a lot of times the system is at fault. When you look at the low income wages or home opportunity, it's very difficult for a woman or two-parent that has an income to get the opportunity to be in these homes for low income, and it creates a lot of strife. And many times when it's approved, it's basically approved based on it being a single parent. 90% of the times, a female. And many of our laws in the housing projects, federal guidelines, some of the men, based on their past history, past problem, are not allowed to live in these communities. So that also creates that problem with having that two-parent in the home. But I would like to start out one of my questions to Mr. Terrence Joseph. What's the status on the Parent University? There was a program, Parent University. What's the status on that program?
That was under the Department of, my recollection is correct, I think it's Human Services.
Education.
Education.
But Human Service played a role with it?
No longer have, what's that?
Human Service played a role, right?
At times, Senator, this is A.C. Reimer Brown. Yeah. We probably would do guest speaking or participating in that arena, but that was a Department of Education initiative.
Okay, thank you very much. And since you're on the line now, Direct Assistant Commissioner, based on your studies, what is the primary reason that fathers are absent from household? Based on your studies, what are some of the primary reasons?
There are a variety of reasons, and that's a difficult one. But many times, I believe men are not necessarily taught how to be effective fathers. And I think that's a big part. Many times there's complications of issues for fathers being absent. They may have several families, financial means. But I really believe that it goes back to not really pushing and promoting fathers as important. I know today, my father, and I'll mention his name, Alan Reimer, was instrumental in helping me become the woman that I am today. My mother, always there, but I believe fathers being in the lives of children is so tremendously important. And especially as a female, I really believe that young women need to have strong fathers in their lives so they can really connect with strong males in their adult lives. And so I believe there's a variety of reasons, but as a territory, as a community, we need to start teaching what fatherhood and responsible fatherhood is from a young child in our schools, in our universities.
Mm-hmm.
Time.
Mr. Chair, may I go ahead and just what?
You may wrap up, Senator.
What recruitment tools you guys are using in human service now to try to bring fathers in line or to be a part of these programs? What type of recruitment drive are you using at this time?
Well, we talked in the testimony, we discussed about our Head Start program's effort, always reaching out to not only the mothers, but the fathers. We've been reaching out to men through our TANF programs. For years, we've done a lot on responsible fatherhood and have sponsored Man Up and different activities in the territory. And so we'll continue to do that to recruit men to help them be those responsible fathers that our families need.
And I appreciate all of your efforts, but a lot of times, a lot of what you guys do is like an annual. I think it needs to be more consistent and more than just an annual base. I look at one of your, I think, photo app with Dad. It's an annual. It shouldn't be just a one time. In order for us to be successful in this endeavor that we're trying to promote fatherhood, it needs to be more continuous and more rampant and ramped up a lot more. And I really thank you guys for all your effort. I appreciate the time, Mr. Chair. Thank you.
Thank you, Senator Johnson. Senator VLA, you're next for your 4 minutes.
Thank you, Mr. Chair. Good morning to the people of the Virgin Islands. Good morning, testifiers.
Good afternoon.
Good afternoon, colleagues. In reference, Assistant Commissioner, in reference to the data that you provided from the 2019 kid counts, the 2019 kid counts data refers back to 2015, correct?
Yes, it does. And that's why there's an ongoing need for data and research. And I see that as one of the roles of the Council for Responsible Fatherhood, for us to have more intensive research and data collection for our community.
Hold up. No, just a yes or no. So we have no data post-hurricane, and we have no data post-Irma and Maria. So we don't know if these numbers are the same, have they increased, or exactly what have taken place. I really believe that specific studies need to be conducted in the Virgin Islands because we're going off of data that is now almost 7 years old. So we don't know if there have been an increase in poverty, a decrease. We don't know if there have been an increase in single parent. So we're going off of data that is so dated. And that is one of the problems that we face in the Virgin Islands. On a regular basis, we don't have data. In reference to, and I commend the sponsor of this bill for trying to dent what is an issue in the Virgin Islands. But I think the issue is more than fatherhood. I think the issue is really parenthood. And I'm wondering if perhaps this bill should have been named the responsible parenthood, because a large number, or quite a number, of single female parents have tremendous difficulties. So the issue isn't germane to just absentee fathers. The issue in reference to raising children also include providing support services for those many single parents that need additional help. And part of the services is definitely making sure that we're able to get those fathers to become a part of the life of these individuals who the Virgin Islands are trying to nurture into responsible community members. Assistant Commissioner, do you believe we have a parenting issue that we should expand, and not just fatherhood? We should expand those issues that impact parenting, especially since we see, according to the 2015 study, that 80% of individuals in poverty are a female-led household.
I do believe we have a parenting problem here in the territory. There's nothing that negates that. But I like to reflect on our statement and our groups that talk about Black Lives Matter. And many people say, why don't you say all lives matter? Well, parenting does matter. But when you have a responsible fatherhood issue, there needs to be particular attention given to this segment of our community. And so it's not to negate parenting issues for females, but we need to look at the matter of fathers who are absent, who are not involved.
How do you see this particular measure getting the guys off of the corner that are there from morning until night and have 4 or 5 children, but they spend no time with any of them?
I believe we're going to have to get positive role models and men to come and to outreach to those men. I was contacted by one of our doctors, and he's a pastor in the United States, and he said he would love to come to the territory because he grew up in hospital ground. And when he comes here, he would like to see some specific activities for people, the young guys who are out there on the corner. So I believe men need to be a strong part of this effort and help to recruit other men and help to promote responsible fatherhood.
Yeah, and in conclusion, Mr. Chair, why I said parenthood, if you're a female and you're having a relationship with a male, he has 5 other children. He supports none. He's not a part of any of them life. But you decide you're going to get a child with him and think that he is now going to be supportive of his 6th child. And that's what I'm saying is parenthood. We need to teach everybody to make responsible decisions. We need to teach females, we need to teach males. The males need to know that if you get a child, it's your responsibility to take care of that child and raise that child. You can't have your boys back and you're willing to die for your boys on the street, but you're not willing to spend time with the child that you conceive into this world. And females need to know if he didn't support the 5, he's not going to support the 6. So that is a choice that you made, and you're going to become a single parent. And there need to be some harsh realities, because these numbers that are reflected here are higher than any other jurisdiction across the United States. So that is telling. And when you have 23, I read the testimony for this afternoon, you have 24,000 individuals receiving SNAP benefits, and we only have 87,000 people in the Virgin Islands. That is more than 1 in 4. So that clearly shows you the socio-economic issues facing this island. And if we can't correct those issues, it's hard to move forward as a jurisdiction when living in poverty becomes a norm. Thank you so much, Mr. Chair.
Thank you, Senator Vielle. Senator Whitaker, you're recognized for your 4 minutes.
Good morning, Chairman. Good morning to the people of the Virgin Islands. Good morning to the testifiers. A pleasant good morning. First off, I also join in commending the bill sponsor, but I want to kind of dive right in. First off, I just wanted the onset. Number one, Parent University has conducted by the Department of Education. The last they had it virtually, and it was October 21 of last year. So there have been about a few of them in the last year and the year before that. So it's still ongoing. And I also think that's a very good initiative as one who's for one of the presenters in the early days. I want to also put out to Assistant Commissioner Reimer, are you aware of the 2021 Kids Count data book that's the St. Croix Foundation put out? Because I wasn't quite clear when you about the lack of data. We do have the St. Croix Foundation that really championed and put together the data book for 2021.
Yes, but the data book in 2021 was not as comprehensive as the past years. I think the St. Croix Foundation is doing a yeoman's job ramping up, and I know that they were going to be expanding that. But as in our testimony, there was more of a focus on specific groups as opposed to the larger efforts. So this is probably a first time, and as they get into this, I'm sure that it will be more expansive.
Yeah, one of the things that they do is reach out to stakeholders, and I know Human Services is definitely one of them. So I really think we need to get a little aggressive with that in terms of that engagement. So it's from the two sides. I was in some of those meetings. Let me go straight now, still to you, Director, Assistant Commissioner Reimer, Brown. I want to also ask a few questions, particularly as it pertains to this council. So there are no, we already kind of went through this already. There are no established programs currently whereby, fathers are attending on a regular basis, some type of program to assist them with parenting within the department.
I wouldn't say that. We have several programs and parenting initiatives for all parents, males and females, through our Children and Family Services. We assist through educational efforts, through our Head Start and our Family Assistance Program.
Well, it's been on a regular basis. Would you be able to provide this committee and to the chair, would you be able to provide a list of those programs and, for example, some of the communication efforts? How have you push these programs, media-wise, marketing-wise? Hey, fathers, come join this program. So just if you can send that to the chair, it's for clarity, and as we can delve down into that. Thank you, Commissioner Reimer. You also mentioned that you would feel more comfortable with the council being under another entity. I just want to put out in our, doing our own research here, that one of the things that I've seen throughout the landscape of fatherhood councils and initiatives throughout the country, for the most part, it's actually been with the respective human service or health and human services, the department. What the other alternative has been, for example, an initiative under the governor or what have you. So I just want to put that out. For the most part, it has been with the Department of Human Service. But because of time, I'm going to move on to our next testifier, Ms. Barrett. I'll circle back to you if I can. Ms. Barrett, can you please provide some of the programs at the Family Resource Center that has been most successful? What would you like to highlight as like the most successful program in the area of parenting, and how can this legislation can assist with that?
Well, our parenting program is relatively new, just a couple years old. We work mainly with court-mandated participants who have had issues with child abuse. Our program has been relatively successful in the fact that I think almost all of our parents have been reunified with their children who have been taken away from the family and then brought back together with their mother or father. Right now, our program is heavily female, but we have reached out to the court system to change that. We also have our perpetrators groups, both of the men terminating violence and the women's anger management groups. And we weave parenting into that. It's not
Well, it's because, yeah, but time was, I'm sorry to cut you, of course, time was called. I really appreciate your testimony. Chairman, I would like to just close off because I know my time was called. Chairman?
At the completion of that response, time was called.
Yes, I'd like to wrap up as others have been afforded. Thank you. So thank you, Ms. Barrett, and we will circle up. I really appreciate what you're saying, because actually what you ended was what I want to also close with, is that we have to involve the court in this. Right now, the court system as it is, our court system right now doesn't really have a system in place in terms of when we talk about parenting and mediation. There has been some initiatives by the Superior Court to do those things, but it's not really in writing and not clear. So I think we need to, when we look at this, it is a parenting issue, and we need to look at mediation initiatives, really, both between the court and providers such as your and the government as well, where we're working on concrete initiatives around that. So legislatively, I will also look into that, so we can actually bear down on the court having a process for mediation, parent agreements, and to move in that direction. Thank you very much, Chairman.
Thank you, Madam Secretary. Next up, Madam President, Senator Donna Fred Gregory, you're recognized for your 4 minutes.
Mr. Chair.
Yes.
Good morning, colleagues, and good morning to the testifiers. And while I am not a member of this committee, I thought it was important to be here today because this committee has a whole lot of work to do. We have a number of challenges within our healthcare system, within the Department of Human Services, etc. We are here today to talk about, or at this particular point, to talk about Bill number 34-0005. And I did take the opportunity to read and listen to the testimony that was provided by the Department of Human Services. And I have some questions. I commend the bill sponsor for moving this legislation forward. But what is of tantamount importance is that once legislation of this nature is enacted, that in fact we are able to see the fruits of the labor of the legislation being put forward. And I remain concerned because I know that the amendments that's before us speak specifically to the Department of well, not even a department, a division of paternity and child support, which is a division that falls under the Department of Justice. So, the paternity and child support director pretty much takes his or her direction from the Attorney General and the like. But let's see how this is going to work. Now, Human Services, you indicated that you have several programs. And what is of interest to me is the discussion that was had a little earlier about the 24K in individuals in the territory, 24,000 people in the territory who are on TANF. How are we working with those individuals to ensure that they are moving away from the TANF program? How are we aligning with the Department of Labor and what is the relationship between Human Services, the Department of Labor, and in fact, the Division of Paternity and Child Support? How are we working this to ensure that we begin to see some reduction in those who are heavily dependent on the TANF programs here in the Virgin Islands? So bottom line, I'm asking, what are we doing to reduce poverty in the U.S. Virgin Islands from the Human Services perspective?
Yes, I'm Mikkel Reimer Brown. Services. I just wanted to clarify that number of the 24,000 refers to our SNAP, our Supplemental Nutrition Assistance Program, also known as food stamps. Our TANF numbers are much lower. But in the Virgin Islands, the SNAP program is looked at as a food sufficiency program to help avoid hunger and homelessness. So we do have also a SNAP employment and training aspect of SNAP. So we assist, Senator, with getting our SNAP recipients also involved with our labor department, and we connect them with those services.
What's your success rate?
For the
Data
SNAP
that's collected, do you have data to show when those referrals are made, how successful this program is or isn't?
Yes, we do
And
have
are you
some data. I
seeing
would have data.
Where those individuals are moving off of the program?
Time.
I would say that some of these individuals, even though they obtain jobs, they may still be receiving some form of SNAP based on their income eligibility. So we have a lot of our SNAP recipients who need additional educational training to get jobs that pay more, but many of them, they are working and may still be getting SNAP. And sometimes that's a thought that people think when people are on SNAP that they're not working. Many of those families, a big percentage, are working.
My time has been called. My time has been called, and you're not allowing me to speak. So I need for my question, that the question that I asked, to be answered, please. And that was, how are you guys measuring the success? Is there data that's being collected around the referrals, and how are we managing that to ensure that there is in fact success? That was the question.
Yes, we have our Director of Employment and Training who works with the Department of Labor, and we have the administrator on the line, and we can provide some data to you via Senator Novelle Francis.
Did you say that the administrator was on this meeting? Well, the administrator can respond.
Administrator of Division of
Testifiers, and one at a time, please.
One at a time, please.
Assistant Commissioner, you may wrap up your response.
Yeah, I wasn't hearing well. I said the Division of Family Assistance Administrator is on the line. She, in response to Senator Fred's question.
Thank you, Madam President.
Madam President.
I want to clear up.
I'm waiting for the response. She indicated that. Who is that person? Can you please ask them to respond?
That is Miss Natalie Bailey. That is Miss Bailey.
Good morning. Good afternoon, Natalie Bailey, Administrator, Division of Family Assistance.
Good afternoon, Ms. Bailey.
Yes. Is it possible you can repeat the question one more time for me, please?
The question is, there was a reference made to the respective programs, the fact that we have individuals who are on TANF, individuals who are on food stamp, etc. And we talked about poverty in the Virgin Islands, and my question was around what services are we offering to these individuals to ensure that we reduce our poverty level, one, and how is the Department of Labor, Department of Human Services collaborating with the Department of Labor and the Paternity and Child Support divisions to ensure that these programs, the individuals on these programs are in fact at some point wean off of the programs. I'm referring to workforce development, etc. But I'm wondering, do you have data to show, because your Assistant Commissioner indicated that yes, that there is that collaboration, and the question was, where's the data? Do you have data to show the success of what is occurring with Human Services? What should be the collaboration between Human Services, the Paternity and Child Support Division, and the Department of Labor? Is data being collected in those areas?
Okay, in reference to the data that's being collected, what I can speak to is the number of referrals that we make to the Department of Labor, as well as the number of services that we provide within the TANF program, like those persons that we refer for training, or who we provide any service counseling services or employment counseling services to. We have that type of data.
Any success data? And I know that my time has been called, but my question is not being answered.
Okay, Madam President.
You don't have the data.
Madam President,
what we'll do is, again, that information was requested earlier from the agency, so I will ask Assistant Commissioner Reimer and Director Bailey to please provide that information through the chair to the Senator, please. Thank you. Senator, thank you, Madam President. Senator Joseph, you're recognized for your 4 minutes.
Thank you so much, Mr. Chairman. A pleasant good afternoon and good day to everyone, including all the testifiers and our listening audience. I want to definitely keep my questioning focused on the bill that is at hand and we are considering today. I want to give really good kudos to the bill sponsor for taking this initiative, and as well as to all the men here who are standing firm to support other men and fathers so we could help build our social needs to provide longevity and reduce the amount of crimes that are being committed and the level of dysfunction that occurs in the family because of fathers. I mean, this initiative has a lot of domino effect and a lot of issues that our community is being plagued by. And so I really want to commend these men, these strong men, men of God, more importantly, for coming up to the plate and standing firm behind this initiative. I have had a brief conversation with the bill sponsor regarding one item, and it's very minor, that I would like to, and I recommended that he look at considering making it specific to the territorial symposium and to have it done annually. And so I would like to ask, starting with Assistant Commissioner Michael Reimer Brown, and the same question will go to Mr. Carlton Stevens, as well as to Mr. Terrence Joseph and Ms. Barrett. Do you think it would be a good idea to have this type of symposium annually? Do we have the support to be able to carry out, based on the legislation before us, an annual symposium to discuss and resolve issues related to responsible fatherhood, etc., as the bill reads?
Michael Reimer Brown, Human Services, I would definitely say yes. That this could be a very important part of the Responsible Fatherhood Council, and Human Services would support financially and with our staff.
Brother Stevens?
Carlton Stevens, yes. I do also agree with Ms. Reimer that this should be an annual symposium for the territory-wide though, so the word can be out, information can be out in the public, so everybody, all the men or fathers or potential fathers, young, can know that there's also services there for them to help them.
Wonderful. Mr. Joseph, good to see you.
I concur.
How are you doing?
I concur. I think we should have a national symposium every year.
Yeah.
That provides data to give in our annual report that we have to submit to the legislature to identify the help that we're providing to the fathers here in the territory.
Ms. Barrett, last but not least.
Completely, totally agree with what has been said. Absolutely, yes. At least once a year.
Thank you kindly. Now, Assistant Commissioner, Reimer Brown, I wanted to ask you some questions relative to your testimony on page 5. And it goes into page 6.
Time.
You mentioned, Lord have mercy. My time has been called.
Senator,
Mr. Chairman.
you may wrap up with your last question.
With your last question.
You're so kind. Thank you kindly. I appreciate it. You mentioned the Responsible Fatherhood and Healthy Families initiatives, and you said you will be collaborating with the fraternity. When do you see that you're going to be putting this initiative in practice? What is your timeline? You said you will be. I am thinking that you already started. Who is the lead in your department, the point of contact? So tell me, what is your timeline to put this initiative in place? That's my question, Mr. Chairman, and I will allow the Assistant Commissioner to respond on your time. Thank you kindly.
Thank you for that question, Senator. Definitely in this fiscal year, I would say within this second quarter of the fiscal year 22, activities have already started, and the lead person is our Director of TANF, our Jobs Program Director, Sarah Burke.
Thank you so much.
Thank you, Senator Joseph. And now we'll wrap up this segment with the bill sponsor, Senator Potter. You're recognized for your 4 minutes.
Thank you very much, Mr. Chair. Good afternoon again, one and all. Thank you very much, testifiers. Good afternoon to the people of the territory. I don't have any ideas of grandeur when it comes to this bill. I don't think this bill is a magic bullet that's going to fix everything that is not going right with fathers and with Virgin Islands families. It won't. But I think it is one tool in a toolbox that I think will go very far at making a huge difference with respect to our ability to forge financial and emotional relationships between fathers and their children. Families are key to the success of our community, and father absence is real. It is really something that impacts the minds of young people, the minds of old people. There is always a yearning and a longing for fathers in the lives of individuals. And I think that this fatherhood initiative, the Fatherhood Council, will put together a cadre of subject matter experts to make recommendation to address issues relative to building and supporting fathers in our community. It will go a huge way. There are many jurisdictions throughout the country that have established similar councils, and I am really excited with the possibilities when we can bring together all of the agencies, all of the not-for-profit entities who can come together collectively, not just to do an isolated program, but to collaboratively and purposefully develop initiatives. The beauty about this program is the council's very existence, the reason for the council's existence will be the establishment of programs and initiatives relative to fathers in this community. It is an anti-violence initiative. It is. Much of what we're seeing on the streets is a manifestation, ladies and gentlemen, of our families in crisis. And the absence of fathers is a critical role, has a critical role to play in us beginning to fix this situation. I just have a brief question to the panelists, and my question really is, from your years of experience, are you able to share with us a brief, just a brief success story, beginning with Carlton Stevens?
Well, briefly, in my years of conducting the programs that I do for the Mission Project, or 24/7 Dad program, which is a evidence-based curriculum, we'll be able to actually put fathers in touch who was previously not been in touch with their children, who are living abroad and living locally, and just seeing the reaction from these fathers after going through the program, learning all the information from the program, getting the education from the program. I was on the plane, and this gentleman was in the back of the plane yelling my name, Mr. Stevens. He was pointing. I went, what is he pointing at? He was pointing at his daughter. He had actually now gotten permission to go see his daughter after years of not being able to get in touch with her. Through the Division of Paternity and Child Support and our program,
Time.
he was able to actually get in touch with his daughter and bring her home for the first time in like 5 years. And that's touching. That's touching. That's touching.
Incredibly impressive. Ms. Barrett? Any brief things you'd like to share just based on your experience?
Well, when fathers and come together, have gone through the parenting and the co-parenting class, and we've seen changes in their behavior and their reactions and discipline tools. I see it with the children and the fact that they're doing better in school. They are much more willing, that the children themselves have much better pro-social behaviors, academic development. And whenever I see fathers and mothers interacting with their children in a more positive light, to me, it's a great success story and a validation of what this program, this initiative strives to do.
Thank you very much. Mr. Chair, with your indulgence, I'll just ask Mr. Joseph to just briefly share with us a success story.
I've seen this on hand day to day with fathers who have gone through mediation, who has received visitation with the said child. I have seen the highlights of their happiness. I've seen the highlights of the children being happy. I've seen how the father take on the role of regularly going to visit and take the children out. I've seen how happy they are. I've seen, in regards to fathers and their children, especially the girl child, I've seen a situation where this father was trying to get visitation with his young daughter. When he finally got visitation with his young daughter, she was so elated. She's now back home working in the Virgin Islands. And it makes me so happy to know that our program was able to provide that venue so he could be able to visit with his daughter. And now his daughter is home working and she's a responsible adult. That makes me so happy. And it made him so happy too. You know, it's really truly a blessed thing when the child and the fathers can really get together and have a good time. It makes the fathers happy. The daughters happy.
Thank you very much. So my time has been called, but just very, very briefly, in a past life, I worked at the Family Resource Center. I believe it was Assistant Commissioner Michael Reimer and I really co-counseled a program called the MTV program, which is short for the Men Terminating Violence program. And it was a court-ordered program for men who were charged with, convicted, I believe, with domestic violence. They came to the program angry. In a word, they were angry. They were angry at themselves. They were angry at their significant other. They were angry at the police. They were angry at the judge. And when it came there, they were angry at the counselor. It was just anger times 5, all around. I was very reluctant initially. But I'm telling you, education and knowledge makes a huge difference in changing behavior. And these individuals, after day number 2, were open to sharing and learning conflict resolution techniques, communication techniques. It made a difference in shifting the way they thought and behaved. This isn't just fluff. This isn't just fluff. I mean, it's not arresting somebody or setting a mandatory minimum sentence, and those are the things that we do that make us believe that we're fixing crime. Ladies and gentlemen, this is a significant measure that will make a difference. It's not going to cure all, but it's going to make a difference in curbing what we're seeing on the street that is manifested in the form of crime, and in making a difference in strengthening Virgin Islands families. Mr. Chair, thank you very much for your generosity. Thank you very much, all. I look forward to your support in this initiative.
Thank you, Senator Potter. I want to say thank you to all the testifiers for your participation and input in this measure. The committee will at this time take a 20-minute recess. It's now 12:51. We'll resume at about 1:11, and we'll take action on the bills at that time upon return. And we'll also hear from our territories hospitals, Roy Lester Snyder Hospital and the Wang F. Louis Hospital, and from the Department of Human Services. So the committee will recess for 20 minutes and will resume approximately, it's now 12:52, approximately 1:12. Committee stands on recess.
The Committee of Health, Hospital, and Human Services is out of recess and back in record. Again, I want to thank all of the testifiers for block number 1. And at this time, do I hear a motion?
Amendment.
Senator Alma Francis Heiliger, you're recognized for your amendment.
Thank you, Mr. Chair. I offer amendment number 33286, amendment to bill number 340055, offered by Senator Milton E. Potter. Bill number 34-0055, section 2, is amended in following instances. A, internal section 72 is amended in subsection B, paragraph 6, by 1, inserting after conferral with the family court judge in each district after report. 2, striking January 31 and inserting November 15 in its place. 3, and adding a sentence at the end of the paragraph to read, the report must be based on fiscal year, calendar year of the Virgin Islands government. B, internal section 73 is amended. 1, by striking 10 and inserting 11 in the first sentence, and 2, in the second sentence by A, inserting and the director of the Division of Paternity and Child Support of the Department of Justice or the designee shall serve as after the first sentence of services. B, striking and before ex officio, and C, striking member and inserting members. I so move.
Thank you. Amendment properly offered by Senator Francis Heiliger, seconded by Senator Janelle Sarro and Senator Samuel Carrion. Hearing no objection, so ordered. Amendment. Francis Heiliger, you're recognized for amendment.
Thank you so much. Mr. Chair, I offer amendment number 34-394, amendment to bill number 340055, offered by Senator Milton E. Potter. Bill number 34-0055, section 2 is amended in the following instances. A, internal section 72, subsection A is amended. 1, in the first sentence by striking Department of Human Services and inserting paternity and child support within the Department of Justice. 2, in the second sentence by striking Department of Human Services and inserting paternity and child support division. And 3, in the third sentence by striking department and inserting division. B, internal section 3 is amended by striking Commissioner of the Department of Human Services and inserting Director of Paternity and Child Support within the Department of Justice. C, internal section 80 is amended by, in subsection A and C, by striking Commissioner of Human Services and inserting Director of the Department of Paternity and Child Support within the Virgin Islands Department of Justice. D, the bill summary is revised to reflect the amendment. I so move.
Amendment properly offered by Amendment 34-394, properly offered by Senator Francis Heiliger, seconded by Senator Janelle Sarro, Senator Kurt Vielle, Senator Samuel Carrion. Hearing no objection, so ordered. Do I hear a motion? Senator Gittens, you're recognized for your motion.
Thank you, Mr. Chair. Good afternoon to all again. Mr. Chair and colleagues, I move that bill number 34-0055, an act amending Title 34 Virgin Islands Code by adding a Chapter 4 to be known as the Responsible Fatherhood Act of 2021, as amended, be voted upon favorably here in this committee and be forwarded to the Rules and Judiciary Committee for further vetting. I so move.
Motion properly made by Senator Gittens, seconded by Senator Kurt Vielle, Senator Samuel Carrion, Senator Alma Francis Heiliger. Roll call.
Senator Marvin A. Blyden. Senator Marvin A. Blyden absent. Senator Samuel Carrion. Senator Samuel Carrion, yea. Senator Kenneth L. Gittins. Senator Kenneth L. Gittins not voting. I'm sorry. Senator Kenneth L. Gittins, yay. Senator Alma Francis Heiliger.
Yes.
Senator Alma Francis Heiliger, yay. Senator Janelle K. Sarro. Senator Janelle K. Sarro, yay. Senator Kurt A. VLA. Senator Kurt A. VLA, yay. Senator Novell E. Francis Jr.
Yay.
Senator Novell E. Francis Jr., yay. Mr. Chairman, 6 yeas, 1 absent.
Thank you very much, Madam Clerk. Bill number 34-0055, as amended, an act amending Title 34 Virgin Islands Code by adding Chapter 4 to be known as the Responsible Fatherhood Act of 2022, has been approved by the Committee of Health, Hospital, and Human Services and will be forwarded to the Rules Committee for further vetting. Thank you very much. Congratulations, Bill sponsor, on that measure. I recognize you for a point of personal privilege at this time.
Thank you very much, Mr. Chair. Colleagues, thank you very much for your support on this initiative. Like I said, this initiative is no silver bullet, but I think it's just an additional tool that we can use in our arsenal to begin to educate this community as to the importance of fathers in this community. I look forward to your continued support as this bill is shepherded through the Rules Committee and then to the full body. I think the people of the Virgin Islands will be the ultimate beneficiaries of this initiative. Thank you very much, colleagues. Thank you very much to all the testifiers who provided their input and support on this legislation.
Thank you very much, Senator Potter. At this time, Madam Clerk, please read the second item in block. Well, please read block number 2.
Block number 2, overview of the Governor Huang F. Louis Hospital and Medical Center. Invited testifiers, Dr. Doug Cush, Chief Executive Officer, the Governor Huang F. Louis Hospital and Medical Center. Overview of the Roy Snyder Hospital and Medical Center. Invited testifier, Tina Commission, Esquire, MPA, Interim Chief Executive Officer, Snyder Regional Medical Center. Overview of the Territories Hospital to include the operation, infrastructure, and disaster recovery projects. Invited testifier, Mr. Christopher E. Finch, Chairman, Board of Directors, Virgin Islands Government Health Hospitals Facilities Corporation.
Thank you very much, Madam Clerk, and let me say good afternoon to the individuals in block number 2, and again apologize for the delay. I know that you were on from early this morning and pretty anxious to get this part of your testimony over with. I want to extend congratulations to the new Executive Director of the Governor Juan Francisco Louis Hospital and Medical Center, Chief Executive Officer Doug Koch, as well as the interim Chief Executive Officer of the Snyder Regional Medical Center, Tina Commission, Esquire. At this time, we'll go to our devices just to make sure that do a sound check real quickly, and we'll recognize Chief Executive Officer Doug Koch.
Good morning, Chairman. Good afternoon, Chairman.
Good afternoon. Welcome. Interim Chief Executive Officer Commission, Esquire. Well, we'll wait for her to get online. We'll go to the chairman of the Board of Directors of the Virgin Islands Government Health and Hospital Facilities Corporation, Christopher Finch.
Good afternoon, Senator.
Good afternoon. Very well. Ms. Commission, are you on the line at this point? Very well. At this time, we'll go to CEO Koch for your testimony. Good afternoon once again, and welcome.
Good afternoon, Honorable Senator Novell E. Francis Jr., Chairman of the Committee on Health, Hospitals, and Human Services, Honorable Health, Hospitals, and Human Services Committee members, other senators of the 34th Legislature, and the U.S. Virgin Islands present, and the listening and viewing audience. My name is Doug Cook, the new Chief Executive Officer of Governor Juan F. Louis Hospital and Medical Center. Before we get into the details of this testimony, I think it would be appropriate to give you a little background about myself. I am a native of South Dakota, and I grew up on a grain and cattle farm. Following high school, I knew that I wanted to do something different and not be reliant on rainfall and the mercy of tornadoes, drought, and freezing temperatures. I began my career as a radiologic technologist, and I realized that I loved healthcare and the noble profession of serving those in need. This love of healthcare led me to attend nursing school during the day while working as an X-ray technologist at night. I worked as a registered nurse for several years in several areas of the hospital, including surgery, interventional radiology, and the emergency room. My first leadership position was Director of Radiology for a 25-bed critical access hospital in South Dakota, in which I transformed an outdated technology department to the current standards in the industry at that time. After several years of leading that team, I was contacted by a recruiter for an opportunity that took me to Green Bay, Wisconsin, as Director of Diagnostic and Cardiac Services for a newly constructed Level 2 Trauma Center and Tertiary Medical Center. There, I implemented the first digital mammography program and the first flat panel digital cardiac catheterization lab program in the state of Wisconsin. I was promoted to Vice President of Operations, overseeing many of the major service lines and support departments. During my tenure, we became recognized as a top 100 cardiac hospital and a top 100 hospital overall, with national recognition for our performance in quality and customer service. I was then promoted to Market President, overseeing a 74-bed hospital, 13 ambulatory clinics, pharmacies, and rehab facilities in southeast Wisconsin. Here, my team and I transformed a hospital with failing metrics to a Medicare 5-star rating. We dramatically improved the patient satisfaction scores and reduced the employee turnover rates to their lowest levels. After 4 years in this role, I returned to my home state of South Dakota to serve the communities of western South Dakota, including several large Native American reservations. As Vice President of Operations for the past 3 years, I oversaw all major service lines, including cardiology, oncology, surgery, and several outpatient clinics. As the only tertiary hospital for hundreds of miles in every direction, we served as a safety net hospital for these vulnerable populations. Which brings me to the Virgin Islands. When the recruiter called me regarding this opportunity, at first I didn't give it much thought. But as I began doing my research and learned of the level of devastation that transpired during the hurricanes of 2017, I wanted to better understand if I could help. In my very short time here, I have met some very special people. I will be the first to say that there are many concerns and a lot of things that need to be fixed. It is clear that these problems were not created overnight or even in the past few years. Several of them go back many years, and I promise you that they will not be fixed tomorrow. But you have my word and commitment that as a team, we will work together to prioritize the needs of our patients and implement solutions that are focused around high quality care and excellent patient satisfaction that the community of St. Croix deserves. This is my third week as CEO. I am currently in the process of having introductory meetings with the team, physicians, and community leaders. One of my highest priorities is the JFL team, the doctors, the nurses, and all the staff at Juan Louis Hospital. We will create an environment where the staff feel supported, respected, and have the resources available to them to provide high-quality care that they are all committed to. Personally, I have moved to St. Croix with my wife, Mary Lynn. We have 4 grown daughters that live in several states within the U.S. We look forward to becoming part of this community and making St. Croix our new home. I thank you for the opportunity to share with this body JFL's COVID response, the hospital infrastructure and surgical suites, staffing levels and recruitment and retaining of employees, wait times in the emergency department, the status of the critical care unit, the status of dialysis, JFL's discharge policy, regulatory compliance, finance and operations, and amnesty. To assist with this presentation, I have with me Acting Chief Financial Officer Chanel Moorhead, Acting Chief Human Resource Terry Lynch, Chief Nursing Officer Doris Plaskett, Chief Operating Officer Hazel Filbert, Chief Information Officer Gregory Bryant, Chief Legal Counsel Siobhan Thomas, and the Executive Director of the Territorial Hospital Redevelopment Team, Daryl Smalls. Chief Medical Officer Dr. Raymond Citron is unavailable for this hearing. As a hospital, JFL is in the month 23 of its COVID response. Every month of the virus has required considerable change, expense, and sacrifice from our personnel. I thank every employee at JFL for their hard work and dedication during this long and difficult pandemic. JFL has established both a COVID-19 Incident Command Task Force to manage and guide the COVID-19 preparation and prevention efforts within the institution. We continue to provide an external triage to ensure the protection and safety of our staff and patients. Additionally, we have completed the construction of the internal surge location within JFL, which is currently used by the Department of Health for monoclonal antibody treatments to ensure that we are prepared for the surge of COVID-19 positive patients in-house. At the beginning of the pandemic, the ICU renovation was completed in 2021. JFL reopened additional beds on the second floor to accommodate patients. We continue to work to identify additional opportunities for housing patients internal to JFL. We continue to manage personal protective equipment despite the continued supply chain issues as a result of being on an island. As you know, we have seen an increase of patients requiring hospitalizations. We continue to manage the acute needs of these patients and also the patients that require care for non-COVID-19 health-related issues. As it is commonly known, JFL has provided and continues to provide round-the-clock services for patients in a hurricane-damaged facility. We remain committed to addressing the infrastructural challenges to maintain a safe environment of care for our patients. As we continue to maintain the JFL main building during the transition period to JFL North, significant financial resources have been expended and will be required to complete ongoing maintenance work and repairs to critical systems. A majority of the current physical challenges will be eliminated once we successfully transition over to JFL North, and we look forward to the day when we are able to do so. Daryl Smalls and Board Chairman Chris Finch will speak further as to the status of JFL North and the status of the new hospital building project. In the meantime, our Facilities Management Department has completed and continues to oversee several projects in the main building to include repairs to life safety and utility systems, like JFL's generator system and HVAC systems. Other projects that the Facilities Management Department is presently working on include the replacement of the automatic door located in the ambulance bay with access to the emergency department. In September 2021, the vendor, Eddie Glass, received a check for the full amount of the new door for the area. The door has been ordered and a wait time of 10 to 12 weeks was estimated for it to arrive on island. We await confirmation from the vendor regarding arrival of the new ambulance door on island. Other ongoing project activities by the Facilities Management Department include the constant deep cleaning of the emergency room and patient rooms, completion of repairs to the soil room drainage system, and completion of the renovation of the former advanced radiology space, repairs to the generator room and air handler roof, medical vacuum pump and motor installation, retrofitting of air handler number 2, repairs to the visitor elevators, oxygen use. The repairs to the laboratory equipment are ongoing and or continuously monitored monitoring is required. The operating room is open for emergency and elective cases. As testified to at the July 2021 budget hearing, JFL expanded its surgical suites from 1 to 3 operating rooms, and it has been performing elective emergency surgeries. In 2021, a total of 1,109 procedures have been completed, in spite of staffing, equipment, and supply challenges that may at times result in the postponement of elective procedures. It is important to note that there is always an OR team available, and the OR is always prepared for emergent and emergency cases. Additionally, new service lines were added to the surgical services in 2020 and 2021. The total joint replacement and orthopedic trauma service with a state-of-the-art GPS navigation technology continues to do well, with a total of 21 procedures completed in 2021. In 2021, a vascular surgeon expanded our surgical lines of services by providing vascular and surgical trauma intervention, such as AV grafts and fistulas, dialysis catheter placement, thrombectomies, femoral artery bypasses, and are contributing significantly to the decrease in off-island transfers. We have also initiated 5 minimally invasive gynecological interventions that will provide laparoscopic procedures for women's health services. We have recently recruited a new orthopedic surgeon, Dr. Torres, who specializes in shoulder replacements after 2 years of recruitment efforts. We continue to recruit operating room staff to ensure that we will be able to serve the needs of the people of St. Croix. As we continue progress towards our plans to transition to JFL North, combined with our goals of additional enhanced services, we must ensure that we are staffed at adequate and regulatory standards in order to meet the demands of increasing our provision of care. Recruitment and retention of healthcare personnel has been routinely negatively impacted by the competitive short-term contract salaries offered on the mainland and in the territory. Coupled with the high cost of the government employees' retirement system, the cost of living, and the availability of affordable housing have all created a perfect storm and great recruiting challenges. Our team continues to work diligently to create strategies to combat these obstacles and build a workforce environment conducive to high performance and increased employee retention. We are hiring. At this time, we continue to advertise for clinical and non-clinical positions at JFL. Please contact careers@jflusvi.org to apply. We thank the Virgin Islands Department of Health and VITAMA for their assistance during the pandemic. The Virgin Islands Department of Health has been particularly instrumental in deploying healthcare professionals to assist our staff with the care and management of the COVID-19 patients. We continue to work to decrease wait times in the emergency department. For the year 2021, JFL managed 11,510 patient visits in our emergency room. From January 1st, 2022 to January 10th, 2022, we have seen 341 people in our emergency department. 137 of these persons received a COVID-19 test, and a positivity rate for our emergency room patients is net 39%. Most of these patients waited in their vehicles to receive their COVID-19 test for their own safety. All of the above factors have an effect on wait times in the ED. We are working to recruit emergency department and laboratory personnel so that we can remedy these wait times and ensure higher patient satisfaction. We are listening. We ask that our listening and viewing public not to misuse the emergency room department for COVID-19 tests when you are asymptomatic or not experiencing any symptoms. The use of the emergency department should be reserved for persons who are experiencing severe symptoms. Please be reminded that our emergency department wait times are determined based on each waiting person's care needs, which are determined by a severity index. The less of an emergency you are experiencing, the longer your wait may be. Our critical care unit has a total of 11 beds in operation that are designed for intensive care, progressive care, and highly infectious disease, or our COVID patients. As previously stated, efforts to recruit and retain healthcare professionals are met with many challenges, and the pandemic has further compounded the challenges we experience. Recently, within the critical care unit, to ensure safe and adequate patient to staff ratios, we were forced to utilize the standard medical practice of evaluating the medical needs of each patient, and if deemed necessary, transfer to an accepting hospital for a higher level of care. Although our bed capacity was temporarily reduced, the ICU has remained open to treat and care for patients who require the higher level of care. With the onboarding of additional RNs through the Pafford Emergency Services, we have been able to gradually increase our bed capacity. In terms of the transition of services to the Caribbean Kidney Center, this transition remains pending. To date, despite JFL's best efforts, engagement, and collaboration, none of the dialysis patients have transitioned to CKC. Nevertheless, we thank the CKC for their continued engagement and care of the dialysis population. JFL's discharge policy. The Centers of Medicare and Medicaid Services has established regulations that govern hospital admissions and are used to verify the medical necessity of any hospitalization. Medical necessity, as defined by CMS, means that a patient has a condition requiring treatment that can only be safely provided in a hospital setting. Once evaluated by the provider and medical necessity is met, the provider makes a decision to admit or transfer the patient based on the level of care that the provider believes or expects the patient will require during the episode of care. This decision is documented by the provider in an order. If the patient's condition meets medical necessity, the patient is admitted and a treatment plan and care goals are established. Discharge planning needs are assessed at an early stage of an admission by an interdisciplinary team, which includes the patient and their support system, physician, registered nurse, case manager, and other members of the healthcare team. It must be emphasized that all discharge plans are specifically tailored to the patient and their support system needs. As such, these plans are assessed, managed, and adjusted throughout the patient's stay. Should the patient's condition change or a need for a more advanced discharge plan arise, our case management team will be notified and responded accordingly. Furthermore, whether uncomplicated or complex, once a patient is discharged from our care, the patient has either met their specific care goals or the acute inpatient environment is no longer the appropriate setting to attain those goals. The lack of territorial resources for the long-term care, hospice care, assisted living facilities, and treatment services for behavioral health patients presents difficult challenges and a financial burden for the hospital. JFL currently has 6 boarder patients. Boarders are patients that remain hospitalized post-discharge because family members refuse to pick them up or they have no loved ones and require continued care at home. We recognize that in order to improve care, communication, and transparency are paramount. However, we are absolutely prohibited by HIPAA from discussing any specific patient medical information. We encourage our patients and families with any concerns, feedback, comments, suggestions, and the like regarding the care that they received and or that they which they wish to receive to contact the Patient Advocate Department at patientadvocate@jflusvi.org or call 340-778-6311 and ask for the patient advocate. Our patient advocates are responsible for addressing complaints and concerns from patients and or their family members about the quality of care and services provided at our institution. If you are admitted as a patient, you and your family member may also call the nursing supervisor on duty to report concerns, feedback, comments, suggestions, and the like regarding the care you are receiving. There is a nursing supervisor on 24 hours a day, 7 days a week. This is not a process where your concerns are not addressed. They are addressed. Persons are complimented or held accountable, and change is implemented if necessary. JFL's goal is to ensure quality for every person in our community. We continue to maintain our accreditations through the Center of Medicare and Medicaid Services and locally with the Virgin Islands Department of Health. We continue to prioritize our financial health of the organization, and we move towards ensuring timely payments for our vendors. The organization continues to be burdened by the outstanding debt from 2012 to 2015. However, we continue to work hard to optimize the value of every dollar allocated or earned by this institution. We thank this body for your support of our fiscal year 2022 budget request. We look forward to reporting our progress this budget year. Our next large project will be the Meditech Expanse technology upgrade. We thank you for the funding provided for this project thus far, and we look forward to collaborating with this body to ensure the completion of this project that will increase the organization's financial viability. I would be remiss if I did not mention our 2021 amnesty program, an opportunity for our community members to clear debt from their outstanding hospital bills and restore their credit reports. This program allows for a discount up to 50% off their hospital bill through March 31st, 2022. Please call 340-778-6311 at extensions 2861, 2813, 2797, or 2876 for more details about this program. You can also visit our website at jflusvi.org/amnesty. In conclusion, I thank the Honorable Senator Novell E. Francis Jr., Chairman of the Committee of Health and Hospital and Human Services, and the members of the Health, Hospital, and Human Services for the chance to appear before you today. JFL continues to ask for your support of the needs of our institution as we work to improve staff recruitment and retention, the hospital infrastructure, the federal reimbursement models for the hospital, and the completion of JFL's construction projects. I am pleased to answer any questions you may have, and I look forward to being able to work with you all as we seek to meet, improve, and exceed the healthcare demands of our community. Thank you.
Thank you very much, CEO Cook. Next, we'll go to ICEO. Commission, you're recognized for your testimony at this time.
A pleasant good afternoon, Honorable Senator Novell E. Francis, Vice President of the 34th Legislature and Chairman of the Committee on Health, Hospitals, and Human Services, to all other senators present, and to the listening and viewing audience. For the record, I am Attorney Tina Commission, Interim Chief Executive Officer of the Schneider Regional Medical Center. Appearing with me today are SRMC's leadership team, Dr. Cecilia Penn, Interim Chief Medical Officer, Ms. Ralda Mason, Vice President of Human Resources, Mr. Christopher Borgeson, Vice President of Operations, Dr. Delphine Olavaci, Vice President of Quality and Performance Improvement, Mr. Peter John Baptiste, Interim Vice President of Facilities, Ms. Kenesha Engel, Finance Manager, and Ms. Toya Sylvester Allen, Associate Administrator of Nursing, representing Ms. Yvonne Thomas, who's our Interim Chief Nursing Officer. Thank you for allowing Schneider Regional Medical Center the opportunity to provide an overview of our operations, staffing, infrastructure, and status of our ICU, surgical suites, and patient discharge policies. The COVID pandemic has reshaped everything we do at SRMC and has considerably affected our operations. It has been 2 years since the first cases of COVID-19 were reported in the U.S., yet the pandemic rages on, causing a significant impact on our personnel, expenditures, and overall operations. Throughout the pandemic, our workforce has remained on the front lines and often made personal sacrifices to ensure our patients receive the essential care they need. I want to pause here and thank them for their tremendous efforts. In January 2020, SRMC successfully established a COVID task force that includes representatives from all areas of the organization, including operations, administration, facilities, human resources, nursing, medical staff, laboratory, pharmacy, security, housekeeping, food services, infection control, and performance improvement. This team meets weekly to guide our COVID response and preparation efforts with a specific focus on ensuring the safety of our staff and patients and preparing our organization to accommodate the increased demand for patients seeking care. To accommodate the increase in patients seeking services at SRMC, we created 2 external COVID triage units to conduct preliminary assessments, one at the Royal Esther Schneider Hospital and one at the interim Myra Keating Smith Community Health Center on St. John. Our emergency department fast track was converted into a negative pressure COVID treatment unit equipped to provide rapid response and urgent respiratory care. To decompress wait time in the emergency room during the surges we had in July and August of 2021, we also implemented drive-up testing services to support the community screening efforts occurring in St. Thomas and St. John. We plan to resume that activity next week to accommodate the most recent surge. We have expanded our lab capacities by purchasing a fully automated holistic Panther fusion system, which is currently the most sensitive and accurate test available in the Virgin Islands. We also expanded our inpatient units to accommodate COVID-positive patients requiring admission. A significant portion of our 4th floor was converted into 2 21-bed, highly infectious disease patient care units that can safely accommodate COVID-positive patients. Our patient care units were designed with mechanical ventilation systems to provide the negative pressure environments required to prevent the spread of COVID and to safely care for our patients. We also converted administrative offices on the 5th floor into patient care spaces to accommodate our normal medical unit operations. 83 new critical care hospital beds were purchased and installed to support these new units. As part of our preparation for surges of COVID-19 positive patients in-house, we purchased and installed 40 new central monitoring systems to improve the direct monitoring of our most critical patients. We also added 25 new ventilators to support patients with severe or acute respiratory conditions. We have created redundancy and hardened our infrastructure by installing an oxygen generator. At a critical time like this, when there's a surge in the number of COVID-19 patients in the territory, the demand for oxygen supply has increased considerably. This acquisition has proven to be highly beneficial and a reliable solution for our organization. Since the system became operational in October of 2021, we've been able to provide our patients with a secure and constant source of medical-grade oxygen produced directly here at the hospital. Throughout the pandemic, we have procured adequate supplies of personal protective equipment, or PPEs, despite having supply chain issues. Our infection control team has provided education and training to our staff on the proper usage of PPEs and on best practices to care for patients with highly infectious diseases and conditions. We are again in the middle of yet another COVID surge, and we are seeing increasing numbers in COVID-positive cases in the St. Thomas-St. John district, thus resulting in an increased demand for hospital care at SRMC. Over the past year, our organization has seen approximately 15,000 patients at the Royal Esther Schneider Hospital's emergency room. We had 172 COVID positive admissions for 2021, and sadly, 31 deaths in 2021 that were related to COVID. Of the 31 deaths, only 2 persons had received both vaccines. 1 person had received only the first dose, and 28 persons were unvaccinated. SRMC has provided approximately 10,000 outpatient hemodialysis treatments and had approximately 23,000 outpatient encounters for our other services in outpatient areas over the past year. Within the past 2 months, our patient visits or encounters have increased considerably, with our ER sometimes seeing more than 50 patients in a 12-hour shift. We have talented, qualified, and engaged employees who are passionate about their work, and they are the heart of our healthcare system. This COVID pandemic has taken a heavy toll on our healthcare teams, and many are now suffering from stress, trauma, burnout, and related health challenges. At SRMC, we are currently experiencing the most severe staffing shortage ever faced in our organization. Aside from the burnout issues, staff are leaving for more lucrative travel contracts as the nationwide shortage of clinical staff continues to drive pay rates higher. Many of our critical care and support service departments lack the permanent staff we need. Hospitals nationwide are facing the same challenges. According to a 2021 Washington Post Kaiser Family Foundation survey, nearly 30% of healthcare workers are considering leaving their profession altogether due to work-related stress and the impact of the pandemic. Medscape's 2021 report, published on December 29th, which polled 10,788 nurses over the summer of 2021, found that at least 25% of respondents in each position category of nursing said the pandemic decreased their satisfaction with being a nurse. In every nursing category, at least 20% of the respondents reported being very burnt out or burned out. SRMC's nurses and allied health professionals have the biggest hearts. They don't want to see their coworkers suffer, and they don't want to see patients suffer, and that's why many of them have chose to stick it out, and we thank them. But now, with this 5th surge underway, even those nurses are having thoughts of resignation. We must, therefore, act tangibly to reward and incentivize them to stay. A recent survey by the American Hospital Association found that between 2019 and 2020, job vacancies for various nursing personnel increased by up to 30%, including respiratory therapists by 31%. And these shortages are expected to persist over the next few years. The daunting challenge of sustaining the healthcare workforce predates the COVID-19 pandemic. The industry, for more than 50 years, has acknowledged that the U.S. would face a shortage of nurses due to fewer persons entering the nursing field. More nurses are retiring, and the demand for nursing care has increased with the graying of society. COVID has only exacerbated this known shortage. A study by the American Hospital Association estimates that the U.S. will need to hire at least 200,000 nurses per year to meet increased demand and to replace retiring nurses. Our staffing shortages at SRMC were further complicated during this recent surge by our own employees being infected with COVID through community spread. While approximately 90% of our staff are already vaccinated, we continue to strongly advocate and encourage all staff to get fully vaccinated and boosted. Based on our average daily census of 60 patients at the hospital, we require approximately 149 registered nurses on staff to care for them. Currently, we only have 83 of the 149 nurses hired as permanent staff, which means we only have 56% of the permanent registered nurses we need on board. In the ER, we only have 7 of our required 21 permanent registered nurse positions filled, which is only 33% of the permanent registered nursing staff we need for the ED. In the ICU, we only have 7 of 15 permanent nurse positions filled, which is 46% of the permanent nurses we need. On the medical unit, we have 11 of 17 permanent registered nurse slots filled, which is 65% of the permanent registered nurse staff we need. And on the surgical unit, we have 12 of 20 permanent nurse slots filled, which is about 60% of what we require. Recruiting staff has been a challenge for our organization. We are being outpaced in this highly competitive landscape by hospitals that offer higher salaries, generous sign-on bonuses, reasonable cost of living, and better accommodations. We must put a real effort towards fixing our permanent staffing. While we are most certainly thankful for the temporary assistance we have received from PAFFord, we must recruit and retain permanent employees vested in the Virgin Islands who are passionate about caring for the community. I would like to offer a special thanks to Commissioner Justa Encarnacion and the Department of Health team for all they have done to help secure temporary staffing for our organization during this pandemic. As we enter this year, our utmost priority and number one priority is to do everything possible to attract and retain our permanent staff. To do that, we must become a more attractive employer. This has to be a 5-year strategic plan because we cannot solve these issues in 1 year. But we have to take a serious first step with a concrete strategy to develop an attractive recruitment and retention package that convinces nurses and other allied health professionals to work in the territory. Proactively, I want to thank Governor Bryan for understanding our need to focus on permanent staff recruitment and for his public commitment to supporting this effort by pledging funds to the hospitals to help us achieve this mission. I also thank OMB Director Jennifer O'Neill, Finance Commissioner Bosady Bruce, and OCB Chief Negotiator Attorney Joss Bringett for working with our organization to help to plan and fund this initiative. We have started to help ourselves address our staffing issues where we can by instituting training programs to grow our own. Last October, SRMC started a patient care attendant training program with 6 enrollees. PCAs are unlicensed nursing attendants that provide support to the registered nurses and other members of the healthcare team. Last year, we also offered practical, hands-on experiences to student trainees in the Raphael O. Wheatley Skill Center program and in the UVI nursing programs. We hope to onboard these student nurses and trainees in the future. We hope to partner this year with the Department of Education to encourage our Virgin Islands youth to join the medical field. This is something that we have done in the past, and we hope to reestablish it this year. We also want to establish new training and rotation opportunities with other health systems to allow their staff to rotate here to work with us in Paradise. In all we do, and despite our staffing challenges, patient safety is of importance to us, and we remain focused on maintaining our accreditation, status, and certifications with the Joint Commission and the Centers for Medicare and Medicaid Services, CMS. SRMC is currently in full compliance with the Joint Commission's standards and with the Centers for Medicare and Medicaid's conditions of participation for hospitals. We have also successfully maintained accreditation with TJC, CMS, and CLIA for our clinical laboratory services. Our patient experience and high reliability organization committees are instituting best practices aimed at the continuous goal of enhancing our patients' experiences. We also have to continue our efforts to improve the timeliness of patient throughput, and especially our emergency department door to disposition times. To have successes there, We will have to improve the timeliness of diagnostic testing results, the admission paperwork process, and we'll have to increase our nursing and physician staffing. Another one of my priorities is to advance new financial initiatives to improve our bottom line. We have already started to put into place several measures to improve our billing and collections. Since I have been in the role of interim CEO, we have worked on improving our denials management process and exploring real cost-saving measures. We are taking a hard look at our supply chain management and our group purchasing organization options. There are cost-saving opportunities which could result in savings of $500,000 or more over the course of a year by taking a new approach to our entire inventory management process. This includes ordering the right product in the right amount at the right time from the right suppliers. We will also be looking at our pharmaceutical purchasing to get a better bang for our buck there and see what cost savings we can achieve. We are being good financial stewards of the allotments that are provided to us from this body. Many of our initiatives include making our finance office more up-to-date, electronic, and efficient by converting many of our paper processes to automated and electronic processes in payroll, management of credit accounts, billing, and budgeting. We successfully rolled out individual department budgets, and our finance team has been providing tools and education to assist our department heads in better managing their department's finances. This has already increased the financial stewardship as we see our department heads becoming better at reducing overtime, explaining variances, and improving the management of supplies and resources. We have successfully started moving Myra Keating Smith into a fully electronic site with an emphasis on making their medical records completely electronic and improving the transmission of data from Myra Keating Smith on St. John to Royal Leicester Schneider Hospital on St. Thomas for better processing. We have almost completed our finalizing the price transparency project, where you will be able to go on our website and see our price for all services, including a cash price, which is in line with our requirements under CMS for price transparency. We have completed our audits for this year. There's one piece related to GASB that's still awaiting completion, that's tied to and waiting for the larger government-wide audit. And we have been collaborating with the Department of Human Services and other agencies on our cost reports. We know there are opportunities to relook at the cost reports, and this is tied to our reimbursement rates. We are continuing to manage our accounts payable and have been working to improve our vendor relationships through timely payment processing. We are keeping our focus on revenue-generating activities and performance metrics to help us on the top line. We're being strategic about how we can be competitive in the market to increase our volumes in revenue-generating service lines and areas where there is a positive profit margin. We continue to track our productivity using metrics. One specific advancement that we can make, which will help to reduce our staffing needs, improve patient safety and satisfaction, and enhance our regulatory compliance, is a technology infrastructure update to move to a new version of Meditech, specifically Meditech Expanse. Moving to Meditech Expanse will improve efficiencies, workflows, help to reduce errors, and make our staff's jobs easier. The Meditech system is our electronic medical record, and it is used for clinical documentation, inventory tracking, patient records and billing, payroll and personnel tracking, medication verification, and for laboratory and pharmacy ordering. According to Becker's, a leading healthcare industry group, hospitals that have adopted an updated EMR report that 25 to 30% of patients adopt the new digital platform right out of the gate, and that adoption rate grows exponentially as patients acclimate to the system. That provides more time for our staff members to focus on higher priority tasks. Organizations who have adopted enhanced EMRs have seen tangible business benefits, such as a 58% increase in out-of-pocket cost collections at or prior to service, more than 75% of patients being financially cleared before their service, and 15% lower administrative costs through automation and improved accuracy. This investment will help to improve the patient experience. Today's patients expect an easy and convenient digital experience. Many providers have already taken steps to meet those expectations with applications, portals, and point-of-care solutions that target specific processes. Digital transformation was already well underway before this pandemic, and COVID-19 has shifted that into overdrive. Additionally, regulatory agencies such as the Joint Commission and CMS have also increased reporting requirements, and this technology can help us to streamline processes and reduce the manual labor that's required to capture this information, which frees up hours to perform patient-related duties. The time saved in collecting the data would be used to implement safety and quality initiatives. We thank this body for the support we have already received and for your continued interest in funding this critical technology upgrade. As requested by this committee, I will now move forward with an update on our patient care units and our discharge process. SRMC's intensive care unit, or ICU, has 8 full-service intensive care beds that are equipped to handle acutely ill patients who require advanced level critical care. The intensive care unit staff are trained in adult and pediatric life support and in other critical care treatments, interventions, and protocols. Over the past year, we have been able to provide steady anesthetist support for the operating room, where we were able to have at least 4 anesthetists to support 3 functioning operating room suites plus a C-section suite. This has greatly improved our patient and staff safety and allowed us to reduce our operating room overtime. We have continued to perform outpatient surgical cases under heightened infection control protocols during the pandemic. SRMC performed a total of 2,346 cases in fiscal year 2021. We have been able to reestablish our OR block time. We have a consistent team in place to improve our policy and protocols, especially with respect to epidural consents, epidural equipment, and other needs in the operating room. SRMC has also restored its total joint program. This strategic business unit has been a success for the organization and a good thing for the community over the past year, allowing residents of St. Thomas and St. John to remain at home to have elective joint replacements. We have negotiated fixed pricing with vendors to ensure cost savings with implants, and we've executed a new contract with vendors to provide custom prosthetic implants for total knees. As of November 10th, we had performed a total of 46 procedures for the year. 33 of those were total knee replacements, and 13 were total hip replacements. Collectively, they had a positive contribution margin of $146,000. Our medical unit is typically full at 21 patients for 21 beds occupied. Unfortunately, we have multiple unsafe discharges or boarders in-house, which further compresses the hospital and ties up our nursing staff. SRMC is accredited and certified as an acute care hospital, not as a long-term care facility or assisted living facility. These patients are technically discharged from the hospital, but remain in-house for various reasons and durations. Obstacles to ensuring a safe patient discharge include family refusal to take their loved ones home, unsafe home environment, a patient's inability to provide self-care, and the lack of wraparound services and nursing home and assisted living care placement options, to name a few. Currently, we have 10 patients identified as unsafe discharges. It is important to note that these patients are not acutely ill, but require post-discharge support and housing. As a result, they remain in-house and occupy acute care beds and require staffing support. Some of these patients have been in-house on boarder status for more than 3 years. That lack of bed capacity has resulted in extended stays in the emergency department for admitted patients who need to be moved up to the floor. We are engaging our community partners and government agencies to identify appropriate post-acute care facilities that can provide support to safely discharge these patients. We are hopeful that these persons can be transitioned into appropriate alternate facilities in the very near future. These patients truly should be at another care location or facility other than SRMC. The hospital bed is the most expensive bed on the island, and this is not a good use of government resources. We want to thank Governor Bryan and his team for launching the Virgin Islands Healthy Housing Initiative, which is helping the Virgin Islands better understand the needs that exist for housing and services, and will provide a strategic focus for developing the much-needed additional behavioral health and skilled nursing home services in the Virgin Islands. Schneider Regional Medical Center's policies and procedures regarding the safe discharge of patients are guided by CMS conditions of participation and the Joint Commission standards. Our processes and procedures mandate that the discharge process begins at admission. This is accomplished by the following procedures. First, all patients' discharge needs are initially assessed and documented by the professional registered nurse within 24 hours of admission. Secondly, all Medicare beneficiaries, patients aged 65 and older, and patients identified based on special needs or disease processes are also assessed by the professional registered nurse case manager within 72 hours of admission. Each individualized discharge plan must include the following: an assessment of the anticipated post-discharge needs, including the ability to provide self-care, the presence of a support person or family member to assist, the anticipated need for medical equipment, and the patient's physical home environment.
I mean, you know, if you weren't doing anything else, it doesn't matter, right?
As well as
Commissioner Kazi
evaluation of the
Gomez, please mute
patient.
your phone. Commissioner, mute, please. Mute your mic. Go ahead. I'm sorry, ICU, go ahead.
Thank you, sir. The second part of the individualized discharge plan is an evaluation of the patient and their support person and family members' ability to understand the patient's needs, their ability to get their discharge medications, and their capability to get their required follow-up care, such as physical or occupational therapy, home care, hospice, durable medical equipment, and mental health services. All patients are provided written discharge instructions outlining follow-up appointments, directions for the continuation of their care at home or with outpatient providers, medications they should continue to take, and a summary of the care provided during their hospitalization at SRMC. When patients cannot be safely discharged from the hospital, the case management and social services teams work with the patients, their families, and the available community resources to try to meet the specific post-discharge needs such that the patient can be discharged. However, the lack of available community resources and post-acute care placement options frequently makes this challenging. Finally, we want to update this committee on our facilities and infrastructure. SRMC needs to continue to make repairs to our facilities as they are old and still affected by the hurricanes which severely impacted our facilities nearly 5 years ago. We have done our best to maintain our facilities to provide our patients and staff with a quality healthcare environment, but we need additional funding support to perform the additional necessary repairs. Keeping the building in safe working condition has not been easy and has cost us significant amounts of money. These facility issues are not separately budgeted for, and any repairs or required upgrades are funded by our operations. We have already successfully completed some repairs, including roof repairs, some air conditioning repairs and replacements, a partial dietary and cafeteria overhaul, and we have made several grounds and building improvements. We have also completed the installation of 2 new hoods in the pharmacy, in the drug mixing room, to meet the requirements established by the Joint Commission. We need to continue to work on our HVAC system, as most of the ducts around our air handling units were torn off during Hurricanes Irma and Maria, and some of our AC units are still in need of repair or replacement. Additionally, we need to perform work on our electrical system. The main transformer that controls the voltage to the facility is defective and requires replacement. A new transformer has been received and is on site, and we anticipate completing the installation of this transformer by the end of this month. We want to give special thanks to Mr. Darrell Smalls for his assistance with this replacement. Our chairman of the Territorial Board, Mr. Christopher Finch, and Mr. Darrell Smalls of the Territorial Hospital Redevelopment Team will elaborate on the redevelopment of SRMC's 3 facilities. But we want to thank and acknowledge our stakeholders, including our physicians, nursing, and Charlotte Kilman Cancer Institute staff, who have been participating in reviews of the development plans and the alterations to ensure that the new facilities will best accommodate the patient care that we need to deliver to the community. Our leadership team is committed to working with the THRT, with our boards, with the Governor Juan F. Louis Hospital and its new CEO, Mr. Cook, to achieve best practices, cost savings, and other efficiencies to improve healthcare for all residents in the territory. I am confident that we can achieve that with this alignment and energy. In closing, we hope that healthcare will continue to be at the forefront of all future funding considerations made by this committee and by the 34th legislature. We thank this body for its commitment to our hospital. The hospitals and health systems in the territory are facing mounting and critical staffing shortages, infrastructure needs, and information technology limitations that could limit access to care in the communities we serve. We have the opportunity to transform healthcare here in the territory by becoming employers that attract staff and that are hardwired with technology to advance the best healthcare possible. I am committed to working with our team to help to make our hospital the best that any small island has. And I thank every member of our SRMC team who contributes to our success and continued improvement. The community we serve deserves this, and the people of the Virgin Islands deserve this. Any one of us here today, or our family members, could need the services of SRMC any day. And it's in our collective best interest to work together as hard as we can to make it as great as it can be. Should any of us suffer a trauma, a car accident, or experience a major illness, we all want to know that we are in good hands. Our staff and leadership have good hands, and we care. We just need to support our staff and our institution. As you consider legislation this year, we ask that you look at the overall healthcare needs of the territory and prioritize funding that supports patients, caregivers, and providers in the wake of the COVID-19 pandemic and into the future. Our specific asks for this committee are, first, to support staff recruitment and retention plans. Second, to support facility infrastructure updates. Third, to support information technology updates, specifically the move to Meditech Expanse. Fourth, to lobby to maintain the Medicaid reimbursement at the 85-15 split and to push for Medicare rebasing to reflect a more current year. Fifth, to boost in every way the long-term care options and placement options and wraparound services that are available within the territory. Sixth, to lobby for expedited visas for qualified international nurses and other clinical staff. And lastly, but importantly, to support programs that address clinical staff well-being. State leaders across the U.S. are recognizing that hospitals and frontline workers are in desperate need of additional resources as the COVID pandemic overwhelms the hospitals. New York's Governor Hochul pledged within the last week to invest $10 billion towards fixing issues similar to the ones we are facing. That money will be used towards higher wages, better hospital conditions, and recruitment and retention to assist with getting a more robust pipeline of workers. In the VI, we have to make the same commitment towards protecting the health and safety of the public by providing resources for our hospitals and competitive compensation to our staff. This latest unplanned uptick in COVID yet again created another emotional roller coaster. It took us away from celebrating the holidays with loved ones and left us feeling overwhelmed with the volumes of COVID-19 patients and with being affected with COVID-19 ourselves and seeing our fellow team members affected all at the same time. But on the upside, our SRMC team always pulls together and finds a way to put all the lessons we have learned on nimbleness, resiliency, collaboration, and best practices to work, and we handle whatever comes our way. There's a strong sense of gratitude for each other and recognition that we're all in this together, as we have been in a similar place before, and we know with your help, we will get to a better place together. SRMC remains committed to providing quality, timely, and safe healthcare services to our patients, and we thank our district and territorial governing boards for supporting us in our mission. It has not been easy, but our staff show up every day and give it their all. The team I am surrounded by continue to push forward and display incredible strength and endurance, and I thank them on behalf of all of us. To the listening public, we urge you to get your COVID-19 vaccinations and boosters. You, the public, can help us this way. Most of the persons admitted to our hospital did not get their vaccinations, and this choice is putting a strain on the healthcare system that we all need. We call on community members to mask up in public and to social distance. We all need to remember to stay up to date with our regular medical appointments. If you feel you need us, we are here. Our emergency department is always open. But if possible and your symptoms are mild, you may want to seek care from your physician or a local urgent care center instead of the emergency department when that is appropriate. Again, I want to thank this committee and thank you, Chair, for allowing me to share these updates from Schneider Regional Medical Center. And I respectfully hereby conclude my testimony. My team and I are available to respond to any questions you may have. Thank you.
Thank you very much, ICEO Commission, for your testimony. And next we'll go to Chairman Finch for his testimony. And again, thank you, Chairman, for your patience. We know that you're not on the clock. And we appreciate your patience on a long day that you have spent here with us. And in addition to preparing for today's hearing, you're recognized for your testimony at this time, sir.
Thank you, Senator. Good afternoon, Honorable Chairman Novelli Francis Jr., Vice President of the 34th Legislature and Chairman of the Committee on Health, Hospitals, and Human Services, Honorable Senators of the Committee on Health, Hospitals, and Human Services, other Honorable Senators of the 34th Legislature, Senate staff, fellow hospital testifiers, and the listening and viewing audiences. My name is Christopher Finch. I am the Chairman of the Virgin Islands Government Hospital and Health Facilities Corporation, more commonly known as the Territorial Hospital Board. I am also a member of the St. Croix District Governing Board for the Governor Juan F. Louis Hospital. Thank you for this opportunity to testify. I was asked today to testify on two aspects of the hospital operations. These are one, to describe the board's oversight of the territory's hospital operations, and two, to give an update on each of the hospital construction projects. Joining me today, along with leadership from both hospitals, led by Attorney Tina Commission and Mr. Doug Cook, is Mr. Darrell A. Smalls, who leads the hospital redevelopment team as the Executive Director of Facilities and Capital Development. I'll start with the Territorial Hospital Oversight. The Territorial Hospital Board presently has 10 members, which is sufficient for a quorum. The makeup of the board includes 3 cabinet members, namely the Commissioner of Health, the Commissioner of Finance, and the Director of the Office of Management and Budget, plus a doctor and a nurse representative from each district elected by their respective medical organizations, and 3 members proposed by the governor and confirmed by the legislature. We meet monthly as a full territorial board, most often the first Wednesday of each month, plus we have an active committee structure. Our standing committees are the Executive, Finance, Human Resources, and Performance Improvement Committees. Committees also meet monthly, except for the Executive Committee, which meets on an ad hoc basis to handle pressing needs that should be addressed prior to the next full board meeting. The 7 board members who are not cabinet members also serve on either the Schneider Regional Medical Center or the Juan F. Louis District Board of Directors. The district boards also have a consistent meeting practice and their own subcommittee structure. Since the district boards do not have a quorum, final approval of all board members is done at the territorial board level. Hospital issues requiring board approval are vetted through the committee process before coming to the full board for approval. For example, procurements exceeding $100,000, which honestly is most procurements, will typically process through a district board meeting in the Territorial Board Finance Committee before being approved by the full board. Similarly, new hospital policies will be discussed at a district board level and through the Territorial Board Performance Improvement Committee before going to the full board for ratification. The COVID-19 vaccine mandate was shaped through a series of Human Resources Committee meetings before its final approval. To be clear, the board does not meet by itself. Hospital leadership participates fully with us. For example, at our most recent full board meeting, which was Wednesday of this week, along with the 10 board members, we had 15 invited participants from the hospital leadership, along with board support and media. Both hospital CEOs and the executive director of facility and capital development, which is the hospital redevelopment team, report directly to the territorial board through the chairman. The territorial board has oversight responsibility for the hospitals and provides advice, consent, and support to the leadership. In addition to its overall role, the board has also been focusing on priorities, which I will briefly list. Some of these areas of focus, in no particular priority order, include, and I should add that this is not a complete list, but some of our areas of focus include appointing permanent CEOs, monitoring revenues and expenses, monitoring the impact of the pandemic on the hospitals, especially patient needs, staffing, and finances, monitoring the COVID-19 vaccine mandate compliance and its impact, supporting the completion of JFL North, supporting the hospital's efforts to find funding to upgrade their Meditech electronic health record systems, maintaining a consistent procurement process that passes all local and federal standards, coordinating policy development so that to the greatest extent feasible, our hospitals follow similar policies, maximizing the receipt of Medicaid funds, and reducing the accounts payables and receivables, especially for JFL. The entire nation is experiencing a nursing and medical specialist shortage. All through the U.S., there is competition for the same professional staff. This will not go away with the end of the pandemic. What will go away is the federal funding for traveling workers. Staffing challenges will continue to be a leadership and board priority for years to come. Hospital construction projects. I'll now testify on the Territorial Board's perspective concerning the recovery efforts of our territorial hospital. The Governor Juan F. Louis Hospital, the temporary hardened structure, now called JFL North, the Myra Keating Smith Community Health Center, the Charlotte Kimmelman Cancer Institute, and the Royal Schneider Hospital. The recovery efforts of our hospitals remain a #1 priority of the Territorial Board, the Office of Disaster Recovery, and the Office of the Governor. The Hospital Redevelopment Team. This is the separate entity the board established to manage the disaster recovery construction projects. As previously mentioned, Mr. Darrell A. Smalls, who leads the Hospital Redevelopment Team as the Executive Director of Facilities and Capital Development, is also present today and will be available for question answering. Mr. Smalls has been reporting directly to the Territorial Board while working closely with the leadership of both hospitals. We are thrilled to have the services of Mr. Smalls and feels confident he will bring the new projects to outstanding success. Since our last presentation to this body, Mr. Smalls has begun to build out the redevelopment team with experienced and talented staff, which includes an executive assistant, 2 engineers, an experienced former FEMA disaster recovery specialist, an experienced procurement specialist who's versed in both federal and local procurement processes, a project management manager framework designer with data capturing and file sharing experience, and project monitoring specialists. The team, I believe right now, is at 10 or 11 persons. The team will continue to grow as the projects progress to include additional engineers, project managers, procurement specialists, asset manager, inspectors, and other key support personnel. Before I proceed any further, I want to thank the Office of Disaster Recovery, led by Ms. Adrienne Williams-Ochteling. Ms. Williams-Ochteling has advised, assisted, advocated for, and pushed us on all recovery projects. She has met with the Territorial Board to provide information and guidance whenever we have asked her to. JFL North. The much anticipated completion of JFL North, the #1 priority construction project, is slated for this summer. Presently, the construction of the CMU building, which is an essential component that will enable JFL North to provide patient care for the residents and visitors of the island of St. Croix, is underway and will be completed by July 2022. The CMU building is a structure that will house the critically important mechanical systems, such as the water distribution system, the fire protection systems, the medical gas delivery systems, and the oxygen distribution systems. While these systems are key to the opening of JFL North, there are additional construction projects which will not impact the scheduled opening. These additional they have to be done. These additional projects include the construction of critical administration space, material storage, medical waste storage and handling, as well as the additional parking areas to support the interim operations of JFL North. As you are aware, with the assistance of supplemental funding passed by the legislature and signed into law by Governor Albert Bryan Jr., the Territorial Board of Directors has been actively involved in negotiations to lease 5 acres of land directly east of Juan F. Louis and adjacent to JFL North. This land is critical as there is no available space remaining on the existing JFL property to provide the much-needed parking, the constructions of the material storage, the medical waste storage and handling, and to run water lines. I assure this committee that we are fully aware of the disappointment and frustration that JFL North is not yet open. We are doing all we can to complete it as quickly as we can. The board shares the community's frustration deeply. Nothing would have made me more happy than to be able to come here today and tell you it was imminently opening. Originally, we had planned for the hospital redevelopment team to work only on the other recovery construction projects. We added JFL North to their duties to ensure we had a special focus of experienced professionals completing the project. Rarely a day goes by that I'm not in communication with Mr. Smalls. He comes to St. Croix weekly, often for several days, to oversee this work. If there is any way to finish it quicker, we will do so. The new Juan F. Louis Hospital. The programmatic and planning effort for the permanent replacement of Juan F. Louis has been underway for the past 7 months. The selected architectural and engineering firm, FLAD Architects, has completed the preliminary programming and design for the new Juan F. Louis Hospital with the input of the Territorial Board of Directors, the executive team of Juan F. Louis Hospital under the leadership of former interim CEO Diamond Williams, and the hospital redevelopment team. The next step in the process is to finalize the program size and then to begin with the planning and schematic design. This effort is dependent upon the final FEMA funding, also known as the fixed cost, for the construction, which is anticipated to be presented to the territory by the end of January 2022, in other words, in the next couple of weeks. Our planning efforts to date have been based solely on the preliminary fixed costs as an estimate in this initial phase. Once the fixed cost is presented and subsequently accepted by the Territorial Board of Directors, we will immediately commence simultaneously with the final design phase and the demolition planning. Essentially, our critical path, wherein we will begin to develop the project timeline for the permanent construction effort, will commence with the approved fixed cost determination. The hospital redevelopment team anticipates the issuance of demolition bid packages by June of 2022 and the final design bid packages by December of 2022. FLAD architects have been integral in every step of the way, working with members of the hospital redevelopment team and the Juan F. Louis Hospital, and we're happy with their progress as they're currently on schedule. We have a weekly update meeting with FLAD, and they have made several multi-day trips to St. Croix to gather the input of hospital staff. The Charlotte Kimmelman Cancer Institute. The programmatic and planning effort for the comprehensive renovation of the Charlotte Kimmelman Cancer Institute has been underway for the past 5 months. The selected architectural and engineering firm, EYP, has completed the preliminary programming and design for the proposed work effort to perform extensive renovations to the severely damaged Charlotte Kimmelman Cancer Institute. And with the input of the Territorial Board of Directors, the executive team of Schneider Regional Medical Center, and the hospital redevelopment team. Similarly to the new JFL project, the next step in the process is to finalize the program size and then to begin with the planning and schematic design. This effort is also dependent on the final FEMA funding, also known as the fixed cost, for the construction, which is anticipated to be presented to the territory by the end of January 2022, similar to the new JFL. Our planning efforts to date have been based solely on the preliminary fixed cost as an estimate in this initial phase. Once the fixed cost is presented and subsequently accepted by the Territorial Board, we will immediately commence simultaneously with the demolition phase to be followed with the construction phase. Essentially, our critical path, wherein we will begin to develop the project timeline for the permanent construction effort, will commence with approved fixed cost determination. The hospital redevelopment team anticipates the issuance of demolition bid packages by April of 2022 and the final design bid packages by June of 2022. EYP is the furthest along in the process of the three A&E firms due to the project being a renovation project, as the structure of the facility remains intact. EYP has been integral in every step of the way, working with members of the hospital redevelopment team and the Schneider Regional Medical Center, and we're happy with their progress as they're currently on schedule. The Myra Keating Smith Community Health Center. The programming and planning effort for the permanent replacement of Myra Keating Smith Community Health Center has been underway for the past 3 months. The selected architectural and engineering firm, the Smith Group, has recently completed the initial facility evaluation and assessment report, which provides recommendations towards the rehabilitation and/or reconstruction of the Myra Keating Smith Community Health Center. The hospital redevelopment team is currently in review of these recommendations. Once the type of rebuild is determined, the hospital redevelopment team can commence its FEMA determination activities for the Myra Keating Smith Center. Once the fixed cost is presented and subsequently accepted by the Territorial Board, we will immediately commence with the planning and design efforts. And again, as before, essentially our critical path, wherein we'll begin to develop the project timeline for the permanent construction effort, will commence with the approved fixed cost determination. The hospital redevelopment team anticipates the issuance of demolition bid packages by July of 2022 and the final design bid packages by August of 2022. While Myra Keating Smith is the smallest of all hospital facilities, the critical planning effort is as intricate as that of the other facilities. The Royal Leicester Schneider Hospital. The programmatic and planning effort for the renovation and/or replacement of the Royal Schneider Hospital has not progressed pending the final FEMA determination. The hospital redevelopment team, along with the consultants with O'Brien, submitted further information this past December, last month, regarding the damages incurred because of the hurricanes of 2017 and the work effort that will be required to bring the facility up to industry standards. We are confident with this latest information, FEMA will have the necessary information to make a final decision as to whether Roy Lester Schneider Hospital will meet the standards of a prudent replacement. This decision is anticipated to be determined by February 2022. EYP, the selected architectural and engineering firm, this is the same firm as for Charlotte Kilman Cancer Center, EYP is poised to commence with the planning and design process as soon as the final determination is provided. Once the decision is made, the next step is to develop the plans and specifications for the interim structure, which will create additional swing space to facilitate the renovation process. Simultaneously, we'll commence with the planning and design effort for the permanent renovation of the Roy Lester Schneider Hospital. Barring any further unforeseen circumstances, we anticipate preliminary drawings by November 2022. So, closing statement. I want to end my testimony today with a thank you to all the hospital workers and to all those who have supported the hospitals. This is a hard time to be in the hospital business. We are at the 2-year mark of a pandemic that everyone is exhausted with, especially hospital staff. It has posed a challenge to American healthcare like none in my lifetime. Every time we think it's ending, there's a new variant. The pandemic has affected everyone and everywhere, but perhaps nowhere more drastically than the hospitals. Locally, we are back to the double-digit COVID hospitalizations we experienced last August. There are only a handful of institutions in every community that can never close and never say no to needs. Hospitals, especially safety net hospitals like ours, are one of those critical institutions. Since our hospitals are the only hospital for their respective island, the entire community is dependent on them to be available and able to help as needed. No amount of external challenges, funding difficulties, or staffing supply or equipment shortages changes that reliance. We are always dependent on the dedicated hospital workers. I have witnessed births, miraculous recoveries, and deaths in our hospitals. I have signed do not resuscitate agreements and involuntary commitment papers. I have gone to the hospitals to visit persons who are victim of crime and who survived a suicide attempt. It is the hospital staff that takes care of all of us at those moments. It takes all the staff, doctors, nurses, technicians, specialists, housekeeping, dietary, maintenance, security, fiscal, administration, and leadership. We know they do their best under difficult circumstances, and they want to be the best. I want to thank this legislature for the support it has given the hospitals. I want to thank the governor, his staff, and especially the Department of Health under Commissioner Justa Encarnacion for the unending efforts to keep us staffed. I also want to thank my fellow board members. They have full-time jobs with significant responsibilities and demand. Yet they spend considerable hours on hospital business because they are united in wanting the hospitals to be as well managed and well resourced as possible. To all, I say thank you. This concludes my testimony. Please, everyone listening, get vaccinated and boosted. It works. I'm available to answer questions at the appropriate time. Thank you.
Thank you very much, Chairman Finch. I know, Mr. Smalls, you don't have any testimony, but I would ask that at least the JFL North, if you could just provide a little bit more of an update for our community in respect to what's going on at JFL North and any timelines that you may have established consequential to that facility. I'll appreciate it. The Smalls?
Good afternoon, Senator. I apologize. I believe you're buffering, so I did not hear your question. Can you repeat that, please?
Yeah, I just asked. I know that Chairman Finch just gave an overview regarding all of the facilities, but I wanted to see if you had a little bit more granular in regards to the JFL North, any timelines or anything else that you have established for the opening of that facility. Again, for the St. Croix community is a grave concern. So if you could provide a little bit more of an update on that specific facility, I'll appreciate that.
All right. Again, good afternoon, Senator, and I hope that you can hear me clearly because, again, you're buffering tremendously on our end. I think you're asking a question as to the status of JFL North. As the chairman of the board, Mr. Chris Finch alluded, right now we're slated for the construction to be completed and ready to move in by this summer. We're anticipating, barring any unforeseen circumstances at this point in time, that we will be ready by July. We are looking at the construction being completed. We're looking at the commissioning that is required. We anticipate that all three vendors will be working simultaneously to ensure that we can open this facility this summer.
Very well, thank you. What we're going to do is open up the floor to a 7-minute round for my colleagues. However, at this time, what I'll do is take a quick 2 minutes recess for a refresh, and then when we come back, we'll be opening up the floor. And of course, Senator Francis Heidegger, you'll be the first on that. So, followed by Senator Gittins and Senator Samuel Carrion. The Committee of Health, Hospital, and Human Services stands in recess for 2 minutes. The Committee of Health, Hospital, and Human Services is back on record. At this time, we have heard all of the testimonies from our healthcare professionals. And at this time, we'll recognize Senator Francis Heiliger. You're recognized for 7 minutes.
Thank you, Mr. Chair. Good afternoon to my colleagues. Good afternoon to the testifiers. Good afternoon once again to the people of the territory. My first set of questions is a joint question to both hospitals and the board, if applicable. I heard some inside of some of the testimony that spoke to ordering of supplies and potential cost savings. I would like to know, is there some way that bulk orders could be done collectively between the two hospitals in order to effectuate a greater savings? Because if they're both utilizing the same thing, it's one government, is it more prudent to order supplies in one larger bulk that could realize more savings? Is this something that can be done?
Senator, could I start with the answer?
Yes.
Thank you. It's been a priority of the board to push that whenever that is feasible. We haven't found many opportunities yet. What we have found is at times when one hospital is looking at a certain cost, we discover that the other hospital has actually been able to find a cheaper way to do things, and then that information is used by the first hospital to save money. One of the focuses of the hospital redevelopment team is going to be that as we develop the new facilities, we are to the greatest extent possible going to use the same equipment, so that if there's a certain brand of elevators that is bought, we'll buy that elevator brand throughout the territory. The same with generators, et cetera. That will help with being able to have supplies, to be able to, because very often these things have to be fixed from the States, with us being able to learn how to fix them locally, because everyone will be using similar items, et cetera. And if one hospital has supplies and the other one doesn't. And very recently we had that. Schneider Hospital was able to help Juan Luis out with an oxygen emergency. So we're doing that to the greatest extent possible. Okay.
And as it relates to PPP supplies, is there still a major issue with that? Are you guys figuring that out? Any one of the CEOs can share that with me. CEO Cox, CEO Commission.
Thank you, Senator. I'm going to defer, again, being my 14th day here, I'm going to defer the question over to our CFO, Chanel Morad, to answer that question for you.
Okay.
Hi, good morning. I'm sorry, good afternoon.
Good afternoon. How are you?
I'm good. How are you? So in response to your question, yes, we do continue to experience some supply chain issues, and they do affect our people. Can you hear me? Okay.
Yes.
And they do affect sometimes this delivery of our PPEs. When the COVID pandemic first started, we did, however, put in some big orders of the main necessity PPEs that we would need, the gloves, the gowns, all level of the gowns. And so we do continually monitor the level of PPEs that we have. And in addition to that, we do report daily to the Federal Health and Human Services website our levels of PPEs as well. So that is being tracked on both ends.
Okay. Is it one or both hospitals that have a bill reduction amnesty? Who's doing that one? I think I heard part of from JFL, or are both of them doing that?
Good afternoon, this is Chanel again. The JFL Hospital is right now in the middle of a 2021 amnesty program. Would you like me to explain the program?
Yes, and what are the requirements to participate in the bill reduction program?
Right, so in order to be able to participate, you just would have to have had service done at JFL through December 31st, 2021. We do have different discounts that are available based on the time of when your service is performed. And those discounts can go all the way up to 50% depending on the time frame of your bill.
Okay, Well, that's good. Is there a deadline for when this amnesty is going to be completed or finished?
Yes. Right now, the amnesty is scheduled to end on March 31st, 2022. So we do urge the community to please call into the numbers that CEO Cook mentioned. The information is also on our website as well, and we have done a few radio shows as well. Please call in and take advantage of this program.
Okay. Miss CEO Commission, as it relates to the health information database, I think it was $5 million I had read was given for this specific project. As it relates to does anyone have any updates on that?
Good.
Hi. I was hearing an echo, but I can't hear anyone now. Can you hear me?
I can hear you.
Okay, go ahead. Your mic is mute. Your mic is turned off. Oh, Lord.
ICEO, you're on mute.
Hi, thank you. Thank you, Senator. Thank you for the question, and apologies for the connection difficulties we're having right now. Yes, we did receive some funds towards our technology upgrades. It wasn't to the tune of $5 million, but we were appreciative of what we have received so far. We need to identify some supplemental funding to be able to complete that project, though we've gotten very good feedback from the governor's team, including Director O'Neill, as to the potential for some funds that have come in territory that can be used for healthcare that we may be able to apply there. And we also would thank the legislature for continuing to support us in that effort through future allotments. Thank you, Senator.
All righty. Mr. Smalls, as it relates to JFL North, can you identify to us what do you believe is the greatest cause for the delay in the opening of this particular facility? Because we've been hearing it's opening, and I think you just said July is the next date. What do you think has been the major factor as to why it's taken this long?
Good afternoon, Senator. Really, there's been a number of events that transpired from the inception of the project. Again, this is kind of a new process. When I say a new process, FEMA really has never done a temporary hospital or an interim hospital. So typically this is not a normal endeavor. So there's been a lot of hurdles that we've had to overcome. I think we've come a long way, and FEMA is definitely on board with us now. The contractors are on board with us. The funding has been made available. Even locally, the Office of Disaster Recovery has facilitated prompt payments, or what we would call early payments, to the various contractors for these long lead items that are going to be necessary for the project. So I think all of the steps are in place right now to ensure the timely completion. I really can't speak, from the initial inception of the project, but I can tell you where we stand today, that we're confident in getting this project completed.
Okay, thank you. Mr. Chair, may I ask my final question?
You may wrap up, Senator.
Thank you so much. As a representative of the people of this territory and being concerned about working environment for my constituents working at the hospitals, one of the things I had gotten complaints about and concerns about, specifically when it came to JFL, there seems to be an issue as it relates to sexual harassment, according to some of the employees. And they seem to be very concerned with the process as to filing complaints. And have you or anyone been getting any excessive complaints of sexual harassment in the hospitals? And how do you handle these situations?
Thank you, Senator. This is Doug Cook. I will begin to answer that question and then to defer to our acting Chief Human Resource Officer, Terry Lynch. Sexual harassment is taken very seriously in every organization, and as well as at Juan Louis Hospital. Since I've been here for 14 days, I have not heard of any incidents or concerns. I've held town hall meetings with staff so far, walking around talking to employees. I have not heard any incidents or concerns of that, but I will, again, to answer your question fully, defer over to our human resource, Terry Lynch.
Thank you.
Good afternoon, Senator. Terry Lynch, Acting Chief of Human Resources here at JFL. Just to reflect what CEO Cook said, sexual harassment is a very serious accusation, and we address that as one of our high priority issues if it's an employee concern. And I have to echo his sentiments. The HR department has not received any complaint of sexual harassment, I can say, for the calendar year of 2021. So if any of your constituents have reached out to you with some concerns, please urge them to make sure that they forward any of those complaints to the HR department.
Okay, so within the calendar year of 2021, which ends and begins when? I just want to know for clarity.
So the entire year until present, actually. So for 2021, which ended December 2021 until present, I haven't actually received any sexual harassment complaints.
Okay. Well, thank you so much for putting that out to the public as well. And I do appreciate you sharing that, and I will be definitely following up. Thank you, Mr. Chair, for your time. I greatly appreciate it.
Thank you very much, Senator Francis Heilig. I just want to remind the testifiers as you begin to speak, please say your name and your position. Again, all reporters are also virtual and will not be able to determine who's speaking at any given time. Before we go to the next senator, I wanted to ask the chairman of the board, in respect to the vaccine mandate, what has been the impact in terms of personnel to both facilities? If you could give them individually or overall, what has been the impact consequential to the vaccine mandate?
Senator, thank you. Chris Finch, board chairman. At the time that we passed the vaccine mandate in August, the territory had an unprecedented number of deaths. There were 19 COVID deaths that month, 15 the next month, and there was a high number of hospitalizations. One day there were 39 people hospitalized between the two hospitals, and we were seeing many days of over 20. At that point, despite then at almost 8 months of sort of education and encouragement, Juan Louis had a vaccination rate among staff that was around 50%, and Schneider had a vaccination rate around 67%. Since then, since the mandate, and it has regrettably, caused some rifts and driven some wedges. Schneider is up to 90% now, and Juan Louis up to, I believe it's around 84 or 87%. And so it has had the positive impact. The HRs can give us the number of staff separations, but they've actually been relatively low in terms of any forced separations. We have had other people who chose to resign. Another impact has also been that some of our vaccinated staff have left because of these just very, very lucrative travel nursing opportunities in the States where they're just able, in a short period of time, to make a considerable amount of money. So that's been a kind of an anticipated impact. We from the very beginning followed the federal rules of offering a medical and a religious exemption. And those are managed by the respective HR departments, and everyone with an exemption does have a testing requirement. If they're patient facing, that testing requirement is twice a week. Obviously that's a challenge these days as so many people are trying to get tested. I just in closing would also perhaps add that if we had not established our own vaccine mandate in August, by late November, early December, with the CMS requirements, we would have had to have done one then. And that was, as we know, was at least for the moment, approved or continued by the Supreme Court as of yesterday.
Very well, thank you. At a later time, we'll allow for HR to put on record the Delta, those individuals that have less left as a result of the COVID, the vaccine mandates. I must say that I've also been in communication with the OMB director in respect to the recruitment and retention bonuses, because I think it's critical that we're able to get that going and at least minimize the hemorrhaging that we have seen because of individuals going off for better opportunities. And I've been informed that hopefully by the end of this month, we should see that in place, and they'll be available to the hospital then to be able to put in place their retention and recruitment programs in their respective hospitals. I know that the governor had given $8 million to each of the hospitals for the purpose of recruitment and retention, and we're really looking forward to them receiving it so we can minimize the hemorrhaging that we have seen. At this time, Senator Gittens, you're recognized for your 7 minutes.
Thank you, Mr. Chair, and good afternoon to all. Mr. Chair, thank you so much for today's hearing, and thank you to the testifiers for your testimony and your service to our community. We have so much to discuss today, but I'm not sure that we have all the time to get to all the subject matters. So let me get right to it. And before I get there, Mr. Cook, welcome on board, and congratulations to both you and interim CEO Commission on your appointments to head our hospitals. On St. Croix specifically, let's go to that end, and maybe I can, if I can't get a response from the new CEO, of course we have able and competent individuals who were here prior. I want to know what's the status of the additional purchase of land or the lease for the St. Croix extension. There was some land needed to, I guess, put some supplies and whatnot so we could start the new hospital expansion.
Senator, I know you asked for staff, but could I answer that? That's been a matter that the board has been handling.
What's the status of the lease or the purchase? Have we decided to lease or purchase?
Chris Finch, board chair. As you know, with the gracious help of the legislature, we purchased about 3.5 acres of land previously. The additional 5 acres of land that we want to lease, we are in very active negotiations with the family that owns it. We did express an interest in buying it, but they are not interested in selling it. And so we had a board meeting earlier this week where we made some limits of spending that were given to me, and I made an offer to the family right after that, and we're waiting to hear back. But so we're in active negotiation.
Okay, so as the chief sponsor of that bill, on behalf of my colleagues and I say congratulations, and let's move forward. That's on the 3 acres that you were able to purchase. But so specifically to the lease of the land, you're saying that you're in talks and waiting for a decision right now from the family?
Right. The family made a new offer to us about a week ago. The board authorized a counter offer. We made that this week.
Okay, and I just want to say, and I'm going to be candid because I have no time to be kicking the can down the road. I'm not being personal with anyone, but I'm going to say that this is a matter of life and death, and if we're going to be playing Russian roulette, I am going to be the first to encourage that we, if we have to move for eminent domain, that we do that and get survey the land and pay the amount for what it's worth and move forward. But we can't continue to hold the people of St. Croix and the people of this territory hostage. Next off, do we have any echo techs on St. Croix just yet? It is my understanding that we have not had any echo tech at the St. Croix Wang Louis Hospital since July 1st. What's the status? Short answers because I have a lot to ask.
Thank you, Senator, for the question. This is Doug Cook, CEO of JFL. Currently, we do not have any echo techs, permanent echo techs on the island, and we are not able to provide that service. We are actively seeking both regular staff and also agency staff to provide that service for us.
So this will be one of your tasks to try to lure echo tech to to St. Croix, this district?
Absolutely, it'll be at top of the list along with many other areas that we need, staffing areas.
Thank you. Next up, and probably the chairman could also let us know, since you just arrived, Mr. Cook, why are we so dependent on what you call locums tenens? Why don't we, or answer that first. Why are we so dependent on locums tenens?
Thank you for the question, Senator. This is Doug Cook, CEO of JFL. This is a problem across the country. There's a few reasons for it. We have an aging population of healthcare workers across this nation, and JFL, or the Virgin Islands, is no different in that. Along with that, we don't have as many people going into the nursing and medical professions, also causing a gap here in the ability to provide these services. And finally, we have, and again, across the country, we have many of our nurses, technologists, et cetera, leaving their regular jobs in favor of more lucrative traveling assignments where they can go across, see the rest of the country. They can basically pick anywhere they want to go. That does come with challenges for them personally, but we're finding that many people are choosing that type of an environment.
So let me ask this then. How many locums tenens do we have versus actual direct paid doctors employed with the Wang Louis Hospital?
Currently, we have 28 Pafford staffing nurses and EMTs for our location, and we have a total of 502.
Mr. Cook,
Yes.
Directly, I'm talking about locums tenens, the doctors. How many locums tenens doctors do we have versus our own doctors working for Wang Louis Hospital itself?
Thank you for the question. We have no locum tenens physician. Sorry. We have a full 28 full-time physicians, and we have to get back to you on exactly how many locum tenens physicians that we have currently.
Time.
Now, if I may wrap up here until the next round. Now, I'm just wondering, and I want to get the number of locums tenens that we have, because my question is, why not pay the doctor directly instead of paying the company that the doctor is working for? We actually pay the company the doctor's salary plus 30% on top of that. And I was wondering if can't we, to cut costs, hire them directly and have them work for the hospital, and the hospital will in return do the billings of these doctors, or the doctors do the billings themselves. So I'm hopeful for you to get back to me with the number of locums tenens. Thank you.
We will.
Thank you very much, Senator Gittins. Next, the chair will recognize Senator Carrion. You're recognized for your 7 minutes.
Thank you, Mr. Chair. Good afternoon once again to the people of the Virgin Islands and to the testifiers. I would also like to join my colleagues in congratulating and welcoming the CEO for GFL. Mr. Cook, welcome. And also Attorney Commission, thank you for accepting and taking the helm there at Royal Leicester Snyder Hospital. Moving right along, I have a question in regards to employees. I've been told that they are exempt and classified employees that as yet have not received the correct step. In other words, they have not received their 3% compensation, as well as some classified staff who are not placed in the right union. Can JFL, can the CEO or someone from his staff please expound and explain why this hasn't happened?
Good afternoon. This is Chanel Moorhead, acting CFO. So I'll take that question. Yes, JFL still has to implement the raises that were negotiated by the Office of Collective Bargaining. Those raises, of course, are dependent on the availability of funding. And so we are currently looking at our budget to see what we can implement and be able to sustain. That's something that I'm working on with the internal team. I have spoken to Director O'Neill of OMB, and so I will be reaching out to them at some point through our board process if additional funding will be needed if we're not able to sustain that through our current budget.
Timeline.
I'm sorry, can you repeat that?
Timeline.
So I'm hoping that we're able to do something by potentially the summer, but it's very hard for me to give you an actual date until I'm able to really secure the funding and be able to sustain.
But why does it have to take so long? I mean, if funding is the issue, you can reach out to this body, but why are you taking so long?
Good afternoon, because we need to be able to implement, give the retro that is owed, and also sustain it. So I need to look to see where we are with the revenue generating activities that we can do currently. We are expecting to be in the JFL North around the summertime, so that should increase our revenues, hence the reason why I'm saying potentially summer, where I can comfortably say that with the funding that we have, we can implement and sustain.
Well, we need to work and doing good to these employees who've been working so hard in JFL and deserve this step increase and this compensation increase. What about those that are not in appropriate union? You have supervisors that are still as SIU and not as SW and not an appropriate union. What's the hold up for that? Quickly, I don't have much time. That's for JFL. Concentrating on St. Croix. I'll let my colleagues in St. Thomas concentrate on Snyder's Hospital. CEO, Mr. Cook, as part of your leadership team, do you have anyone from HR that could answer that?
Hi, good afternoon. Terry Lynch, Acting Chief of Human Resources. Again, specifically in response to your question about employees being placed in the right union, to my knowledge, every employee that is hired is placed in the union that their job description or their position calls for. And similarly to what I said to the senator previously, if there is a specific issue or concern that an employee has with being placed in the right union, I would welcome that employee to have a direct appointment with me in HR so that we can address their concern.
Well, I've received numerous calls from various employees who are not in the right union, specifically supervisors who are not in the right union. So I would ask you that you recheck your list and check the placement of these employees, because they should be in the right union to have the protection that they need and the benefits that they need. Going back to the CFO, I want to talk with regards to billing, because we've also received multiple reports of individuals, and even from this very institution, who have been having billing issues. What is the billing process, and why aren't we billing the employees and billing them as delinquent when we haven't billed them in the first place? What's the status with your billing process?
Good afternoon, Chanel Moorhead, Acting CFO. Currently, our billing is done with a hybrid process of internal and we have an external biller. Right now, our billing process, we make sure that we run through we make sure to look at the coding. We make sure that everything is being captured appropriately, and we're able to capture all the charges that are available based on the type of procedure that's performed. That goes through the process that then gets sent off to the billing company, who puts it through their clearinghouse and then sends the bill out to the different insurances if insurance applies. Once the insurance does pay or provide an explanation of benefits or an EOB, then the bill can then be dropped if there is a balance on self-pay to the patient, and then at that point you will see a bill. If there are any issues in terms of delinquent physicians, in terms of coding, et cetera, we do work with the medical director's office to ensure that we're in constant communication with our physicians to make sure that our bills are not delayed in going out the door due to any delinquent coding or delinquent physician signing off, as well as we look to make sure that we always have to double check to make sure that everything that's going out the door is as accurate as possible. So it does take some time. And I do want the community to understand that as soon as you leave the doors of JFL, you're not going to get a bill the very next day. It does take time for that bill to drop.
Mr. Chair, is Ms. Moorhead listening?
Ms. Moorhead, please, the senator is trying to get your attention.
The insurance companies.
Yeah. Go ahead.
I thought I was on mute for a second and you weren't hearing me. Ms. Moorhead, I'm listening to what you're saying, but the issue that we're constantly hearing is that patients are not being billed, and they're being billed in the second half as delinquent. So what's the time frame? You guys have to work on that time frame, because if we have a funding issue within JFL, part of it has to do with your billing process. You're not billing on time, and then we're establishing these amnesty programs because we're not billing on time. And then when we're billing clients, customers, patients as delinquent, when in fact they never receive a bill in the first place, I should say. So that needs to be corrected. And time after time, JFL comes before this body. We say the same thing and we hear the same process, but nothing is being implemented and nothing is being changed. So we need to see this corrected as soon as possible. That's what I have to say in regards to that. Mr. Small.
Can I please respond?
No. Thank you very much. I think I've heard your process. You mentioned about the process. I have to move on. My time is running. Mr. Small? My time didn't call.
Good afternoon, Senator.
Yes,
Darrell
I just would like to know, I heard in the chairman's testimony about your staff that you have. So what's the size, the number of your staff, and he also testified about additional staffing. What's the amount of additional staffing that you will require?
Again, good afternoon, Senator. Darrell Smalls, Executive Director, Redevelopment Team. Currently, we have on board 11 members across the territory, 5 in St. Thomas, 6 in St. Croix. The additional staffing, I would anticipate perhaps upwards of about another 10 individuals as we get all of these projects online. We're talking about inspectors, we're talking about additional engineers, asset management, other individuals to help us with the procurement process. So right now, I would say we're going to at least double the staff.
Double the staff. Thank you very much. Thank you, Mr. Chair, for the leniency.
Thank you. Thank you very much. Senator Carrion. Senator Gittens, you recognize for your point of inquiry?
Thank you, Mr. Chair. Mr. Chair, on the line of questioning that my colleague just asked about the billing, I wanted to ask about the Omnicell machines that they have there, because if we're talking about the billing process, are the patients being billed properly and utilizing the information from the Omnicell machines? Are they working? That's the question at the Wang F. Louis Hospital and at RLSH.
Good afternoon. This is Chanel, acting CFO. Yes, the OmniCells are working. We actually did get some new OmniCells in, I believe it was in late 2020, and those OmniCells were officially transitioned over, and so we are using the OmniCells effectively.
Okay. Up to when I was at the Wang F. Louis Hospital, I was told that those machines are not operable. So, Mr. CEO, the new CEO, I'm asking if you could look into those OmniCell machines to see if they are working. Thank you.
Thank you, Senator.
Thank you. Thank you very much, Senator Gittens. Before we go to Senator Johnson, I wanted to ask, is the legal counsel on the line? I need to get a situation where a payment for a judgment or settlement is pending. What is the timeline in getting that taken care of? Is the legal counsel on the line? Ms. Thomas, Attorney Thomas?
I'm here, Senator. Good morning, or good afternoon.
Good afternoon. Yeah, I was inquiring about settlement or judgment, employee settlement and judgment. What is the timeline to get that paid up, or have it been taken care of?
Not sure what case you mean. There are several cases and judgments and orders. Which case you're?
I guess I'll take that offline so that we don't put employees' information on the record here. So I'll contact you offline to have a discussion in respect to that. Thank you.
That's great. I'll be happy to answer. Thank you.
Very well. At this time, we'll recognize Senator Johnson. You're recognized for your 7 minutes.
Good afternoon. Thank you very much, Mr. Chair. Good afternoon to all the testifiers. I first would like to start and say thank you to you and your team. Throughout the pandemic, caregivers have remained on the front line. And I want to say thanks to all of them for all what they have done with their selfless service. I also would like to welcome on board Mr. Cook and Interim Commission. I really want to welcome you guys. You guys have stepped up to the plate. And the task that you guys have taken on is no easy feat. Mr. Cook, I saw in your testimony you referred to transforming a hospital in southeast Wisconsin. What would you need, or what would it take to bring Governor Wang Louis Hospital Medical to the next level?
Thank you, Senator, for that question. This is Doug Cook, CEO of Wang Louis Hospital. It's a question that probably could be answered over an hour conversation, but to make it brief, there's certain things that need to be done. Number one, you need to ensure that you have the right people and the right resources available to your organization. Second thing you need to do is we need to standardize processes. And what that means is that's reducing variation out of the care delivery system and making sure that we're following best practices, whether it be CMS or there's other quality bodies out there. We need to make sure that we're following their guidelines on the delivery of care of our patients. And the next step we need to do is actually monitor your work. We need to have metrics in place that continually support and are reviewed often to see how we're improving or where else we need to improve. And then if we need to make changes, we need to make those changes, re-educate staff or hold people accountable for implementing and sticking to the standards.
And with all honesty, what do you think or have you observed in the short time that you've been here is lacking at the institution?
Thank you again for the question, Doug Cook, CEO of Wang Louis Hospital. In the short time that I've been here, we are really in the investigation phase and the evaluation phase of what is needed here at Wang Louis Hospital. So it would be premature of me to start stating things that I think that are needed here. Because I haven't been able to give I wouldn't be able to give a well-rounded answer to that. I can tell you in the short time that I've been here, the incredible staff of nurses and technologists and doctors are working tirelessly on dealing with all the influx of COVID patients through our emergency room, through our inpatient areas, and that is really their focus at this point. We need to get through this pandemic and surge, but our continuous need to focus on improving the care to our patients in this community needs to be our top priority.
And staying on the line with COVID, I'd like to ask both hospital CEO, what's the total number of ventilators do you guys have on hand on each island? Total number of ventilators. As you know, we just had a spike, and we were blessed that this spike was not as devastating as the Delta and the other type of stuff that we had there. So what a number of ventilators do you guys have on each island? Starting with Mr. Cook, if anyone in your staff, a team could tell us.
Thank you, Senator. We are actively looking for that number right now.
CEO St. Thomas, if St. Thomas have that information, can they go ahead?
Sure. Yes, Senator. We currently have 48 ventilators on site that we can use for critical patient care. Thank you, sir.
Thank you very much. And Cook, you got the number yet?
For Schneider.
Yeah, sure. Good afternoon, everyone. This is Hazel Silva, Chief Operating Officer for JFL. We currently have 25 ventilators here at JFL and an additional 15 ventilators that were donated to us from the national stockpile.
So your total, you said 25 and how much, 15?
25 and 15. That
Okay.
brings us to about 40 ventilators here at the institution.
And you guys have reached your peak. Have you reached peak in any other hospital with folks in the hospital when it comes to COVID? Have you, the hospital maximized, reached its peak? Both sides?
Tina Comas-Young for Schneider Regional. No, we have not reached our maximum capacity. We have had surges with quite a number of inpatients, but we have not reached our maximum capacity, sir. Thank you.
Wang Louis?
Good afternoon. Doris Plaskett, Chief Nursing Officer, Juan Louis Hospital. We currently have in our critical care unit 11 operating beds that we can use for COVID positive patients. We have not reached that peak.
Thank you very much. And Mr. Small, good afternoon, Mr. Small. I would like to get a little information from you. What size hospital can we anticipate getting, and how many beds on the island of St. Croix with this new bid that we're planning for?
1 minute.
Good afternoon, Senator. Darrell Smalls, Executive Director. Currently, based on the census that we're looking at right now, we are looking at a facility in the neighborhood of about 116 beds. That is 116. But we're also designing the facility that should there be a need for a surge capacity, we're developing private rooms, in other words, single occupancy. The way the hospital is being designed, we'll be able to go to double occupancy if we had a surge.
Thank you. And St. Thomas, what's the status with the Roy Lester Snyder with this rebuild? What's the status? Where are we with it right now?
Where we are as it relates to the Roy L. Schneider Hospital, Chairman Finch presented it in his testimony. We're probably about a month away from a final determination from FEMA. We were asked for additional information this past latter part of the year. It was submitted just before the end of the year. It is currently under review, and we're looking for a favorable review of all of the information that is necessary.
Thank you very much. And Mr. Chair, I may wrap up with this last question.
You may wrap up.
Thank you very much, Mr. Chair. For the finance operation, what is our collecting rate, or what is the amount you receive versus the amount you have billed?
Good afternoon. This is Chanel Moorhead, Acting CFO of JFL. Our collections rate for fiscal year 2021 was actually 36%, and that is up from the last years that we've had. In fact, the highest rate we've had that's even close to that was what it was prior to the storm in 2017, which was only 34%. So we're actually doing very good in our billing.
And St. Thomas, same question? 36.
Yes, sir. While we don't have that specific number available right now, Tina Cummins Young for Schneider Regional. While we don't have that specific number in front of us right now, but we will get it to you. Our estimate is between 35 to 50% of what we bill, and that's based on contractual adjustments we have with various payers, as well as our ability to collect on self-pay accounts.
Yeah,
Thank you.
we're having a little bit difficulty understanding you, ICO.
Thank you. We'll continue to try to work on our connection on our end.
Either get a little bit closer to the device,
Get a little
or
closer to the
I
mic.
think the mask is muffling you a bit.
Yes, sir. I hope this may be a little bit better. We're having connection issues.
That's perfect.
For Schneider Regional, Tina Cummins Young. We don't have the specific percentage in front of us right now, but we know that it's somewhere between 35 and 50% of what we bill we're able to collect. That's based on that we have contractual arrangements with various payers and based on our ability to collect on our self-pay accounts, sir. Thank you.
Thank you very much. Thank you very much, Mr. Chair. But I would like to, conclude with saying that these are some of the problems that we continue facing in this territory with, everyone said we have a financial problem. We really don't. We have a collecting problem. And until we find a dent into that collection, we will continue having these problems. So I hope that you guys could do a lot better with that collection, and that will help the hospital to go a much longer way. But I really want to say thank you guys for all what you're doing and the team that have been there diligently throughout this pandemic. Thank you very much. Thank you very much, Mr. Chair.
Very well. Thank you. Thank you, Senator Johnson. Senator Viale, you're recognized for your 7 minutes at this time.
I'm ready. Oh, thank you so much. I was having a next conversation in reference to healthcare, so I'm sorry. Let me begin with, I read a board presentation from both hospitals, and I saw where the Snyder Hospital was able to utilize those federal funds to expand availability of rooms for COVID. And I want to ask Wang Louis, what is the status of the facility at Bethlehem, at the National Guard, where we spent some $8 million for overflow of patients? We're in the middle of a spike. Well, what's the status of that facility, the overflow unit?
Thank you, Senator. Doug Cook, CEO, Wang Louis Hospital. I will direct that question to Hazel Filbert, our Chief Operating Officer.
Okay, good afternoon, Senator. I'm Hazel Filbert, Chief Operating Officer. In terms of the RTI, this was identified during 2021 as an alternate care facility for the hospital. And it was outfitted, but this was under the jurisdiction of the Department of Health as well as VITEMA. So in terms of the next steps and plans regarding the RTI, I would rather defer that. Well, presently the DOH is not there, but I think they would have more information. We've been in active discussion in terms of the RTI, in terms of additional capacity for the hospital. But at this point in time, we've never commissioned the RTI in terms of using that as an alternative care facility for the hospital. But we've had several discussions to include a tabletop exercise that was held last year
Okay, so
in terms
hold
of
up there.
identifying the things that would be needed. We did identify.
Hold up, ma'am. The long and short, the RTI can be used. Tabletop exercise doesn't allow for you to be able to utilize a facility. Okay, you're still speaking. You need to. I don't know if you're hearing me.
CEO Filbert, the senator was trying to get your attention and responded.
As any other.
Okay, thank you so much. I didn't realize that you were still speaking. The reality is that the $8 million we spent for the facility at Bethlehem has never been used, cannot be commissioned. There's no oxygen. The facility cannot be used. And the hospital in St. Thomas Snyder Hospital wisely utilized their monies to be able to add capacity at their hospital and was able to add 20 plus rooms at the Snyder Hospital that can be utilized any day of the week. But in the event that there's an overflow on St. Croix, the plan was that those patients are going to be shipped to St. Thomas. And it's a crying shame that we did not do what we had to in terms of the feasibility of having a site at Bethlehem that has been built, has never been used, and is being decommissioned. So $8 million gone and $2 million of government money. Literally a waste of time. Ms. Lynch, in reference to onboarding of nurses, I'm consistently hearing the complaint of nurses who have passed NCLEX, who have applied for a position but can't get an answer back for weeks. And some of those individuals taking other positions in other healthcare institutions. What is the issue with nurses who have passed NCLEX and submitted all documentation to Wang Louis as to why it takes so long to get them hired when we have a shortage of nurses? What is the issue?
Good afternoon. Terry Lynch, Acting Chief of Human Resources. Senator VLA, I can't speak to a delay specific to the local nurses that have submitted. Actually, we are very passionate about onboarding our local nurses.
We have individuals. We have, Ms. Lynch, 1 minute. I'm hearing that all the time. Ain't no passionate this or that.
Is the completion of our comprehensive background check, along with making sure that they have
hold
all
on, Ms.
regulatory
Lynch. Somehow we're having some difficulty in reference to connecting. My question was very specific. Every time a question is asked, we hear these long, real professional responses. But the long and short, we have individuals who have passed NCLEX, have submitted all of the documentation, and have not been hired. And I know more than one. And there's some related to members of this body. I know more than one that have applied and they have not received a response back. And we cannot be in dire need of nurses, and we have individuals who pass NCLEX, apply, and then they end up going to work to Frederick Health Center or a next facility because they cannot get a response. And the excuse is the same consistently. And these individuals are coming and saying, I applied, I passed NCLEX, here's all my documentation. If the hospital is serious about expanding the nursing base, then HR got to do a better job by getting those individuals on board, or we are not going to be able to expand our base. We got to do a better job. And these are some local nurses that I know. Mr. Finch, and I'm hoping we're able to get the communication. I see that we have an interim CEO for the St. Thomas Hospital. What happened to the person that was selected for the position?
Senator, that person's current employer did what they had to do to get the person to stay.
Okay, so the person refused?
Yes.
Okay. How many finalists do we have?
Presently?
No, when you had 3 finalists, correct?
Correct.
Did one of your finalists submit fraudulent documents to the board?
There was a question. Those were explained to our satisfaction. So I would say no.
So you're saying that what was included in the resume in reference to that person's service at Wang Louis Hospital that was verified by the doctors at Wang Louis that that person never served in that capacity was not fraudulent?
We had that person's former boss, the former CEO. I believe that we can argue with the specific language, but the CEO, person's CEO at the time, satisfied our questions. But we did not choose that person.
You did not choose that person because the documentation was false. And we need to do a better job in terms of vetting individuals. The documentation were false, and it was verified by members of Wang Louis who have worked at the hospital for more than 20 years. And I don't want to get into the specifics, but I know as we move forward, we need to make sure, because of the importance of healthcare, that every single person that is vetted for that position meets all of the qualification. Because the individual with the false documentation was recommended by the executive branch for that particular position. And God would not have been able to help Juan Louis Hospital. So as we move forward, we need to make sure that we thoroughly vet those individuals. And it's easy to vet those that say they have service at any of the hospitals, at both hospitals in the territory. Thank you, Mr. Chair.
Thank you very much, Senator Viale. Chairman Finch, you had a response?
I was just saying that I agree with the senator. About that the need to do thorough vetting.
Correct. Very well. Thank you for that. The chair will now recognize Senator Whitaker. You're recognized for your 7 minutes.
Good afternoon. Good afternoon, Chairman. Good afternoon to the listening viewing audience. Good afternoon to the testifiers. I want to first also join in welcoming the new CEO of the Juan Louis Hospital, Doug Koch, and I really look forward to hopefully some change efforts by way of management and just execution of a lot of policies that need to come. But I will first want to go to Chairman Christopher Finch. Specifically, I just want to dive in real quick. You said that the board has regular meetings, and one of the things that as many board chairs know, many different departments and agencies that have boards, I'm a stickler for information coming to the legislature about meetings, but also just in the general public. When are you using the same methods of sending it out to the media, social media? How does the public would know about specific meetings that they can most participate? We understand, of course, there's sensitive information being shared, but certainly some of the public information that can be shared through your meetings.
Senator, the best answer is that to the greatest extent, the territorial full board meets on the first Wednesday of every month starting at 3:30 p.m. And we've been meeting virtually for quite some time now. We do send that out to the media. I do see that in the media. There's certainly aspects relating to contracts, to legal matters, personal matters that we do in executive session. So typically but we start as a general session.
I would suggest, as you can look outside to other boards and in our government, that some of which are adhering to real outreach to the public and information. Right now, I hear you, but I really don't see that level of engagement with the public, and it's really critical. With that, one of the requirements by law is patient satisfaction. We know we hear, we feel a lot of complaints, a lot of concern as a community where we're hurting with respect to our hospitals. Can you please advise of the status of the CMS requirement to do patient satisfaction surveys? When is the last time both hospitals have conducted such surveys?
Thank you, Senator Doug Cook, CEO of Juan Louis Hospital. I will give a few remarks and then turn it over to Hazel Filbert, our Chief Operating Officer. Juan Louis Hospital does concurrently do patient satisfaction surveys. We use a company called NRC. After a patient is discharged from our organization, that patient is contacted, I believe it's via phone call, where they are given a series of standardized questions and able to also give comments if they want to recognize people for good work, or if they want to leave a concern, they're able to leave those comments as well. I will now turn it over to Hazel Filbert for additional comments. Thank you.
Good afternoon, Senator. Hazel Filbert, Chief Operating Officer of the hospital. CEO Cook has also given you a very good summary in terms of the patient satisfaction, and we also call it patient experience monitoring. This is done with using our CMS certified vendor, which is NRC Health. And there's several areas which are monitored through the patient experience reports. As CEO Cook indicated, the survey takes place via phone primarily. It happens about within 6 weeks of discharge. We do have an internal process where our discharge information goes through over to NRC Health. But just for time, but hold on,
but for time purposes, just because of short for time, I just want to know when. So the survey is being conducted regularly. So you can confirm, and you're testifying that the surveys have been done regularly, and up to this year, we have surveys, from last year, the year before, and it's being consistently done. That's all I need to finalize. That the surveys are.
Yeah, that's.
Okay, thank you.
That's correct, Senator.
Thank you. Thank you very much. The only thing is, of course, I'm looking for some of that information. No, other hospitals report that, and I know it's right, which I did, my staff and I did. We didn't find information that would lead us to that answer other than your testimony today. So you have to definitely work on that public component. You're doing that work, but it needs to come out so we can have that information. To see the CEO, Koch, and please, if I butcher your name, please correct me. What are your plans? So we know now we're compiling all that data. You said it's happening, and of course you're new, just started. What are going to be your plans to improve the scores? We've there's hospitals some have 4 out of 5. Juan Luis is about it's not it's 1 out of 5. It was for older surveys that I was able to find, not more recent ones. How do you intend to improve the scores overall?
Thank you, Senator. Doug Cook, CEO of One We Hospital. Patient satisfaction is, something that is near and dear to my heart. We're taking care of our family members. We're taking care of the citizens of St. Croix, and each of them deserve the very best health care possible. As we monitor and we start digging into the actual meat of the patient satisfaction results and looking at what the expectations of our patients are that we are not meeting, that is what we truly start to look at how we make changes within our operations. Specifically, one of the things that I want to focus on is ensuring that our doctors and our nurses and our staff all feel supported by this administration, that they have the right resources, they feel that they are valued and respected, and that their input into what they believe we need to do to improve things is heard and clear by this administration.
Thank you, and we look forward to seeing those results. Workforce development, that's there. I'm going to drive down. Tina, interim CEO Comisión, and I'll circle back to you, CEO Koch. The both questions for both of you. In terms of workforce development, in your testimony, I was quite pleased in your expression that you're going to re-engage in the Department of Education. But what I will say to both you and CEO Koch, you have to work a lot more strategically. I hear a strategy coming from the Snyder Hospital. Can you lay out efforts from this hearing going forward, what you're going to do to engage not just the Department of Education, when we talk about a holistic effort for all the stakeholders, the board, the CTEC board, the Workforce Development Board, Apprenticeship Council, the list goes on, and engagement even with my own committee, the Committee on Education and Workforce Development. Can you tell me some next steps to achieve workforce development?
Yes, Senator Whitaker. Tina Comisión for Schneider Regional. Thank you for the question. This year, that's going to be our major focus, developing our staff, recruiting staff, retaining our staff. We're going to continue where we continue to work with. We're going to continue to work with the local skills centers and with UVI to develop nursing staff and other allied health staff. And we're going to continue to look at how to develop the pipeline where we're attracting persons earlier in their career into wanting a career in medicine and in the clinical fields. And I would like to let our Vice President of Human Resources, Ms. Ralda Mason, add any additional initiatives, as a lot of this work will be spearheaded under her leadership.
Well, my time is called. Chairman, if you let them conclude. Chairman?
Yes, she may respond on my time, Senator.
Thank you.
You may respond.
Good afternoon, Ralda Mason. Good afternoon, Ralda Mason, Vice President of Human Resources, Schneider Regional Medical Center. We have dedicated staff to recruitment efforts that we plan to engage Department of Education. To see how we will be able to incorporate some of our clinical programs with them and move forward with our high schools.
Great. Well, thank you very much. And I just continue to encourage not just the Department of Education, you have to get all the education stakeholders. So I will be following up with you all and making sure it's holistic. And thank you very much. I also wanted to hear from CEO Koch, Chairman, if we can hear him just respond about workforce development.
Senator, your time has been
Thank you,
called.
Senator.
Please wrap up.
Yeah, just allow the other CEO for the other hospital, St. Carlsville, to Wong Lee Hospital. Thank you.
Very well.
Thank you, Senator. Doug Cook, CEO of Wong Lee Hospital. Workforce development, our employees are the key and are a vital component of providing good health care here. And so we need to do everything possible to attract and retain good people. Part of that is through making sure that we're paying them appropriately, but we also have to find ways to attract them differently. I think it's very important that we work closely with UVI. Very pleased that I've already had conversations with them with regards to their simulation center that they have here, or is currently under construction here on St. Croix. That will provide not only the tools necessary to continue to re-educate our current employees, and also to create a pipeline to attract new nurses and technologists to our community.
Thank you. Thank you. Thank you, Chairman.
Thank you. Thank you very much. At this time, the chair will recognize Senator Fred Gregory. You recognize for your 7 minutes. 7 minutes.
Thank you, Mr. Chair, and good afternoon to the testifiers, and good afternoon again to my colleagues. I'm going to start with first welcoming Mr. Koch to the U.S. Virgin Islands, and I wish you well in your endeavors, and it is my fervent hope that with your leadership, the hospital in JFL Hospital and the St. Croix District will be better for it. Now, let me ask you, you specifically noted, I think one of my colleagues asked, when will the JFL North be ready to be opened, and you noted July. And I specifically recalled last term, there was a significant amount of discussion around JFL North and the fact that once JFL North opens, that there will be a requirement to fill a number of positions. So I need to find out from you today, where are we with the recruitment process in ensuring that once JFL North reopens in July, or opens rather, in July, that we're not having another compounded problem or compounded discussion around now, how do we ensure that we are able to staff up JFL North?
Thank you, Senator. Doug Cook, CEO of Wong Lee Hospital. Currently, we have 502 employees on staff with Wong Lee Hospital. I'm going to turn things over to our Chief Human Resource Officer, who can give you more specifics about what the projections are for JFL North and the staffing requirements.
Please feel free to just answer, because when you answer and you don't give the information, the time is running. So, Lynch?
Absolutely, Senator. In talking with Chief Human Resource Officer Terry Lynch, I believe the number is close to approximately 900 staff that will be needed for the support of JFL North. So hopefully that answers your question.
What are the recruitment efforts, and where are you? Because once JFL North reopens, sorry, I keep saying reopen, once it opens, then we're going to have another compounded issue if we don't address this issue now. So what are the efforts? What are your efforts? What's the efforts of your HR division as it relates to bringing on the personnel necessary for JFL North? Before we know it, it's going to be July of 2022.
So good afternoon. Terry Lynch, Acting Chief of Human Resources at JFL. In terms of recruiting initiatives so that we can meet our goal for both current JFL and JFL North, With Mr. Cook onboarding, we've already begun pursuing initiatives in terms of giving the additional resources that we would need on the recruitment side. Currently, we have recruitment campaigns using our social media, using Indeed, advertising locally. We're advertising in industry-specific journals so that we can capture those. So we have a multi-pronged approach to meeting our recruitment goals.
We've heard this before. I just hate to say this. And we continue to be frustrated by this. We've heard this before. We had it Indeed. We've heard all of that. I am trying to get more specificity around the recruitment. Are you being successful? You know, what are your challenges? That's the conversation I'm trying to have. You know, we spend a lot of time. You guys answer these long diatribe, but you're not giving the information. We've heard this before.
If I may, what is a new development in addition to what we discussed before?
One at a time, please, Ms. Lynch. Ms. Lynch.
The current ongoing.
Ms. Lynch, please wait for the senator's question. All right, one at a time.
Lost all of my time trying to get this one question answered, and I really want to discuss St. Thomas. Go ahead, Ms. Lynch, with your answer. We're just trying to figure out what's happening. We've asked this question. I sat in the 33rd. We've asked the question. I'm now in the 34th, and we still hear about Indeed and all those other things. I need specificity, please. What are your success rates? What's going on? Do you have any commitments? That's what we're trying to get from you.
We do have ongoing challenges nationally in terms of healthcare recruitment with the pandemic. If you're asking what are the challenges remain trying to remain competitive with the salaries and compensation packets that are being offered for crisis assignments for COVID. It's gotten even more challenging since we last spoke. There's a lot of healthcare workers that have left to seek those higher compensation offers in terms of even the.
Thank you for your response. Thank you for your response. Thank you for your response. Mr. Koch, you have work to do, and information like this, you need to be providing it to the legislature when we ask the question. These types of questions need to be asked and answered in a meaningful way, because at the end of the day, when this situation balloons, you're going to come right back to this body. We're going to be having the same conversation that we've been having for all of 4 years, literally. Let me go to St. Thomas St. John.
1 minute.
Mr. Smalls, could you give me an update on what's occurring with CKCI? I know that we did a walkthrough sometime last year or year before, last year, and I need to get an update around CKCI.
Afternoon, Senator. Right now, where we're at is we have completed the programmatic design, which is the essential component to getting the facility completed. Right now, what we're waiting on is the fixed cost determination, the actual dollar value. We anticipate receiving that information by the end of this month, January, after which we can go to full-blown design and go to bid. Right now, that is the project that we foresee that will come online in terms of permanent construction as early as beginning this summer.
Good news. All right. Mr. Finch, I heard in the discussion when Mr. Koch was asked the question. May I proceed, Mr. Chair?
You may wrap up, Senator.
Yeah, I have to wrap up because they used up all my time saying much of nothing. Mr. Finch, I'm trying to establish from the board, the territorial board, are you looking at standardized practices across the hospital for delivery of care?
We will be, Senator. We have been focusing on policy and procurement standardization so far.
Will be. What does that mean? What does that really mean? I mean, I'm not sure. This conversation is very frustrating. I mean, every time we come, the healthcare comes before us, is always with will be. We're working on it. When is it going to be? That's the issue. It's frustrating.
Senator, if I understand you correctly, the standards of care are pretty much already set and similar. It's set by our regulatory body. When I'm talking about policy development, I'll give one example. When we did the recent emergency allocation of care in case we got overwhelmed by COVID, we made sure that we wrote a policy that would be the same for both hospitals. When we're looking at patient discharge policies, et cetera, safety policies, the board has been focusing that to the greatest extent possible, we should have the same policy across the territory. On the procurement practices, we've implemented a procurement requirement and holding both hospitals to follow it that'll pass local and federal muster.
Thank you for your response. And Mr. Chair, can I ask one final question, if you would allow me, please?
You may, of course. Go ahead.
You may, of course. Go ahead.
It's tied to the presumptive eligibility. I know that we've had challenges with presumptive eligibility at our both hospitals in relation to the relationship with the Department of Human Services. So I am trying to find out today if that process has improved. So I'll first hear from Snyder Regional, and then I'll hear from GFL. You can answer on the chair's time. Thank you, Mr. Chair, for the time.
Thank you. Thank you very much, Senator Fred Gregory. Is there a response?
Good afternoon, Tina Cummins-Young for Schneider Regional. So we, at Patient Access, we are registering every eligible person who comes for services who is not otherwise have insurance for presumptive eligibility through Medicaid. We do still have to work to get the persons who we are enrolling for presumptive eligibility, work with Department of Human Services to get them to complete those applications so that they will be fully enrolled in Medicaid and can use it beyond the initial period of approval. And so that's something that we've worked on, and we thank Chairman Finch for his support in that endeavor, because we know it's really important to get as many individuals in the territory covered with that insurance as possible. Thank you, Senator Fred Gregory.
Good afternoon. This is Chanel Moorhead, acting CFO for JFL. JFL is doing the process as much as the same as Schneider. Our patient access department makes sure to register each patient appropriately, and if they do not have insurance, we do try to qualify them as best as possible for presumptive eligibility. We also do have the same challenges in terms of making sure that those patients are able to actually convert to full Medicaid coverage within the timeline so that they do not get penalized in the future. In doing so, we were able to work with Chairman Finch to get the gift card incentive program, which allows for a patient to produce their Medicaid coverage card to JFL, and we'll give them a gift card, a Visa gift card for $50. So that's been working as well.
Thank you very much. Before we go on to the next senator, which will be Senator Carla Joseph, I wanted to ask you, Acting HR Director, Ms. Lynch, how many individuals have been hired at JFL since your last budget hearing on June the 30th? And in what positions?
Hi, good afternoon. Acting Chief of Human Resources, Terry Lynch. Senator, I can get that specific information to you because I don't have readily for the specific hires in front of me right now, but I can get that information to you.
Very well. If you could have that before the hearing is completed, I'll appreciate it. Senator Gittins, you recognize for your point of inquiry or point of information?
Thank you, Mr. Chair. You know, and this is a good segue 400 additional employees. Are we for real that we will need for JFL North? I continue to say that to agency heads that come before us, we have to be realistic in our responses and our requests. 400 additional employees to open JFL North. Remember with the surge, we couldn't get the RTI to open over at the National Guard because we didn't have personnel. Everybody in the same boat. Where in the world are we going to get 400 people? And I could almost guarantee, colleagues, that if we were to ask all the agency heads, from the time they had budget here and came in here with all the fancy talks about how many vacancies they had, to how much employees they have hired since then to now, we will get the same response or zero. Again, I'm asking for everyone to be realistic with the responses and the requests before the body. 400 employees, I don't see where we're going to get them from. Thank you, Mr. Chair, and I hope that we don't have to wait for even 100 employees to be hired before we open JFL North.
Thank you very much, Senator Gittins. CEO Cook, in respect to the CMS commissioning of JFL North, have we begun that administrative process to at least complete the paperwork and made the initial request?
Thank you, Senator, for the question. Doug Cook, Chief Executive Officer for JFL. I am going to, yes, we have begun that process, but I would ask that Daryl Smalls, who is involved with that process, speak directly to that. Daryl.
Thank you, CEO Cook. Senator, that process, I think I spoke on it earlier, that we have our internal process that's going to wrap up at the end of this month, January 31st, after which we have a solicitation also out with a firm for a project management firm to assist us in that endeavor. All of that is going to take place simultaneously, so I anticipate that process beginning no later than April. As we once we onboard that either firm or individuals to facilitate us during that process. But it has actually already begun internally as far as identifying all of the issues that we know that will be needed to, address any CMS concerns.
Very well. Is it your testimony that you'll be utilizing an independent firm outside of the consultants that we already have for the purpose of the CMS commissioning process?
The commissioning contract that we currently have, as I recall, is primarily for equipment and systems. We're looking at someone who is code compliant, who understands a lot of the CMS environment of care standards that are going to be required. We know that this facility is an interim facility, and that is actually one of the challenges we have with CMS. CMS doesn't usually certify interim or temporary facilities. They always do a permanent facility. So that is one of the major reasons for having this CMS review to go over these challenges.
Very well, thank you. Senator Carla-Joseph, you're recognized for your 7 minutes.
To everyone, pleasant good afternoon to the testifiers. I really want to also welcome Mr. Cook to the U.S. Virgin Islands. I hope and trust and as well as pray that your stay here is well the worth, and that we will see positive income and positive things happening on the big sister island of St. Croix. So my questions are going to be joint questions for both hospitals, and I wanted to first begin my line of questioning relative to some of the billing issues. I know they mentioned for Louis that there was a 31% collection rate in 2021, but I want to get to straight out bottom line numbers. How much money do we have owed to the hospital at Juan Louis? Bottom line, straight numbers.
I'm sorry, Senator. Can you please repeat the question? How much money to what?
How much money to what? is Juan Louis owed in your account receivables? Outstanding receivables. Outstanding receivables. What is the figure? I don't want any percentages. I just need the bottom line number. Please, and thank you kindly.
Sure, give me 1 minute to get it, 1 minute to get it, please.
While you collect that information. In fact, furthermore, if you could send that information through the chair so we don't waste too much time, I would greatly appreciate it, but we'll come back and hear it. Also send it through the chair, but I'll wait for that information. I do have some follow-up questions. I have a whole plethora of questions here. Tell me regarding, I understand you have some borders in both Island District. And so I want to be really clear on understanding the process of what we're doing with the borders. And those would be the persons who, for whatever reason, you are unable to discharge from the hospitals. What is your process if you can't discharge them? Or is it because they need physical rehabilitation care that is not available here? What are the issues besides them on being unable to go to a family member, or because we don't have home 24-hour hospice care outside of that block? Can anyone answer that question for me?
Senator, if you will, I'd like to start. Chris Finch, Board Chair. The borders are essentially people who at the hospital. We have a very shortage of long-term care within the territory, which is really the issue. From time to time, borders have been placed in Puerto Rico and other places. Really, the solution to this would be to identify the funding through Human Services, for Human Services to be able to place them, and then to follow that with, they would have to go to court to get guardianship of people and then have the case management capacity to follow them. I would estimate if we have 16 borders, an average of $75,000 per border per year for placement. So that would be 1.2 million plus whatever the case management needs were.
Thank you. And you're saying it's $7,000 per border per year? That's what you're representing. Thank you kindly for that number. Now, going on, you were going to say something else?
5,000.
How much did you say? The number again, I did not hear you clearly from this end.
75,000. Some would cost 5,000 a month on average, and some would cost 9,000, depending on what their needs are. So I'm saying the 75,000. That's really a back of an envelope projection, but that's I think that's a good starting place.
Month or annually?
Yeah, that's an annual figure. Senator.
Okay. All right. Thank you. The other issue I want to really drill down on is, let's look at, on average, how many persons are seen in your ER in a 24-hour period? I know, on average, I know that there's a lot of fluctuation in that number based on the season, but how many persons are we seeing in our ER on average? Do you have any data on that? Schneider Regional, let's start with you.
Yes, Senator. Thank you for the question. We typically see, Tina Comis-Young for Schneider Regional. We typically see between 60 and sometimes up to 80 patients in our ER in a 24-hour period.
JFL.
Thank you, Senator. This is Doug, CEO of JFL. We typically see between 40 and 50 patients per day through our emergency.
I hear you clearly, Mr. Cook, because it's coming in a bit choppy. Can you please be so kind to repeat that number?
Yes, so sorry. We see at JFL between 40 and 50 patients through our emergency room.
Thank you kindly. Now, I wanted to just, and this, I'm going somewhere with this, because if we are seeing this number of persons
1 minute.
in the ER on an average basis, 24 hours, how are the hospitals working towards preventative care as well as primary care? Because we don't want people to come to the hospital all the time sick. We want to make sure that we have people who are healthy. What are the hospitals doing to prevent and working with people so that they're not coming to the hospital sick relative to the preventative care?
Thank you, Senator. Doug Cook, CEO, GFL. Currently, we do not have primary care physicians, but I do agree with you that we need to partner with any and all agencies and providers on the island and the community to make sure that we are focused on health and wellness and keeping people healthy and out of our hospital and out of our emergency room. That needs to be a primary goal.
Okay, thank you kindly. Now, Jeff Schneider, your response.
Time.
Yes, Senator. Tina Cummins-Young for Schneider Regional. So we do partner and work closely and are thankful for the efforts of the Department of Health on preventative health activities. And we agree that those healthy initiatives and keeping folks healthy and less sick and out of our emergency departments is a very important objective. And we want to continue to do our part to contribute to the population health initiatives that Department of Health leads in the territory, and continue to partner with the primary care physicians that exist in the territory to ensure that there's management of the patients earlier in the care stream. Thank you. Thank you.
Well, thank you. I barely made out what you said. I'm so sorry because you have on the mask. I barely understood. I'll review the tape, not to waste any time. Mr. Chairman, I believe my time was called, but I would like to get the information I asked earlier regarding the outstanding payments owed. Is that available now?
Hi, good
Mr. Chairman?
Hi, yes, good afternoon. Chanel Moorhead, acting CFO. We have 19.1 million in accounts receivables.
19.1 million. Okay, and what was the amount in 2020? Because this is at the end of 2021, is it not? That's as of to date?
That's as of today.
As of to date. 19. And now let's go to regional. How much do we have?
Good afternoon. Tina Cummins-Young for Schneider Regional. Last year, we collected net about $48 million. In FY21, we collected $48 million of patient revenues from our inpatient and outpatient services. We will pass through the chair accurate current statement of our outstanding accounts receivable immediately following this hearing. Thank you, Senator.
So you don't have that number available, acting CEO, you don't have the number available now where you owe to, where you have accounts receivable to date? Is that what you're representing?
We don't have our accounts receivable number available right now. We have what we collected in the past fiscal year available now, which was the $48 million, Senator. Tina Cummins-Young for Schneider.
Thank you kindly. Mr. Chairman, my time has been called. I do have some more questions.
Well, there'll be a second round, Senator, so you'll have an additional opportunity.
Oh, you're so kind. Thank you so much. I'll be here. Thank you so kindly, Mr. Chairman.
Thank you. The chair will recognize Senator Saru. You recognize for your 7 minutes at this time.
Thank you. Thank you, Mr. Chair. Good afternoon to all. I'm looking at page 6 of 20 of Schneider Regional Hospital as far as 183 of 149 nurses, 7 of you required 21, 7 of 15, 11 of 17. And I keep hearing the same story over and over for both hospitals and recruitment. And the writer was on the wall a long time. And you gave the data throughout your testimony with all due respect of this percentage from this source says that nurses are leaving for more lucrative jobs, and then you cite GRS or something else. And that's the same story for teachers, for law enforcement. The fact of the matter is, I might get some blows for this, but I belong to the microwave generation, and we simply don't want to work. We want to get rich tomorrow, and we have these get-rich-quick schemes to just, we believe that when we come out of college, we should just, bam, be making six figures. So the truth of the matter really is that it's the sign of the times and the way that we think our thought process. And I could go on a whole tangent about it because I asked my volleyball players recently, who would you like to be like? And they told me Jada. I said, who is Jada? A lady on Instagram who is Lil Baby Mama. I said, who is Lil Baby? A rapper. And I said, what did this lady do? I can't tell you up to now. But this is just the way that we have evolved in our thinking. It is troublesome. So really and truly, we leave it to go do, we just want to sell t-shirt, have a jam hair, and we just want quick money. So I done on my soapbox, right? But moving on. Interim CEO Commission, the MAP expansion on both hospitals. There was an expansion in MAP. What was your increase in revenue with the MAP expansion?
So, Tina Comisión for Schneider Regional. Thank you for your question, Senator Saru. The expansion of the MAP, both in terms of the percentage share that we receive now and in terms of the presumptive eligibility, made a significant difference for the hospitals in terms of our ability to collect, where otherwise persons were uninsured.
Give me a number.
We were able to register patients when they...
Can you give me a dollar figure if you
I'm
don't
sorry,
mind?
Senator?
Can you give me a dollar figure if you don't mind, attorney, on what that looks like?
Our finance manager doesn't have that number on her right now, but I'd be happy to submit through the chair the difference in the collections as a result of the expansion of the program and the change in the percentage.
This is second request the CFO doesn't have, so I'm taking note. JFL, Miss Moorhead, what does your increase look like?
Good afternoon, Senator. I will have to get back to you on that as well. I apologize.
Okay. Going back to Attorney Commission, the cliff is coming up for MAP 2022, correct? Snyder? Okay. Well,
can you please repeat the question? I'm sorry.
The MAP cliff 2022, we're supposed to have that cliff and we're supposed to go back, correct?
Yes, Senator, that was one of the requests a specific request that we made of this body is to assist us in continued efforts to lobby, because the effort that was extended by yourself and other senators previously got us that initial extension, which proved to be very beneficial for the underlying finances of the hospital and the support of the hospital.
Okay, so quickly, what would that shortfall look like if we revert back to the old MAP numbers? Do you know, or you need to tell?
So I think that question is directly in line with the earlier question in terms of what's the difference that we've been able to collect now. So as I get you that number, it would be the same, but I could estimate it would be at least $1 million, probably more, because that program and the expansion of that program has significantly improved the hospital's finances and ability to collect.
Okay. Okay, I got some information. MAP is 89.2 until June 30th, 2022. Okay, thank you. I stand corrected. JFL, do you know what that impact would do to you financially?
Good afternoon, Chanel Moorhead. Yes, it would obviously have a severe impact on our financials. If we were to go back to the 55-45 versus being where we are right now at the 89.2, it would obviously have a real impact. I also want to take a moment to just address the fact that we are paid at a per diem rate for Medicaid, and so that percentage rate is based off of the per diem amount that we get, which I believe for inpatient right now is just $441 per encounter. So I can come back to you and get you the actual figure, but I just wanted to put that on the record.
Okay. Fair enough. Back to Ms. Comisión. Technology upgrade, Meditech expands. Mr. Brandon there, Mr. What's his last name? Richardson.
Mr. Richardson, yes. Yes,
Okay.
Senator. Mr. Richardson is
Well-
not present today. He's on approved leave, but I'm happy to respond to any
No
question about
problem.
Meditech Expense. I'm very familiar with that project.
Okay, good. So the technology upgrade, Meditech Expands. What was the impetus behind the decision for the Meditech Expands in opposed to going to Epic or Cerner?
So we're currently on an earlier version of Meditech. Meditech is actually one of the premier EMRs for a hospital of our size. Epic and
minute.
Cerner are really great systems also, but those tend to accommodate and support larger multi-hospital systems. Meditech is a leader. We're already on board with Meditech, and this upgrade to the Expanse is in line with how the industry is moving and how EMRs are advancing. Senator, thank you for the question.
Okay, so so is your Meditech able to communicate with other hospitals? You know, for those patients who are going off island to get the records easier, better communication for the handoff, team communication. That's what are you comfortable? Does Meditech do that, and are you comfortable with that decision, interim CEO?
Yes, Tina Comis-Young for Schneider. I think that's an excellent question, Senator. Thank you so much for bringing that up. Really, hospitals and facilities are able to communicate with each other typically through a health information exchange or the HIE.
Okay.
I know that's something that the territory is very interested in and is actively working on. There's a division or an office that's been opened under the Office of the Governor with Ms. Michelle Francis, who is working and meeting with our IT teams at both hospitals to see how we can upgrade our EMRs to serve the basis of starting that HIE, as we will be the main entities contributing data to that exchange.
So we
and that will
acknowledge-
allow us to communicate and do exactly what you're asking, Senator. Thank you for that question.
Okay, so we acknowledge that we have a little hole there and we're working to close that gap. Okay, Mr. Chair, please. Okay, Mr. Smiles. Is Mr. Smiles?
Good afternoon, Senator.
Afternoon. Nothing peeves me more than seeing documents of we have all these plans, but no timeline is equal to no accountability. What is the status on the mechanical room for JFL North? We are in 2022 and the date keeps going back. Where are we on the mechanical room?
Senator, we do have dates in there, but I'm happy to provide you some greater detail. Right now, the construction project is underway with a slated construction to be done by July of this year. Prior to that, we've much of our mechanical equipment.
Hold a second. What was the delay? Did we start construction? Did our contractor make an error? What is going on with with this room out at JFL North? The people are saying could deserve something.
Senator, the contract was executed on September 2nd of 2021. Unfortunately, we did not have what was called the environmental clearance, so the contractor could not physically begin the actual construction. However, we did begin the ordering of equipment, the approval of equipment, the whole 9 yards. The environmental clearance, which is necessary by FEMA to be approved, was approved the day before Thanksgiving. Once we received that approval, the contractor was notified, he mobilized to the site and physically began work. I say all that to say, yes, the contract was executed on September 2nd. Work did begin. The administrative work, there's a whole bunch of administrative components that must take place prior to that. The equipment has been ordered, and right now, per that contract was for approximately 248 days, which would have taken us into June. So I am comfortable based on the contract that was executed and the deliverables and where we will be as it relates to that contract.
Okay, I have some more questions on JFL North, but I would follow up in a second round, Mr. Chair. Thank you so much for the time.
Thank you very much. Colleagues, that completes our first round of questions. We'll go my round at this time. We'll take a 3 minutes recess, and when we come back, we'll do a second round of 3 minutes. And then we'll move to Human Services. The Committee of Health, Hospital, and Human Services stands in recess for 3 minutes. We're out of recess, and we're going on a second round. There's still a number of questions to be asked in regards to the hospitals. So we'll do a 3-minute round. Senator Alma Francis Heidegger, you're recognized for your 3 minutes.
Thank you, Mr. Chair. Good afternoon once again to the people of the territory, testifiers, and my colleagues. I want to find out quickly, in regards to dealing with patients that need services that have to go off island for these services. I did listen to the testimony, and it said that there were some improvements in providing additional services. What services do either of the hospitals see that they have a high number of clientele that has to leave the island because the hospital cannot provide those services? And what, if anything, is being planned to do about it?
Thank you, Senator. Doug Cook, CEO of JFL. Again, only being here a short time, I will rely on my colleagues for the answer. But then the short answer is the two major service lines affecting offline transfers for JFL is cardiology and neurology. And specifically regarding cardiology, one of the main issues is not having a functioning cardiac cath lab that has caused an interventional cardiologist, which has caused many of our transfers offsite.
Okay. Schneider? Anyone from Snyder Hospital could respond to that? Okay. Oh, there she is. I think I see. Is she having technical difficulties, Mr. Chair?
Say again, Senator Francis Heidegger. Your
No,
question?
I was asking if there's technical difficulties, if we needed to hold my time.
No, who you pose your question to?
The next, it was one question to both hospitals. One we already answered. We were waiting for Snyder to answer,
right.
but they were having some technical difficulties.
ICEO, Commission.
Senator Heidegger, thank you. We were having technical difficulties and I could not hear your question. Is it possible to please repeat your question for us?
Oh, no problem. What I was asking is, what is, from your perspective, the services that you cannot provide that you have to have people go off island for? And if anything being done about potentially in the future making sure you can provide those services?
Yes, Senator. Tina Cummins-Young for Schneider Regional. Thank you very much for the question. Our top two specialties that we transfer patients out for are cardiology and neurology. We have made big strides in improving our cardiology services that are available here. We have a permanent cardiologist who provides support to all of our teams and our emergency department. And we have a rotating program where interventional cardiologists come in and work through our heart and lung center to do scheduled cases and also to do emergent cases that appear while they are on site using our on-site cath lab. Thank you, Senator.
Thank you for that. And this is also posed to both of the hospitals as well. This question has to do with mental health and dealing with the psych ward. Are there psychiatrists in each of the hospitals to provide these services? And please tell me, what is the status of dealing with people with mental illness that do come into the hospital?
Tina Cummins-Young for Schneider Regional. We do have a behavioral health unit that is staffed with psychiatrists, psychologists, and nurses who specialize in behavioral health nursing. We typically have anywhere between 2 to 5 patients admitted to our unit, and we do a considerable amount of stabilization through our emergency department, where we treat patients who come in and need just that stabilization and support. Thank you, Senator.
Thank you. JFL?
Good afternoon, Senator. Doris Plaskett, Chief Nursing Officer. We do have a psychiatrist on staff, Dr. Sang. Currently, because of our infrastructure challenges, we do not have a dedicated behavioral health unit. Our patients are seen and treated in the emergency room We do have staff that are also trained to care for the behavioral health population. In the JFL North, I will share that there are 4 patient rooms so that when we do move over to the JFL North facility, we will be able to have the services to care for on an inpatient. We will have 4 rooms.
So quick follow-up in regards to that. Is there a situation that since if there's serious need of help for these services at JFL and you can't service them outside of the emergency room, do you have something set up that they could potentially be transferred to Schneider that can house them at the moment? Is there any type of interchanging program such as that?
Yes, so we do work closely with Snyder Regional and other off-island facilities if it's evaluated that the patient needs a longer hospitalization or a more acute hospitalization.
Okay, I think I heard my time was called. I want to thank you for indulging me, Mr. Chair, and thank you so much for the 3 minutes.
Thank you. Thank you very much, Senator Francis Heidegger, for your line of questions. This time we'll go to Senator Gittens. You're recognized for your 3 minutes.
Thank you, Mr. Chair. Let's go back to these Omnicell machines. And I had some messages to my office asking, what are the Omnicell machines? So those are basically the machines where the nurses could go into it and take out different supplies. These Omnicell machines are under the surgical floor in the med-surg, in the ER, and different areas, correct?
Correct.
Okay, so who's responding? I just hear correct.
I'm sorry, Chanel Moorhead, acting CFO.
Okay, is the CMO, CNO, COO there?
All 3 of us are here, sir.
Okay, who's responding, please?
Chanel Moorhead, acting CFO.
Okay, I would like for the CMO, CNO, or COO to respond to me, please.
Good afternoon, Senator. This is the Chief Nursing Officer, Doris Plaskett.
Good afternoon. How are you
And
doing?
your question was in regards to whether or not the supply Omnicell machines on the various nursing units, whether or not they are currently functioning in order for the staff to be able to capture the charges for supplies.
Yes, what areas?
It has been reported that there are some machines that are not working. And we are working closely with the finance department and the material management department in regards to addressing that issue.
Great. Thank you so much for that. We could move on from there now. Most of the services that would generate revenues, specifically at Wang Lui Hospital, are no longer in place, like outpatient pharmacy, the cafeteria, outpatient surgery. How are we making money today? What's the plan to return some of these services to the Governor Juan Francisco Lui Hospital?
Thank you, Senator. Doug Cook, Chief Executive Officer for Wang Lui Hospital. One of our major revenue streams right now is the Department of Surgery. We are performing both emergency and elective surgeries. And specifically, one of our major revenue streams within surgery is the orthopedic surgery department, as well as the vascular surgery areas. What do we need to do? We need to, as soon as possible, get moved into JFL North so that we can continue to provide more services. We are limited in the amount of services we're able to provide because of the hurricane damaged infrastructure that we currently are operating under. We previously testified, we've opened from 1 surgery suite up to 3 surgery suites, but that still leaves 4 surgery suites that are non-operational at Juan Luis Hospital.
Thank you for that response. And with regards to the 400 additional employees needed for JFL North, what are some of the positions that we're talking about that we would need to staff JFL North?
Thank you, Senator Doug Cook, CEO of JFL. The 400 additional positions was a projection that was given to me, and I think that projection was what would it take if JFL North was fully functional and every bed was full. Obviously, when we open the doors later this summer in JFL North, we're not going to move into it with a completely full patient load. Therefore, we will hire the appropriate amount of staff that needed for the incremental growth and expansion of that department. Specifically, I don't have the breakdown of what those positions are. I'm sure that that projection had that, but it's mostly going to be on the side of nursing personnel and technologists to support our patient care areas.
Thank you for that response again. Now, I want to be clear on this because I'm not in any way knocking Dr. Gallabir on this. As a matter of fact, thank you for being the Lone Ranger on this. But I want to know, why does it have to take so many hours for patients to get back scan and x-ray results if only Dr. Gallabir is doing this? What's the status of our VRAD contracts? And they're the radiology company that used to read all the CT scans and x-rays and whatnot. What's the status of that contract?
Thank you, Senator. This is Doug Cook, CEO of JFL. VRAD has decided that as of the end of the year to not renew their contract with us. We have taken steps to make sure that we have a backup service to support Dr. Gallabir and our radiologists after hours and on weekends. At the board meeting this week, we signed an agreement with a group out of St. Thomas Radiology to support our radiologists here for a weekend and 24-hour coverage after hours.
So VRAD decided not to extend the contract beyond the end of last year, is what you're saying?
Yes, that is correct.
Do we owe VRAD any money at this time?
No, we do not, sir.
When was the last time they were paying, and what amount to close off that contract?
I will have to defer to our CFO for that answer.
Thank you.
Good afternoon, sir. Chanel Moorhead, Acting Chief Financial Officer. They're paid every month. The last time we paid them was in December, and that was for the month of November. We do have, once they send us the bill for December, we'll be able to pay them this month and then finalize that contract.
Okay, I'll get with you. I'm not fully clear on what you just stated, but I think time was called. Thank you, Mr. Chair.
Thank you very much, Senator Gittins. Before I go to Senator Carrion, I wanted to ask, I'm not sure if it's the COO or the CNO that will respond to this, but what is, besides the 6 borders, what is creating the inpatient in the emergency room? What is causing that, and what is being done to address that situation? Because of course there's limitations in terms of showers and bathroom and everything when patients are held in the emergency room. What is causing that besides the situation with the borders?
Good afternoon. This is Therese Plaskett, the Chief Nursing Officer. So at JFL, we are limited in our total bed capacity. For the inpatient units, we have 11 beds in the ICU, On the med surgical unit, it's a total of 27 beds, and those are the high occupancy inpatient units. So in the emergency room, when we do have a high influx of patients, we have limited space to be able to really treat when we have a large number of patients that are admitted and waiting to be transferred to the inpatient units. At times, because of the limitation in our bed capacity, we can have quite a number of patients in the ER that are waiting for an inpatient bed. You have to keep in mind that emergency rooms are not constructed for inpatient occupancy. So those rooms do not have bathrooms and showers. And unfortunately, under the current infrastructure of JFL, there are plumbing and restrooms issues. So as the public is already aware, we do have restroom facilities outside. From an inpatient or from the emergency room perspective, whenever we have a patient that is admitted, we do try our best to expedite that admission to the inpatient unit, knowing that knowing the conditions of the emergency room and the fact that there is not restrooms available for those patients that are admitted.
Very well. Snyder, are you facing the same issue with the retention of inpatient in the emergency room?
Tina Cummins-Young for Schneider Regional. Yes, Senator, we do face delays in being able to admit patients up to our inpatient units because at times the inpatient units are full due to having either a high census, which is sometimes complicated by our inability to discharge our border patients.
Very well. Senator Carrion, you're recognized for your 3 minutes.
Thank you, Mr. Chair. Let's talk about patient advocate department. CEO, Mr. Cook, how many patient advocates do we currently have at JFL?
Thank you, Senator, for the question. Doug Cook, JFL North. I'm sorry, JFL. We currently have 2 patient advocates.
2 patient advocates. Are they on shift? Do you have a patient advocate available during the night shift?
We do not have a patient advocate on the night shift. They are during normal day operating hours. We do have a phone number that they can call during those hours, or the after hours solution is if a patient or a family member has a concern, is to contact our on-site hospital supervisor.
To contact who, I'm sorry? I didn't get what you said.
I'm sorry. Yeah, we do not have a patient advocate on the night shift. Our solution for that is that they contact a patient or a family member can contact the on-site nursing supervisor.
A nursing supervisor. Very well. Do any of your patient advocates speak Spanish?
I'm being told that neither of our patient advocates speak Spanish, but we do have a translation service available.
Okay. What is that translation service? So if someone doesn't speak English, what's the process?
The translation service is called Language Link, and that is a telephonic service. Yes. So there is basically, we get the translation service on the line for and somebody with the patient, and they communicate via the telephone back and forth, so that translation can take place in real time.
And how many complaints have you received for 2021 after the patient through the patient advocate office? And I would like to know what percentage of those complaints have been addressed, maybe with a favorable outcome.
Thank you, Senator. From what I understand, we don't have the figure of the number of complaints that we've received in the last calendar year. We can definitely get that number for you.
Yes, please, through to the chair. I would like to know that that number, and what I think, or if there's anyone also that could also provide if any action has been taken based on any of these complaints that you've received to the patient advocate. Thank you, Mr. Chair.
Thank you very much, Senator Carrion. Next, we'll go to Senator Johnson. You're recognized for your 3 minutes.
Good afternoon. Thank you very much, Mr. Chair. This question goes to both hospitals. Besides the work-related stress and the impact of the pandemic, how was the morale of the staff in each of the hospitals? We could start with Wang Louis, and then we go to St. Thomas and Roy Snyder.
Terry Lynch, Acting Chief of Human Resources for JFL. In addition to the stress of delivering healthcare through the pandemic, it definitely has impacted the morale of the staff. The morale of the staff is one of the challenges that we have right now, low morale, I should say. There's burnout. The staffing levels are affected. People have contracted COVID and have to deal with their loved ones and all of the other stresses that go along with working as a healthcare worker on the front lines through a pandemic. So the morale has been affected.
And so what do we have in place for team building and morale building strategy? What do we have in place?
So we do have some retention activities that we have. We have team building exercises. We have trivia games. As much as we can do virtual retention activities for team building and morale, that's what we've been doing.
Thank you very much. And Roy Snyder?
Tina Cummins-Young for Schneider Regional. I will be honest with you, Senator, our morale is affected just with everything that our staff members are going through, but we have tremendous commitment from our staff who are really dedicated to our patients, really dedicated to our organization, many who have worked with us for many, many years and want to see us succeed. And we can do a lot to improve the morale. Specifically, we need to, I think, recognize the folks who have been here working with us through this pandemic. We need to tangibly, financially reward them. A lot of them are working alongside travelers and other people who are coming into the territory, and they see the differences there. And we need to, compensate our staff who have been committed to us and working with us through this. In terms of team building activities, it's something that we're very conscious of, and we're doing everything we can at the executive level to improve morale. We have healthy activities that we encourage our staff and we participate in ourselves. We have hiking on the weekends. From time to time, we've just signed up for the government league. We're going to field the softball team, Go Hospital. And in addition, when we've had really stressful situations on the unit, we engage our psychologists and our behavioral health unit team to focus inward on our staff to really give them that extra support through those periods. Thank you for the question.
Thank you very much. And on page 9 of your testimony, you talk about a group purchasing organization. What you guys are doing, have you contacted any group or any company that would assist you in reducing those costs for those pharmaceutical needs?
Time.
Tina Cummins-Young for Schneider Regional. Yes, sir. We have participated in a GPO, which we have seen considerable savings with. We are part of a network of hospitals that then get better purchasing due to our participation in that. Recently, we've looked at our GPO and we've seen, where there are other GPOs in the industry that may be able to get us even better pricing. And so we've started to move forward on some of those options because we know our expense reduction is a huge part of improving our overall bottom line. Thank you, Senator, for the question.
Thank you very much. Mr. Chair, can I just ask that same question to Wang Louis?
You may, Senator.
Anyone in Wang Louis could answer about that group purchasing organization, GPO?
Good afternoon, Janelle Moorhead, Acting Chief Financial Officer. Yes, we are in a GPO as well. Our GPO is actually the premier group, and it functions much the same way Attorney Comisiong mentioned, where we're able to use that group to be able to get cheaper prices and procure quicker and faster.
Any idea of the cost of saving thus far with it? Any measurement that you have so far?
I don't have a specific number, but I can say that we use it to be able to assist us with implementation of our Total Joint program and receiving a fixed fee for those supplies for, I believe, the first 2 years. So it was very instrumental in that program.
Thank you very much. Thank you very much, Mr. Chair.
Thank you, Senator Johnson. Next, we'll go to Senator Viale. You recognize for your 3 minutes.
Thank you, Mr. Chair. For both hospitals, there's been a lot of discussion about incentive to healthcare workers, incentives for nurses, etc. Is there an approved plan at both hospitals with the GVI in reference to payment, some type of monetary incentive to nurses and other hospital employees? Snyder first. Do we have an approved plan?
Tina Comisiong for Schneider Regional. Thank you, Senator Viale. We know what we would like to offer. We've made specific proposals to the governor, who has worked with the Commissioner of Finance and the Director of OMB. And now the next step in that, as you know, our nurses are unionized. And so the next step is involving the Office of Collective Bargaining to see how we can those nursing contracts are actually up for renewal. So seeing how we can sit at the table with those various unions and implement these new wages and implement the other bonuses that we described earlier. So the money has been committed, but we don't have specifics that we can announce at this juncture.
Okay, I was not speaking about satisfying a union plan or salary increases. I was speaking about a bonus for those individuals who worked through the pandemic from the inception of the pandemic, not raises. I'm just talking flat out about a bonus for those frontline workers, and also to include, your custodial staff, the staff in the kitchen that's providing meals. Is there, the AFT union, the teachers, the EEA administrators, they receive a bonus. We do it the school lunch workers. We just passed a bill. I'm specifically asking if there's a bonus for those employees who have worked for the last 2 years, frontline workers at both hospitals.
Senator Viale, Tina Comisiong for Schneider Regional. No, there is no specific bonus yet,
okay,
and we desperately are looking forward to that,
Thank you. Wang Louis, do we have discussion as to a bonus for frontline workers, nurses, techs, everybody else that works at the hospital, custodians, everybody that have been there throughout the pandemic? Do we have a signed agreement that the administration have said that this is the amount that those individuals are going to get?
Thank you, Senator. Doug Cook, CEO for JFL. Again, being here for 2 weeks, I haven't been involved in any discussions prior to this, but I am being told at the current time we do not have a plan for an incentive bonus to honor and thank those that have worked for over the last 2 years.
Okay, well, I'm asking that question because both hospitals have submitted various plans, but there is a need for the administration of both hospitals, along with Government House, to sit down and come up with a plan that will be executed immediately. We recently had a discussion about $40 million in premium pay that would go to these frontline workers, along with individuals in the private sector who continue to work through the pandemic. The date for those in government that was given was February, and then the next date for private was March. But as I poll different government entities in the private sector, nobody has any information as to what those payments are going to be. So I'm just encouraging the administration. Our healthcare workers have served this community for the last 2 years. They should have been at the front of the line. At the front of the line. Not 2 years after, we still don't have an agreed on plan as to how we're going to move forward. Mr. CAC, are we trying to recruit an interventional cardiologist, or Ms. Lynch? Are we making any headway in recruiting an interventional cardiologist?
Time.
Yeah, thank you, Senator Doug Cook, CEO for JFL. Yes, we are actively recruiting an interventional cardiologist. At this time, I don't know if we have any specific candidates that we are in contact with, but it is a very high priority for us.
And Mr. Chair, one last question. In reference to our senior population, we have a number of individuals who are older that are being hospitalized in the 80s, some in the 90s. And the no visitation policy takes a toll on those individuals. A lot of them can't feed themselves. They're up there. They're lonely at times for 7, 8 days. Is there any way that a policy can be worked out that one person can be designated for visitation rights, and we work out what is testing for that person on a regular basis before they go up? Because to leave a senior 80-something in the hospital for 6, 7 days is nerve-wracking on the family and also on that elderly person.
Good afternoon. This is Doris Plaskett, the Chief Nursing Officer at Governor Wong F. Louis Hospital. While we do have a no visitation policy during the pandemic, we also have a policy in place that allows for exceptions given extenuating circumstances. For example, just like you just mentioned, if there is a patient that needs some kind of special assistance and support, or if the patient's status is deteriorating, we do allow for a support person or a visitor to visit.
But is that told to the families?
It is communicated by the provider and the nursing staff to the family, yes. And right now we do have individuals that are allowed to visit under this visitation policy.
Snyder?
Tina Cummins-Young for Schneider Regional. We have a no visitation policy currently, but we also have a very similar exemption process that was described by Ms. Plaskett. Additionally, we've instituted a very robust virtual visit program where we provide family members access to FaceTime with their loved ones, and we facilitate that through our nursing staff. And that has proven to be very helpful. We were actually just about to relax our no visitation policy to allow for testing, as you suggested, and then Omicron surged. So as soon as things settle down a little bit, we will go back to that because we understand the hardship of having a family member in the hospital that you can't come and see and touch. And so we want to work, to allow for that as soon as it's safe for the other patients and our staff. Thank you, Senator.
Thank you so much for that answer, and thank both hospitals for the service that you have done to the community. Thank you so much.
That is extremely critical, Senator, and in fact help with the healing process. So we appreciate the hospital extending, again, allowing for family members to, in those exigent cases, to be allowed in the facility. Senator Gittens, you're recognized for a point of information. You're recognized.
Thank you, Mr. Chair. I don't want individuals to be concerned hearing that there were no talks with regards to these incentive pays that were just asked of them. I did submit legislation directing funding for the COVID premium pay for essential employees, and I've since, after Wednesday's meeting or hearing, and we heard the response from the government, I've since reached out to a number of agencies with regards to the first responders and our healthcare workers, and we're working towards that end. Now, I know that they've now reeled in the private sector, which will now probably delay these payments. And after reading something in the news this morning, I want you to know too, let's be clear that the response that we got the other day, that if you make over a certain amount, that you will not qualify for the premium pay, I don't think that the government side had that totally correct, as this would now mean that half the police department, half of our police officers, and maybe all of our RNs and doctors would not even qualify for this. So I will caution the government and have them look at the guidelines from the U.S. Department of Treasury. And if I may just say, Mr. Chair, that under the eligible uses for the premium pay, it simply states, and I quote, that the interim final rule emphasizes the need for recipients, meaning the government, to prioritize premium pay for lower income workers. It goes on to say that the premium pay that would increase a worker's total pay above 150% of greater of the state or country average annual wage simply requires justification, specific justification for how it responds to the needs of these workers. So this does not say if you make above $70,000 that you will not qualify. Thank you, Mr. Chair.
Thank you very much, Senator Gittens. Next, we'll go to Senator Whitaker. You're recognized for your 3 minutes.
Thank you, Chairman, and I want to thank my colleague who just went before. You ended on a good note, as there are concerns that are being heard about the salary maximum, salary cap. I want to dive into naturopathic care because one of the things that I want to find out from both interim and NCO, what are the plans and any efforts? And I want to put out the fact that there has been efforts on the national level where 28 prominent healthcare systems are now connected to naturopathic doctors throughout the country. There are over 6,000 licensed naturopathic doctors that practice in the U.S. and the states and the territory. And so to CEO Koch, in terms of the whole body approach to health, individualized health care, and really addressing clinical nutrition, what efforts are you envisioning engaging in to address that? And as we go through the therapies that are also needed to address our current crisis, COVID.
Yes, thank you, Senator Doug Cook, CEO for JFL. Very good question, and I'm sure we could spend a great deal of time talking through that. Juan Luis Hospital is an acute care hospital and serves those needs for those patients. I believe the question you're asking is how do we work together and partner with all different agencies and healthcare providers within our communities to better work on keeping our patients out of hospitals and keeping them healthier throughout their life, both mentally and physically. It's a great challenge for any organization and for any community to do, but it's a worthwhile effort that we must entail. So again, being here for 2 weeks, I don't have specific plans or ideas around that yet, but please know that it is a tremendous focus of ours and needs to be going forward as we partner with all entities to make that happen.
Senator, you're on mute. You're on mute, Senator.
Oh, can you hear me? Yes, thank you. One of the things, shut my volume up. Also I want to ask the same of interim CEO, Commission, connection with naturopathic providers in the territory.
Tina Commission for Schneider Regional. Similar to the response from CEO Cook, we are interested in partnering with all care providers within the territory to really participate in a spectrum of care and offer those options to our patients. When patients are admitted to our hospital or are treated at our hospital, we do give special attention to their personal preferences and try to honor their personal preferences as much as possible within the recommended standard of care. Thank you for the question, Senator.
Time.
And Chairman, if I will, I just want to ask one last question of Chairman Finch.
You may wrap up. Wrap up, Senator.
Yep. Chairman Finch, so for the board now, the territorial board, what policies are in place in order to address that, because that has been a standing issue. Therapeutic care by way of naturopathy, natural health.
Senator, in my time on the board, we have not addressed that at all, to be honest.
Thank you, and that's what and that's a challenge. So I do challenge us in therapeutic care, healthcare. Like I said, some of the most prominent systems in the country are in fact partnering, addressing the holistic healthcare. Thank you. Thank you, Chairman.
Thank you. Thank you very much, Senator Whitaker. Senator Fred Gregory, you there? We'll skip. I'm sorry. We'll skip Senator Sorrow. We know you have a flight to catch. You recognize for your 3 minutes.
Thank you, Mr. Chair, for the accommodations. I appreciate it. Quickly, Ms. Moorhead, the 8%, was the 8% calculated, or did you give the 8% on the appropriate salary or on the old salary? Were there any employees?
The 8%.
Yeah, were there any employees that were, the 8% was restored based on the incorrect salary?
No, ma'am.
So no one was miscalculated?
We have had a few employees come to us and bring some documents to our attention. If there were any issues, I think there was a few minor issues. We just addressed those calculations and moved on. We do have an issue right now, though, where we do have employees that are telling us that they were working at JFL while JFL was still under Department of Personnel or under the central government, and we're working with Department of Personnel to get the appropriate hours for those persons so that we can give those amounts back to the employees.
So you're working to reconcile those accounts, that area?
Right. JFL has paid out all of the 8% to the employees that it's owed according to our records. Department of Personnel supplied time for those persons that were working at JFL while JFL was under the central government. And there is some discrepancies that we are working with Department of Personnel on to finalize so that we can make those final payments.
Okay. I'll just ask that you go back and scrub those numbers for me. I'm sure the finance chair will jump on this. Mr. Cook, dialysis, page 9 of your testimony, it is a mere 4 sentences. What is the status of dialysis? JFL?
Thank you, Senator Doug Cook. Yes, thank you, Senator Doug Cook, Chief Executive Officer for JFL. The current status of, and again, I apologize if I don't have the full scope here, but the current status of dialysis for our patients is that JFL it was working closely to transition our patients from JFL over to CKC. And from what I'm told, despite our efforts and working with our patients to make those transfers happen, at this current time, none of the patients have successfully made a transfer over to CKC.
So what's the plan?
Well, we think.
What's the plan in the interim? How are we treating those patients?
Thank you. Currently, we continue to provide dialysis services within our modular unit. My next steps after being here is I am setting up meetings to meet with all the dialysis providers. Just number one, to introduce myself, get to know them, and then talk through what our next steps and plans can be. I actually did a radio talk show yesterday where I actually had a call in from one of the patients, tried to answer his questions as well related to the same issue. Look forward to continuing to work with that patient population to make sure that we provide a successful service for the great needs that they have.
Okay, and lastly, Mr. Chair, to both HRs, I am confused. I've searched the internet. Where are you recruiting? Please tell me. You are on no major platforms. So where are you recruiting employees? Ms. Lynch, where are you recruiting? What's your recruitment plan?
Hi, Terry Lynch, Acting Chief HR. We are currently recruiting on Indeed. That is the national major platform. We're also utilizing the local media outlets and our social media outlets.
Snyder?
Ralda Mason, Vice President of Human Resources for Schneider. We're using similar platforms. We're using Indeed. We're also using Career VI. We're using our website. We also have Facebook. We're also posted on nurses.com.
Okay, nationally, how are you broadening your scope? Because even on Indeed, hold on a second, and you can answer when I'm done, because even with JFL, when you look on Indeed, and I did that earlier, you really, not even all of your positions are on Indeed. So I don't understand the full recruitment, but you may respond. Go ahead.
We're also on nurses.com for nurses, and we're specifically targeting some of our allied health periodicals to recruit medical technologists and respiratory therapists.
Okay, thank you for the time, Mr. Chair. We really need to amp up our recruitment efforts in a serious way. Thank you, Mr. Chair.
Very well. Thank you, Senator.
Mr. Chair,
HR
if I may
HR Lynch, had you gotten information in regards to your hires since June 30th to now?
Yes, I do, and I'll be forwarding you that information.
Very well, and if I could get Ms. Mason to also submit that information, I appreciate it. ICO, you recognize, go ahead.
Yes, thank you, sir. Thank you, Senator. I wanted to respond to an earlier question from Senator Serow because we were able to pull some comparative data from an earlier year. So she had inquired, if I'm stating it correctly, about the shift and the difference in revenues that we're collecting due to the changes that were made to the Medicaid program, both the presumptive eligibility enrollment opportunities and the percentage split. So in 2016, we only had about 14% of patients registered in Medicaid. Now we have about 28.5%. And in 2016, we were collecting about 19 million from the Medicaid program. Due to these program changes, we're now collecting about 42 million. And self-pay similarly decreased. So we used to have a higher percentage of self-pay patients, and from them we only collected 23 million. Now that has shifted downward, and we are collecting 12 million. So I just wanted to provide that additional data, as well as for the other senator's question. I think it was Senator Heiliger who asked what is the size of our accounts receivable? It's $7.5 million. Thank you, Senator.
Very well, thank you. And go ahead, Ms. Mason.
Ralda Mason, if I may respond to the question of our hires for the year, we had a total of 64 full-time employees onboarded, and we were filling 42 clinical vacancies and 22 non-clinical vacancies.
Great, thank you. I look forward to a detailed breakdown of that information as well, so I can share with the committee members. And CEO Cook, the dialysis members, at least Angel Rivera, is reaching out and said that he anxiously awaits your contact and look forward to a meeting with you in the very near future. Senator Violet, you're recognized.
Thank you so much, Mr. Chair. I just wanted to add some clarity in reference to Ms. Mohead CFO statement in reference to individuals who are working for the hospital when it was under Department of Health. The 8% was 2011, 2012. So all individuals who were due the 8% was at the point when the hospital was the same structure that it presently is. It wasn't under the Department of Health. Retroactive, that might be a different story. That goes back to the 90s. But in reference to the 8%, it's only those individuals who were working at the hospital as a semi-autonomous entity. Thank you so much.
Very well. At this time, we'll recognize Senator Joseph. Let me get to Senator Joseph, and then we'll allow for a point of inquiry and then close off. Senator Joseph, you're recognized for your 3 minutes.
Thank you so much, Mr. Chairman. Thank you so much for this opportunity to ask some follow-up questions. I would like to revisit a question that I asked the Schneider Regional Hospital Interim CEO, Commission. You mentioned that the daily average ER patients that are seen at Snyder Regional, I just want to qualify the 40 to 50 per day. Does that include Myra Keating Smith in St. John?
This is Tina Cummins-Young for Schneider Regional. Thank you for the question. Our number is sometimes 50 patients on a 12-hour shift. Our averages in a 24-hour period could be between 60 and 80 patients, 80 on a more busy day. Our numbers for St. John are less than that, but I would say another 20 patients. Let me confirm, please, with our Associate Administrator of Nursing, Ms. Toya Sylvester Allen.
Good afternoon, Senator Toya Sylvester Allen, Interim Associate Administrator for Nursing. For the Myra Keating Smith Community Center on St. John, we could average anywhere from 5 to 10 patients per shift, more patients on the day shift rather than the night shift. Thank you.
Thank you kindly. Okay, and then I wanted to just follow up on another question. I believe Schneider Regional, you had mentioned some of your partnerships, and I wanted to go into the partnerships that both you as well as Wang Lui Hospital may have with outside entities, to include other hospitals, other healthcare providers, some type of hospital maybe that is providing some type of mentorship to your staff and the like. Do you have any of those existing partnership, or including some of the services that you've been rendering with the dialysis service, the vascular surgery services at the Wang Lui F Hospital?
Thank you, Senator Joseph. Tina Cummins-Young for Schneider Regional. So we are working to develop partnerships with other health systems to see how we can develop potentially rotations for their staff to come here, and mentorship and specialty training programs for services they may have that we currently don't have, to provide opportunities for our staff to enhance their skills and learn new things. In terms of local programs, we want to continue to develop all of those relationships so that we can continue to encourage and build a pipeline of persons entering who are local, who want to enter our organization.
Mr. Chairman, may I just have the Wang F. Lui respond at your time and wrap up?
Yes, ma'am. You may.
Yes, ma'am. You may. Thank you, Senator, for the question. Doug Cook, CEO of JFL. Again, being brand new here, that is existing partnerships with other entities and hospital is not something that I'm aware of at this time, but I'd be happy to look into that and get back to you as soon as possible.
Thank you. Thank you so much, Mr. Coach. Thank you so much, Mr. Chairman, for the time. I appreciate it.
Thank you, Senator. Joseph, Senator Gittens, you had a point of inquiry? You recognize your point of inquiry?
Thank you, Mr. Chair. I wanted to know from both JFL and RLSH their vaccination rate with their employees, and whether or not we are in jeopardy of any federal funding due to a possible low vaccination rate.
Thank you, Senator Gittens. Tina Cummins-Young for Schneider Regional. At Schneider Regional, we've been able to achieve substantial compliance with our mandatory vaccination policy. We currently have approximately 90% of our staff fully vaccinated, and we continue to work on that number, understanding that there are some religious and medical exemptions that preclude some persons from becoming fully vaccinated. That we are not in jeopardy of losing any federal funding currently based on our percentage compliance. Thank you, sir.
Thank you, RLSH. Thank you, JFL.
Thank you, Senator, for the question. Doug Cook, CEO of JFL. Our current vaccination rates are 78% of our employees are fully vaccinated, meaning that they've had the 2 shots. 84% of our staff have had at least one of the shots. And again, we continue to advocate to our employees as well as the entire community to get vaccinated, including the booster vaccine.
Thank you. Thank you, Mr. Chair.
Thank you, Senator Gittens. Point of inquiry, Senator Carrion.
Thank you, Mr. Chair. To Chairman Mr. Finch and CEO Mr. Cook, is it the position of JFL to not have a dialysis center or dialysis unit within JFL?
Senator, again, we could talk for an hour on this because we've spent a lot of time on this. It's been the position of JFL that dialysis services are going to be better off at this point managed outside. But saying that, we're under full recognition that we will always have to be the safety for the community should anything happen to any private providers. But we did put out an RFP with the intention of contracting out our outpatient dialysis services because we were under threat of CMS to decertify us, and we would have either had to build a new building or contract out, and we decided to contract out.
So I guess your answer is yes?
My answer is yes in the short term, but we're also keeping in mind that should anything happen, people will come back to the hospitals, and the hospitals always have to have in mind how we're going to handle this. It's actually a very, very complex situation.
Definitely is, and we know we experience.
Use the mic. Use the mic.
I want to say it definitely is a very complex situation, and we know that we have a large number in our community that depend on the services, the dialysis services. So I would ask and implore that the board reconsider this decision, and we're here to try to support you moving forward in that reconsideration, given the need that we have within our territory.
Yeah, thank you, Senator. And I just want to emphasize that from the perspective of the hospital and the board, what we want is a dialysis service, the dialysis patients to be well served and be happy with the care that they're getting.
Thank you. Thank you, Senator Carrion. At this time, I'll allow for the hospital. It's been a long day, and I appreciate all of your responses and certainly your patience. I'll allow for each of the CEO and the chair to just do a 2-minute wrap-up, and then we'll release you. I'm also going to reschedule DHS, but we'll address that issue right after we hear from the closing statements from the CEOs. We'll start with you, CEO Cook.
Thank you, Chairman. Doug Cook, CEO of JFL. I would like to conclude by just thanking you yourself, sir, as well as all the committee members and senators and the listening and viewing public. I truly appreciate all the feedback and input that you into the performance of JFL and the broader discussion of healthcare services here in St. Croix. As described in our testimony today, there are many challenges and opportunities to improve our services, and I take them all very seriously. These challenges should not overshadow the heroic efforts of our doctors, nurses, technologists, and all the support staff, given so much of themselves to serve our communities during this ongoing pandemic. We continue to thank this legislative body for their ongoing support, as well as thanking Governor Albert Bryan Jr., Commissioner Encarnacion, and the Department of Health for their ongoing support and partnership. We need continued support and ongoing dialogue to address our issues, including our infrastructure, the upgrade to the Meditech Expanse program, and the retention and attraction of staff.
Thank you very much.
We continue to be.
Go ahead. I'm sorry. I thought you were finished.
I'm sorry. We are continue to be committed to our workforce. And in closing, again, I would just like to thank everybody for their time and efforts here today. I wish all of you a happy and safe Martin Luther King Day. Thank you.
Thank you very much, CEO Cook. Next, we'll go to ICO Commission, you're recognized for closing.
Good afternoon. For the record, Tina Cummins-Young, Interim Chief Executive Officer for Schneider Regional. Mr. Chair, Honorable Senator Novell Francis, and Honorable Senators, we thank you so much for the hearing today, for your interest and your concern and your commitment to our organization. SRMC remains committed to providing top-notch healthcare services to our patients, and we thank every member of the SRMC team for the important part that they each play in us providing that care. You all are amazing and you are true heroes, and we thank you. We also want to commit to working together as a team to improving SRMC and making our hospital the best it can be in every way we can. We know we have to work on getting the staff, the permanent staff that we need, and that's one of our focuses for the upcoming year. To the listening public, we again want to urge you to get your COVID-19 vaccinations and boosters, and that's how you, the public, can help us. And we want to thank you for trusting us with your care. We know that the technical ability of our clinical and medical staff is excellent, second to none, and we look forward to continuing to support them by investing in staff, our infrastructure, our facilities infrastructure, and our technology infrastructure. We hope that healthcare will continue to be a priority for this committee and for the legislature generally, and we really thank you for the opportunity to present here today. Thanks so much.
Thank you very much, ICO Commission. And next we'll hear from the chairman of the board, Christopher Finch.
Thank you, Senator. Thank you for the hearing today. I wake up almost every morning thinking about the hospitals, but that's part of my role. But I am so thankful every day for the people who get up and get ready and go to work in the hospitals in the 24-hour basis. We're so fortunate that they're taking care of us and such extraordinarily challenging times. When we talk to people in the States, frequent question is, what is your payer mix, your patient payer mix? And when we tell people that we're 2/3 Medicare and Medicaid, a lot of no pay or charity care, and only about 1/4 of private insurance, everybody always reacts about how difficult that is to manage under those circumstances, because Medicare and Medicaid, quite frankly, pay a fraction of what the private insurances do for the same services. So there's a lot of challenge. Right now, CMS has both hospitals as one-star hospital. We want to be 5-star hospitals, and we have a lot of work to do. We have, at the same time of all the challenges, we have these opportunities. We have this opportunity to build world-class facilities. We have the opportunity to upgrade our technology. We need to find the rest of the $11 million we need it, but it is a real opportunity to do it. We need to get our salaries up to market competitive rates, and we appreciate the support of this body to doing so. So again, thank you for today. We were able to bring up a lot of issues. Senators have given us a lot to think about and follow up on. So thank you.
Thank you. Thank you very much, Chairman Finch, and thank you to the board. And really, thank you to all of our healthcare professionals. We wake up as well here at the legislature, certainly with the healthcare or hospitals on our mind. We're often challenged by the situation and confronted every single day as we go out into the community. And healthcare is a topic of conversation, whether we want to believe it or not. We have an aging community. I heard some comment about grain. Well, we do have a growing community and an aging community here, and a lot of individuals rely on our healthcare system, and we need them to be available and ready to serve this community. So we're all in this together, and our effort here today was to really be able to bring an overview and reassure our community of the work that's being done to optimize our healthcare facilities and get them to the level that they need to be, again, to be able to respond to the needs of our community. So, we're all in this together as a legislative body. We have the responsibility of providing the necessary financial resources to assist you in doing your job. We're so appreciative of you know, our healthcare professional. You know, we hear of all of this success story. We don't always just hear about failures, but we hear about success stories, and we certainly appreciate those as well. And we know that during this COVID pandemic, we weren't able to close the doors. You know, certainly we continue to keep our doors open, and we appreciate those individuals that continue to put their lives on the front line for this community. Unfortunately, other individuals have moved on for one reason or the next, and you know, we're working with the administration, we're working with all of the necessary federal partners to make sure that we're providing adequate funding for our facilities, as well as to recruit and retain the best of our healthcare professional. So rest assured that today's hearing is just a means, again, for us to get to some level of understanding and really to chart that process by which we go forward into our community and be able to, again, improve healthcare and the healthcare system. I thought that there was some critical comments that have been put on record today that, you know, regardless of what, we rely on our hospitals at least to provide some stability before we could be sent off island, those individuals that could do that. And in other instances, other individuals cannot be sent off island. So again, we are very appreciative to what is being done in our community. We had the Department of Human Services scheduled for the third block, and you know, we know that there is some 84 programs within the Department of Human Services, and we wouldn't be able to do that any justice. There's a lot of concern with the Head Start program, the vaccination, and other things that's going on there. I see you, Commissioner, and we certainly going to reschedule you. We'll try to get you in early next week, so I'm not going to adjourn, but rather to take a recess so that we could be able to, again, hear from you and your programs and what's going on in human services. And there's a lot of concerns in our community about some of those programs as well, our seniors and others, and we want to hear from you. I know that you had a 25-page testimony ready to go, and we certainly appreciate that, and we want to do justice to the Department of Human Services, so we'll reschedule that for sometime next week. The Committee of Health, Hospital, and Human Services, again, I want to thank all of my colleagues for today. I want to thank central staff and you know, all that was involved in today's proceedings. Certainly my colleagues, my staff, and Madam Clerk, thank you very much for your work today, and we look forward to the recess and certainly next week hearing from the Department of Human Services. The Committee of Health, Hospital, and Human Services of January 14, 2022 is hereby stand in recess.